Hi guys, good afternoon. Can you all see me and hear me fine? Okay, all right. So, welcome to the class. This is the second part of our BTR revision. Hi guys, good afternoon. The first part is now available on the app. All right, so it's available for the subscribers of BTR on the app. So you can access it from there. The PDF is also available in the app. Okay. Uh, about tomorrow's class, just a heads up. So tomorrow's class will again be from 3 to 8 p.m., where we'll be covering the remaining subjects. We already did short subjects. Today we'll be doing 5, and tomorrow is the main integrated chunk that we're going to do, right? So path, pharma, physio, medicine, along with pediatrics also have included with the systems, and then surgery. Okay, so those 6 subjects tomorrow. All right. Thank you so much for all your kind wishes. Mm, any other doubts that you have, we will be taking them about your approach to BTR and everything later on, because we have too much to do today. All right. So any other doubts I'll address tomorrow. But one thing I do want to talk about is the new pattern that INICT has announced, again, last minute, like always, so that we never be comfortable going into an exam and very confident and comfortable. That is not INICT style, na ki itna comfortable kaise. So they have made it into 4 parts now of 45 minutes each. So this is a very conscious attempt of going literally towards USMLE, not just in the pattern of the questions, but also now in terms of how the style is going to be. So this is clearly going towards next and figuring out the logistics of whether it works or not. And unfortunately or fortunately, you are the first batch of guinea pigs for that. But don't worry. That's the only thing I can tell you. You are not the only person jiske liye change ho raha. It's changing for the entire cohort. So that kind of neutralizes the entire thing. So don't just panic. That is the only thing you can do to screw it up, is you panic and you are like, oh, again, delusion of persecution. The world INICT is after me only, so that I don't get ranked. So we don't want that to happen, right? We have already made that promise in last class that no matter what happens, we will not panic. And somehow it started before the exam only. We had to utilize that promise that you made for me, isn't it? So don't panic. We will strategize everything, but not right now. Right now is the time not to worry about how to give the exam, but it's to prepare for the exam. Okay. So what I will tell you is, just don't worry. I will tell you what needs to be done exactly when the time is right, which is going to be on 4th, one day before the exam, when it will stay fresh with you on how to approach the paper, how to approach the 4 modules. Everything we will discuss. Till that time, till 4th, I will request all of you to just focus on studying. Put your head down, ignore every other noise around you, and just focus on studying. No, don't do anything. Don't indulge in discussions on Telegram. Don't indulge in social media. Just put your head down and make the best use of these 2 days that you now have. After that, on 4th, you can just relax a bit, and we'll talk about how to approach the exam. Okay, I hope you trust me with that, and you stop worrying about this new pattern. Okay, so now let's start off. We're starting off with obs gynae, and after that we will go to micro. All 5 subjects today are very high yield for INICT. These are 5 subjects which are actually rank deciders. They're gonna have the highest weightage, and today's class, in my opinion, is even more important than the third class. Tomorrow's classes are the important. Ye 5 subjects hai, so you have to master these. So I've tried my best to include as much as possible, and all of the PYQs which have been covered from 2017. All right, group link I will not be sharing today. All right, obviously I will not be sharing it in a live class, otherwise there's no point of having a private group, right, if I share it in a free class. So I will share it when we have the class tomorrow in app. All right, so I will share it when the class happens on Zoom tomorrow. Okay, chalo shuru kare. Everything about tomorrow I will inform you guys when the time is right today. Now, no more discussion, only academics, only obs gynae for the next half an hour. So today also we have to divide our class into 5 blocks, not 4, but 5 blocks, around 45 minutes each we have to give to each of them, and we'll finish right in time in around 4 hours. Okay, so we also have to do the same time strategy. So let's do it live. Let's see what you're going to do on Sunday today, है ना? तो every block, what my target is going to be, I am going to aim to finish in 35 to 40 minutes. All right, itna aim rakhungi to jaake 45 tak khatam hoga, isn't it? So that is what I'm going to do, and I'm going to give 5 minutes to buffer time, which you are going to keep for reviewing. So jo aapko 5 minutes buffer time karna hai, wo 5 minutes mein aise hi gossip ke liye, aapke queries ke liye I will keep. Okay. So that is how we will also practice today's class, and we'll in turn practice for INICT. Okay, so I think that will be win-win for all of us. Okay, chalo, let's begin then. So first is obs gynae. First, like the last class, we will be doing a bit of theory, and then we'll have a few previous year questions which are standalone. Okay, chalo, keep answering simultaneously, and I will get your answers 1 minute later, and I will see them, and hopefully today the lag is lesser, and I will be a bit more slower probably in the beginning, and then I'll pick up my speed. Okay, chalo. So this is about the semen analysis, where they do ask you a lot of questions. Somehow 2020 is still considered to be recent update of sperm analysis. So they have made changes just because it was like 10 साल हो गए हैं, कुछ बदल लेते हैं, let's just change something. So you'll see that in the changes, they've just made minuscule changes. So need not worry too much about it कि ये कैसे मेमोराइज करना है, इतना seriously mat lena. One question that I have from you is, which is the most important criteria in a semen analysis? That happens to be morphology. So you see how morphology hasn't been changed at all. It still remains that 4% has to be normal morphology sperms. So this is the most important. That is first question, and answer is in the question itself. MO is MO. Most important is morphology. Second question will be that they have already asked us, how much should be normal motility. So अगर ऑप्शन में 30 है, 30 is better. अगर ऑप्शन में 30 नहीं है, go for 32, right? That's why I've given you both of the things. The moment below which, I'm not movement, but the sperm concentration below which we start the workup is going to be 15. Now it can be taken as 16, but very minute difference. So below 15 ml sperm count, which is oligospermia, we are going to start the workup of the patient. And how the workup of the patient is done is, next step, if you have an abnormal semen analysis, what is the next step? That is my question to you. The next step is going to be a hormone analysis. So what you do is FSH LH levels, and you check testosterone. Depending on that, you will know. So agar FSH LH is low and testosterone is low, means it is from the top, hypogonadotrophic hypogonadism. If FSH LH is high and testosterone is low, that is the most common cause. It means the problem is in the testicular cause. And what is most important, if both turn out to be normal, it means that the problem is in obstruction. There is obstruction, anatomical problem hai. And there, one thing you rule out is cystic fibrosis, because cystic fibrosis has bilateral absence of vas difference. Okay, so this was not planned, इसलिए मैंने जगह नहीं छोड़ी थी, but I just wanted to give you that extra information because all of these are repeat questions. So याद रखो, testicular failure most common cause of male infertility. Specific, अगर दोनों normal आ रहा है, obstruction है, cystic fibrosis will have bilateral vas deferens absence. Okay, perfect. अब जाते हैं into emergency contraceptives. So the next side that you see here are all of the things which are used as emergency contraceptives. Very, very important question. The one that we use most commonly, first question, most common kya use karoge? It is LNG. Always they give in the option 1 dose or 2 dose. So only single tablet, 1.5 mg stat. How much is a normal combined OCP having? A normal combined OCP is 0.15 mg LNG and 0.03 mg ethinyl estradiol. This is 10 times higher. Okay, ye yaad rakho. So this is 1.5 mg single. I think वापस हो गया है शायद। नहीं, अच्छा बच्चे लिख रहे हैं बैक। आई थिंक इट्स ओके। आ गया है, आ गया है वापस। ठीक है, ओके स्टार्ट करेंगे, ठीक है।
ठीक है, ओके ओके।
Okay. Can you guys see me and hear me now? Shall we start? Okay, चलो, all right. So we were talking about emergency contraceptive. It's okay, है ना, छोटे छोटे issues होते रहेंगे, ऐसे बड़ी बड़ी क्लास में छोटे छोटे technical issues होते हैं. We need not worry, all is well. All right, चलो, let's start. So emergency contraceptives. What did we discuss? The first thing, the most commonly used is morning after pill, which is LNG 1.5 mg stat within 72 hours. अब अगर पूछते हैं कोई, my question to you is, which is the one which is the most effective contraceptive, emergency contraceptive, the most effective emergency contraceptive? Then your answer should be copper T. Don't answer intrauterine device. IUD, can I use LNG? No, I can't use. Can I use Mirena? Basically, LNG IUD? No, you can't use LNG IUD. So remember, you have to mark copper T specifically. So copper T overall is most effective. And how long can I use it? I can use it till 5 days of unprotected intercourse. But agar question hai, which is the most effective hormonal contraceptive? So the most effective hormonal contraceptive is going to be Ella1. What is Ella1? It is ulipristal acetate. Dose bhi yaad rakho, it's a new drug, potential question. Ulipristal 30 mg, most effective hormonal contraceptive. Again, I can use it till 5 days. So both of them are 5 days, very, very important. And the mechanism is, this is a SPRM. You all know SERM. This is a selective progesterone receptor modulator. Okay, so that is what you need to know. Apart from that, sawal aata hai, all of the following can be used for unprotected intercourse except, or emergency contraceptive except. So I can also use OCP. Not recommended because we have to use very high regimen, too many drugs, known as USP regimen. Not recommended, but can be used. Can I use mifepristone, which is nothing but RU486? Yes, you can use, not recommended. So option में आपके दिया होगा, can misoprostol be used? Answer is no. So emergency contraceptive, याद रखो, what can't be used. So we can't use misoprostol, we can't use danazol, tamoxifen, any random drug they throw at you, we can't use. So the only thing we can use are the 5 things that are there in front of you. Okay, understood everyone? Now let's switch gears to the types of pelvis. Recently, lots of questions have come from this. So these are the 4 shapes of a pelvis. The gynecoid pelvis is the most common type. A round pelvis, a wide pelvis, suitable for delivery, most common in females. Then they ask you which is the least common. The least common is platyploid. Look at the shape. You will be asked to recognize it also. So when it is oval, all right, so when it is oval in shape, it is the least common, that is platyploid. Then heart, है ना, किसका दिल बहुत बड़ा होता है? मेल्स का दिल बहुत बड़ा होता है ना? So we will remember android heart shaped pelvis. Okay, is this suitable for delivery? No, males were not meant to deliver. That's why this is something which is not going to be suitable for delivery, and this is the one which has maximum chances of deep transverse arrest. So this is where they will describe a case scenario where a baby has gone, or a mother has gone into prolonged second stage of labor, or first stage of labor is not progressing. What you see is the presence of molding. They will describe that molding is plus, and that is when they'll ask you what is the next step. Should I wait that baby will deliver? No, once there is molding which is present, now you have to take the patient up for LSCS. It is a sign that there is deep transverse arrest. Okay, so that is most common in android. And then anthropoid is very commonly asked. इसमें कैसे याद रखेंगे? नाम में है AP, the only one which has AP in its name. So this is the one where the AP diameter is more than transverse diameter. Okay, and this is the one where usually the delivery will proceed vaginally, but the only difference is यहाँ पे कैसे डिलीवर करेगा. अगर ऑक्सीपिटो पोस्टीरियर पोजीशन है, the delivery will happen by phase 2 pubis. So here what you have to do is normal vaginal delivery को proceed करने दो. They will give you a scenario where they'll ask OP position है. How will they ask you occipito posterior position? They will ask you that there is infra umbilical flattening. So just combining 2 questions and asking you right now, infra-umbilical flattening, that's a sign that there is occipito posterior. They'll ask you kya karoge. So you just have to wait. The labor will take longer, but it will progress. Molding hua, तो LSCS. But otherwise, no danger sign in baby. Just let it happen. Baby will turn and baby will deliver. In an anthropoid pelvis, baby will deliver by phase 2 pubis. So these are all the potential questions, and इसमें से 4-5 repeat questions है from these 4 pelvis 4 questions. So very high yield. Okay. Going on to GDM guidelines. So we follow at AIMS these IAD PSG guidelines. So these are what AIMS has asked you. These are what we follow in India. Okay. In India, what we do is we have to take 3 blood vessels. 3 blood vessels. We have to take 3 blood sample values. Okay. So we have to take 92, which is your fasting one. So remember 3 set of numbers for me. 92, 180, 153. अभी के अभी साइड में एक पीस ऑफ पेपर पे ये 3 नंबर टॉप पे लिखो, मेक अ बॉक्स. यू विल सी दिस बिफोर यू आर गोइंग एग्जाम हॉल. एग्जाम हॉल से जाने से पहले ये 3 नंबर देख के जाना है. 92, 180, 153. 2 after giving the oral glucose tolerance test. In DIPSI, which is the WHO guideline, this is for low resource settings where we don't have so much resources to take so many samples. So there they say that okay, यही कर लो. 75 ग्राम 140. All right, so this is like mega BTR revision है ना. अभी तक पढ़ाई नहीं करी, ठीक है, इतना ही कर लो अभी, है ना. एक सैंपल ले लो, चल जाएगा काम. So 75 ग्राम just one after 2 hours 140. When do we do this screening for gestational diabetes mellitus? We do it from 24 to 28 weeks. If somebody has GDM, does the baby have higher risk of congenital anomalies? No. Congenital anomalies का कोई रिस्क नहीं है. मैक्रोजोमिया का, हाइपोग्लाइसीमिया का, शोल्डर डिस्टोशिया का रिस्क है. All of those are risks, but congenital anomalies only if you have overt diabetes, not gestational diabetes, because by this time baby is completely formed. Got it? Going on to steroids. What we give steroids for is for increasing the lung maturity. Okay, so they ask you these doses. What is a better regimen? What is drug of choice? Is beta मिथासोन. So this is the best because नाम से ही आपका सब हो जाएगा. इसमें आपको याद क्या रखना है that the total amount of steroid that you give has to become 24. Ultimately मुझे 24 लाना है. ठीक है, बाकी नाम से हो जाएगा. How many doses? बीटा, 2 डोज है ना. So name itself will tell you कि total अगर 24 लाना है and 2 doses I have to give, means I'm going to give 12 mg 2 doses, and again 24 is the total. I have to complete it over 24 hours. So 12 mg into 2, 12 hours apart. Everything from the name. But government of India likes cheaper drugs, obviously. So what are we giving in our government of India? We are giving dexamethasone. So again, नाम सब बता रहा है. Name itself is telling everything. Dexa माने 6. So 6 mg. Total has to be 24. So how many doses? 4. Again, I have to finish it within 24 hours. So how many hours apart? 12 hours apart. We give 4 doses. Okay. So here the name itself will tell you everything. Okay. Now going on to eclampsia regimen. So very, very important for INICT. What are we talking about? We are talking about the drug of choice for eclampsia, which is magnesium sulfate. The regimen that you are giving is the Pritchard regimen. Pritchard regimen defines the loading dose of MgSO4. What is the loading dose? We have to give a total of 14 gram. कैसे? 10 gram is given IM. How? 2 doses. So we are going to give 2 intramuscular injections of 5 gram each, 50% weight by volume. 1 mgSO4 vial is 50%. All right, 50% concentration. So I am going to give these 2 injections, which is going to be 10 gram. बच गया 4 gram. Total I have to give 14. So बच गया 4 gram. I have to give as IV infusion. How do I mix this? So this is to be given as 20% concentration. So now understand this. 1 vial of MgSO4 is 2 ml. ओके, एक वायल 2 ml की है जिसमें 1 mg MgSO4 is there. So how many vials am I taking? I am taking 4 vials because not mg gram है ना, gram, 1 gram. So I need 4 grams of this. So what that happens to be is 8 ml solution. Do you agree? 8 ml solution is the 4 gram of MgSO4. So to make it 20%, I have to make it 20 ml. So what I add is 12 ml of normal saline. So I make this test tube with 12 ml normal saline and I mix these 8 ml of MgSO4. That is what is going to give me 20%. So this is how we prepare the loading dose. If you didn't understand, you will read this one more time. Okay, don't ask me to repeat. Agar pehle padha hai ya mujhse padha hai, you will understand this. So we have 50% and you have 20%. All right, so this is the Pritchard regimen. My question to you, somebody has renal failure. MgSO4 is a drug that is released by excreted by the kidneys. Should I change the MgSO4 concentration? Should I give the same Pritchard regimen? Answer is yes, you should not change. So here we go back to pharma now. So what is loading dose dependent upon? Loading dose is going to be dependent on the volume of distribution. I need to see what concentration you give into volume of distribution. Whereas the maintenance dose is something which is going to be concentration into clearance. So I need to take into account clearance, which is renal function in the maintenance dose. I need not change the loading dose. So simultaneously, मैंने आपको general pharma पढ़ा दिया है. I will not repeat it. Okay. So this is about loading and maintenance dose. So now coming to the therapeutic index. No, narrow therapeutic index है. कितने में रहना चाहिए? 4 to 7 milli equivalents per liter में रहना चाहिए. How do I monitor for toxicity? I can't keep measuring. How do I monitor? Clinically, I have to see DTR, I have to see urine output, I have to see respiratory rate. Why do I see urine output? For this, so that we know कि clearance तो ठीक से हो रहा है. There is no renal failure in this person or not. All right. So this is why I check all of this. And if there is toxicity, what is the drug of choice for toxicity of MgSO4? Heart को बचाओ. If magnesium increases, we will have cardiac arrest. Remember yesterday, not yesterday, day before yesterday, short subject class, I taught you कि अगर patient को MgSO4 मिल रहा है, stop it. All right, and start calcium gluconate. So this is one of the causes of cardiac arrest in a female. कितनी देर में we were doing peripartum cesarean section? If there is no return of spontaneous circulation, within how much time were we doing peripartum LSCS? Peripartum LSCS? Using English only. Whenever I use Hindi, the next sentence will be the translation of it in English. All right. So you need not worry. Immediately I will translate. 5 minutes. Very good. And should it be LSCS? No, it can be classical. All right. So this is our first slide. Very important. Physiological changes. Never do it as multiple facts. Do it like this table I am showing you. So what all increases is this table. What all decreases is this table. What all remains constant is this table. तो ये कैसे याद रहेगा अब? So now what you need to do is just focus on the things I am highlighting for you and understand it. In pregnancy, overall blood volume increases and hence the hemoglobin hematocrit decreases. First point. All clotting factors increase. Remember the exceptions. Factor 11, 13 decrease. Repeat question. जहां जहां question mark है, you can't forget that. Wherever there is question mark written, you can't forget that. Fibrinogen increases, and that's why physiologically in pregnancy the ESR increases. All right. Then you have increase in steroid hormone binding globulin and thyroid binding globulin. Very, very important. The question comes, if there is a hypothyroid female who's taking levothyroxine and becomes pregnant now, should I increase her dose of levothyroxine or keep it constant? The answer is you have to increase her levothyroxine dose, because now her thyroid binding globulin is increased. So more hormone that you are giving as drug becomes bound. So patient ke liye we will need more. The patient will need more. So this is what you need to remember. Cardiac output, heart rate, stroke volume increases. What I am going to remember is PVR, BP reduces. All right. The BP, blood pressure in a pregnant female, is lower. Then you will remember ICTV movie. In pregnancy, you have a lot of time. No, you are on mat leave. You have a lot of time. So even I, when I was pregnant, I used to see so many movies. All of the series which are pending, I finished in pregnancy. So what will increase? ICTV टीवी पे मूवीज. So ICTV पे movies will increase in pregnancy and FRC reduces because everything else is remaining constant. So मुझे I don't have to see this only. What I have to remember, ICTV movie increases and FRC reduces. All right, so that entire category is taken care of because overall blood volume is high, RBF GFR is high, and that's why creatinine will be low, urea will be low. Vaginal pH reduces because in pregnancy you have higher lactobacilli, more lactobacilli in pregnancy. Okay, so this is how we have finished this very high yield yet very volatile chunk. AIMS loves CA cervix. Period. You can't forget CA cervix. And again, don't just go into staging. Staging they have rarely asked. What they have asked is everything from screening. So pap smear. What you have to remember in pap smear is that what you have to remember in pap smear, first of all, when do you do? What is the starting time? So we are going to do a pap smear from 21 year onwards till 65 years. We can stop at 65 years provided 10 year ka negative data I have. If we have 10 year negative data, we can stop at 65 years. Should I change it for people who are vaccinated? No, you can't change it. Abhi tak we don't have data, so you don't change it. It remains the same. But for people, so how frequently do you do? We do it 3 yearly. We do the screening 3 yearly if just a pap. But if you are doing co-testing of pap smear with HPV, we can do it at 5 yearly frequency. And if you are an immunocompromised patient, HIV patient, then we have to do 1 yearly, which is annually. Okay, so these are the guidelines. They have gone on to ask you steps of pap smear. So what are the steps of pap smear that you need to remember? That I am going to first, whatever smear you have made, all right? So you know the instruments, we have a wooden spatula, Ayer spatula, and then there is a brush. That is the conventional pap smear. So this I am talking about conventional pap smear. But nowadays, what do we use? Nowadays, we use a liquid-based cytology, which is much better because that has only one brush. That has a cervix brush, which will take care of inside as well as outside, endocervix and ectocervix. And this is much more sensitive because I just cut the brush and I put it. I don't have to make this slide. All right, so we know our slide skills are so great, right? So आधे cells तो वैसे ही निकल जाते in making slide by me or you. So that's why they said you don't make slide. आप put brush put कर लो, बाकी path वाले हम खुद देख लेंगे. That is what path decided. So liquid based cytology is much more sensitive. So this is most sensitive where I have a cervix broom. ठीक है. Now let's go to conventional because this is where they expect you as interns in government hospitals to make pap smear. So this is what they have asked कि इसके उन्होंने steps पूछे हैं. So whatever is highlighted you need to know. So first we fix it in 95% alcohol. Repeat question. First stain H, Harris hematoxylin. Second, OG6. And third is EA36 or EA50. You know what? They have asked you all of the following are pap smear tests except, and the options, if you hear, you will go crazy. I was like, seriously, AIMS? So they have asked you all of the following are stains. One was Harris hematoxylin, orange G, EA15, and this was given as eosin G. So it is not eosin G, it is eosin Y. Just imagine if this was not highlighted and you had to see this list. Anybody who has read, आपको लगता है ना पढ़ाई से रैंक आता है. Anybody who has read, do you think they would have focused on the why amidst all of this chaos here in this list? No. So that is why I am here for you. So remember eosin Y. Why God? Why such questions? है ना? So this is how you will remember why God. So this is eosin Y. So this is about the steps of pap smear. If you just remember why, I think you are sorted, and just remember 95% alcohol. Okay. Then we go to HPV strains and vaccine. So low risk HPV strains कौन से है? 6 and 11. All right, they cause what? Condyloma lata or acuminata? Condyloma acuminata are your warts. Where do we see condyloma lata? Condyloma lata is what is seen in syphilis, है ना? Syphilis में plain top, lata meaning flat topped lesions. Okay, so this is 6-11. What are high risk strains? 16, 18, 31, 33. यहाँ तक सबको आता है 16, 18, 31, 33. Then we have three numbers 45, 52, 58. You want mnemonic? I will give you mnemonic. So what you have to see is everything has 5, 5, 5. So you cancel 5. Then you see 4, you see 2, and you see 8. So 4 twos are 8. Okay, so this is how we will remember all strains. Okay, nice mnemonic, no? 4 twos are 8. So this is about the strains of HPV. Ma'am, why do we need to remember all strains? You need to remember all strains because the total here becomes 9, and those are the strains which are there in Gardasil nonavalent vaccine. Okay, agar quadrivalent hai, so obviously it's going to be 6, 1, 16, 18. But if they ask you nonavalent, we need to be aware of all of these strains. All right, then let's just talk about WHO SAGE protocol. What do WHO SAGE says? That the target group, best group जहाँ पे हम कर सकते हैं वो है 9 to 14 years, but you can also give 14 to 20 years. Their regimen remains the same, where you can give 1 or 2 doses. 1 dose is also gonna suffice. But anybody who is more than 21 years, they are gonna require 2 doses, right? Anybody more than 21 years is going to require 2 doses. So this is what is the WHO SAGE guidelines that they had asked. Now we go to the molecules within HPV. So very important question. E6 is going to inhibit P53. So 6 is P, E7 is RB. So see how sharp it is. That's why it's causing cancers. No, उसने governor, police दोनों को ही block कर दिया genome के. That's why we are going to have cancers from HPV. And what is L1? They ask you, L1 is the target of vaccine. Okay, this is, we don't have E6, E7 protein in the vaccine. L1 is the target of the vaccine. Okay, so this is about pap smear, CA cervix. Next very important point. Is the pace fine, guys? Are you guys able to catch up? I can see from the comment that you are more than catching up, which is very, very heartening, and I'm very happy to see. But it's fine, right? I can go on at this speed. I know I'm jumping like crazy flight of ideas, but this is what we need to do in the last moment. Okay, so chalo shuru karte hain. Episiotomy. So they have asked you this image, episiotomy scissor. How do I know it's episiotomy scissor? Because it is angled. So we are going to do a mediolateral episiotomy. We don't do a median episiotomy. We do a mediolateral episiotomy, because if I do a median episiotomy, what will happen is you can injure the rectum and the anal canal, right? Because this is vagina, this is rectum. So you don't want to cut the vagina accidentally. That's why we are going out of our way and doing a 60-degree mediolateral oblique episiotomy. Even though that means that I have to do a iatrogenic second-degree tear. I'm not just cutting mucosa, I'm also cutting muscle. So even though I have to now cut muscle, but that is a risk we are willing to take, because I will have lesser risk of rectal injury. Okay, so this is a iatrogenic second-degree perineal tear. What are the muscles we are cutting? So don't remember this. Remember what we are not cutting, because they will ask you all except questions. So ischiocavernosus or coccygeus we are not cutting, obturator we are not cutting. Okay, so this is what you have to remember, that this is something that I am not cutting. Yeah, 45 to 60 degree angled, that's correct. Okay, 45 to 60 degree, that's fine. Okay, let me just write. So now what is the timing? When do you do an episiotomy? The 30 minutes ko bhul jao, no? We had break of technology in between. So our time started from 3:15 only. Okay. So episiotomy timing, remember, will be from crowning. Okay. So it will be at the time of crowning is when you do an episiotomy. Routine episiotomy is not recommended by WHO. That's also a repeat question. So don't do it in every patient, even though we tend to do it in practice, but routine is not recommended. The order, what is the order of cutting? So go in order of alphabetical order. So mucosa, muscle, and skin. Okay, so MUC, then MUS, and then S. So go in alphabetical order. So this is the question about episiotomy. Then you have some questions from uterus supports. So we have 3 muscular supports, which is the pelvic diaphragm, urogenital diaphragm, perineal body, very, very basic. Levator ani is your pelvic diaphragm. Then we have true ligamentous support. So this is where question comes. So remember the name, all except सवाल आता है. We have uterosacral, pubocervical, and Macken rod. Macken rod is also known as cardinal ligament, है ना? तो अगर पूछते most important, Macken rod or cardinal ligament. This is what we need to remember here. Fine. Now we have our score. All right. So this bishop score, you need to remember both original OG bishop and modified. Obviously, this is useful for NEET PG. What do you think think while you're listening, what is the feeling you are getting? Did it feel like I have to ask whether it's useful for NEET PG? Okay, so we have the bishop score and modified. They can give you either, so you have to remember both. Okay, so 0, 1, 2, 3. This is something that you just put a hashtag CC on, take a screenshot right now and revise it before your exam. Okay, so ये exam से पहले एक बार देख लेना. They can give you, they have in fact given you the values and asked you to calculate. I am giving you both versions. What's written here is original bishop. In modified, what we did was we changed the effacement with the length. So if length is more than 4 centimeter, that is equivalent to 0 to 30, or basically the score. So this is 3 to 4 centimeter, this is 1 to 2 centimeter, and this is less than 1 centimeter. So if you take a screenshot, you will have both of the values. And you know, it's not very difficult to remember because this is, you know, cross. So this is less than 1, this is less than 1. This is 1 to 2, this is 1 to 2. This is 3 to 4, this is 3 to 4, this is more than 4, this is more than 4. So this way you will not forget this. So इसमें mnemonic create ही मत करो. Don't create the mnemonic. Mnemonic I can create with the parameters, but that's not enough. You need to remember score also, right? So you have to understand this. Station is with respect to the ischial spine. So -3, -2, -1 and +1, +2 is what you have to remember. Consistency and position. ये थोड़ा अलग-अलग दिया है. In some places they give these two together, some they give separate, but I think this is the one that you can follow for your answers. Okay, so this is about this. Don't create mnemonic for parameters ना, because question आएगा calculate. तो वहां पे बैठ जाओगे पुलिस ऑफिसर बोल के, then what will happen? How will you calculate score? So you have to remember this entire table. Okay. All right, so now this is about the bishop score. Now we have all of the Leopold maneuvers. In Leopold maneuvers, you need to know the 4 ones. This is the question that has come in the exam. Okay, so first thing you notice is, are we facing patient's face or patient's feet? 3 mein we are facing the patient's face. So here, this is the first one where I'm checking the fundus, right? So you are doing a fundal grip to see यहाँ पे buttocks है या head है. Then what you have here is the lateral grip or the umbilical grip. So lateral or umbilical grip is what we are checking to again see where is back of the baby. Then what you are checking here, this is where one hand. So animals में hand की जगह paw होता है, right? They have one hand, they have one paw. So this is what you will remember. This is paw. One hand, paw, lick, grip. All right, so this is pollic grip, where you are trying to see whether there is what is the presenting part. Is it the head or is it the buttocks, right? So that is pollic grip. And then now see, we have come from the other side. That is what you have to notice. Okay, because you will get confused between second and third. There's a lot of controversy between third and fourth, but actually the real confuser is third and second and fourth, isn't it? So here I'm coming and facing patient's feet. This becomes the pelvic grip. All right, so first second mein mat jao, it's given differently in different resources. So just remember what I am saying. Pollic is third, pelvic is fourth, where what am I checking? I am checking fetal attitude. What is fetal attitude? Negative fetus है या positive fetus है? No, we are checking whether it is flexed, deflexed or extended, है ना? Not कि fetus कैसा निकलेगा attitude में. Fine. So this is about the 4 types of grips that we have. Now, amenorrhea. Now what I'm going to teach you is the most important thing, where all of you, if you would have not attended this class, would probably have gotten it wrong. So please focus now for the next 5 minutes. These are the most difficult questions and I loves to ask them. And if you just do these with me, I can assure you, you will get every question correct. Okay. So approach to amenorrhea. Any patient who comes to you with approach to amenorrhea, here I have clubbed primary, secondary amenorrhea both. Okay. So what is the first step that you're going to do is you are going to do UPT. All right. So urine pregnancy test is the first step, unless they mention that the pain is cyclical pain abdomen. In this case, it is not amenorrhea. It is cryptomenorrhea. It is bleeding, but it's just not coming out. So what do? You do an external exam. External exam pe agar bluish hue, if you see this membrane, it means what do you have? You have an imperforate hymen. How do you manage? Then and there, you can give an outpatient procedure. You can do a cruciate incision and it is going to be treated. Okay. But if the external exam is normal, we will have to do MRI, because then the obstruction is higher up. The diagnosis is going to be transverse vaginal septum, right? So the obstruction is higher up. So this is not even amenorrhea. This is cryptomenorrhea, right? So now let's go back to our amenorrhea approach. So when you have no crypto but real amenorrhea, I did the UPT. UPT is negative, means female is not pregnant. Now you have to focus on your approach to uterus present or absent. You either do an examination or do an ultrasound. This would usually be given in the question. Ultrasound was done, uterus is absent. Very, very important. You see a female who looks more female than females, meaning she's a very tall female. She is having beautiful skin. She is having breast present. No hair, very smooth skin, absent hair. You do her testosterone, turns out she's male. You do her karyotype, turns out she's male. So, who is this female who looks more female than females but is a male? That is how you remember. That is androgen insensitivity syndrome or testicular feminization syndrome. It's the most common cause of मेल सूडो हर्माफ्रोडाइट और फीमेल सूडो हर्माफ्रोडाइट. यही कंफ्यूज हो जाते हैं बच्चे. इट इज what is the karyotype is how you define it. So most common cause of male pseudo hermaphrodite, AIS. If karyotype is XX, she is a female, everything is normal, means it's an anatomical issue, that's why she is not bleeding. This is Mullerian agenesis. That is why uterus is absent. Got it? So this is how you're going to approach uterus absent. Either it's AIS or Mullerian agenesis. Now let's go to uterus present. Very, very important. Our next step is going to be to see FSH. If FSH is increased, meaning pituitary giving too much signal, but my ovary is not responding. So now you have to see you are dealing with secondary amenorrhea or primary amenorrhea. If it is secondary amenorrhea, my diagnosis is going to be premature ovarian failure. And what is the best test for this? For ovarian reserve. Ovarian reserve ka best test hai AMH. All right. So this is about AMH. So secondary का हो गया. If it is primary amenorrhea, FSH is increased, means what you are dealing with is gonadal dysgenesis. Gonads ही नहीं बने. Gonads are not formed well. So gonadal dysgenesis, I have to do a karyotyping. Remember, no gonads, no secondary sexual characters. Here I have 3 diagnoses depending on the karyotype. If it is 45XO, that's Turner syndrome. You know the phenotype: short stature, cubitus valgus, wide carrying angle, shield chest, can have horseshoe kidney, can have coactation of aorta. This is your Turner's. If it is 46XY, this is very, very important for the exam: Swyer syndrome. Second cause of male pseudo hermaphrodite, because it's a male technically, but she has uterus also. She is not just a female, she has uterus also. Remember, this is exact opposite of AIS. If you remember AIS, you will remember Swyer. Kaise? AIS, no uterus. Swyer does have uterus. That person had lots of secondary sexual characters and a breast present tha. Even though hair was not there, breast was present. Here, no secondary sexual characters. That's what you remember. Fine. And finally, if it is 46XX, this is true gonadal dysgenesis, because it is XX and you have gonadal dysgenesis. So this is very, very important. I can't simplify this more than this. This I have narrowed. This table is a result of lot of hard work, okay, that you are seeing now in 2 minutes. It's something that has taken me lots of effort to bring it to this level. All right, just remember this. I can assure you, you will get your questions correct. Okay, now serum FSH decreased, matlab pituitary only not working. So this can be seen in anorexia. This can be seen in Kalman syndrome if they give you anosmia. Anosmia is a must which will be given to you. If they tell you postpartum hemorrhage ke baad there is amenorrhea, failure to lactate, what is it? It is Sheehan's syndrome. So this is how we have to approach this. And if it is normal, just like testis and infertility, what did we see? Pathway mein gadbad. Now when both are normal, it means obstruction. Here also it means that pathway is gadbad, something problem in genitals. So what I do is I give a progesterone challenge test. Progesterone challenge test is basically you give 7 days of progesterone and then you stop it. If the female has withdrawal bleed, what does it mean? It means that the bleeding was not happening because ovulation was not there. So this is anovulation. इसके बाद also patient is not bleeding. If patient does not bleed after this, We do an estrogen plus progesterone challenge test. I give 21 days estrogen, 7 days progesterone. Still, if somebody does not bleed, diagnosis becomes Asherman. Asherman usually presents with hypomenorrhea, but rarely it can have amenorrhea also. Here, endocrine is not a problem, anatomy is problem. You have adhesions, there'll be history of curettage, dilatation and curettage. There are sinike adhesions, that's why patient is not bleeding. Okay, so this is amenorrhea. Just master this slide and you will not be going wrong. Now let's go to the other big problem. When you have male pseudo hermaphrodite, now two things you already know. Just consider four differentials. All four are XY, but phenotypically they are females. So in the first one, now you will tell me answer. No uterus, external genitalia female, breast present, no hair, testosterone high. You already know it. It is AIS. Here, just one thing you can remember. If not purely female external genitalia, they are giving you that there is some sort of clitoromegaly, micro penis is seen, then you have to go for partial AIS. This is the toughest question that they can ask you. Partial AIS, everything else remains the same. All right. Now look at this. XY, now there are streaked testes which are present. So gonadal dysgenesis. What I have is uterus present, opposite of AIS. No breast, no axillary pubic hair, testosterone is low. So now I'm talking about Swyer syndrome. So far so good. You understood? Opposite kar do. No breast here, breast here. No uterus fallopian tube here, uterus fallopian tube present here. Okay, so this is Swyer. Last one, very very typical, when they describe this कि puberty पे आके ना patient is having virilization. In AIS, female was model, supermodel skin. Here opposite, she is having virilization. She is having acne, axillary pubic hair, clitoromegaly. This, when you get this presentation, we are talking about 5 alpha reductase deficiency. It means that the testosterone is not getting converted to dihydrotestosterone, and that is why the female has external genitalia of a female, because this testosterone could not act. I have explained you the concept of all of this in class, right? That I can't do right now. Right now, just remember the flow charts and you are going to be sorted. Okay. CH, what is the CH which can lead to male pseudo hermaphrodite? So here what you want to remember, that when will there be XY karyotype and then you have female? This is when the testosterone is actually lower, right? So what do you remember? You have to remember our table. Mineralocorticoid, testosterone, 21, 11, 17. What do? We make everything one as high. So the only one where testosterone is lower, isn't it? Am I going to have CAH in a male pseudo hermaphrodite position, right? So this is going to be 17 alpha hydroxylase. The more common one is going to be what? The more common one is going to be where testosterone is high. So that is female pseudo hermaphrodite. So 21 and 11 will have a female pseudo hermaphrodite. And how can I distinguish? With M. So in 21, which is most common, I am going to have shock in a female, in a child at birth. In 11, we are going to have high BP at birth. So this is how you are going to distinguish. One of you is asking me, where will I have palpable inguinal masses, which makes me thoda sad, because anywhere where you have testes, right? How are these testes going to present? These are going to present as bilateral inguinal masses. Okay, so in Swyer's, you have streaked testes. So there it will not present. Jahan pe bhi testes hai, which is AIS and 5 alpha reductase, it's going to present as bilateral inguinal masses. Whenever they describe this, they're just saying ki testes hai. ठीक है? And finally, aromatase deficiency will present in a female pseudo hermaphrodite manner. And how you have to remember this is going to be, they will tell you mother को भी, baby तो ambiguous है, mother also has virilization symptoms during pregnancy. After delivery, mother is fine, but during pregnancy, third trimester, mother says that, oh, I am having male-like hair growth, I am having, my voice is turning into a low-pitch voice. So when they describe this mother, that is aromatase deficiency. Okay, so this is how you approach pseudo hermaphrodite. So what I have for you are 4 pre-YQs from 2017 from these two topics, so that we can be done and we can be confident. Let's see. 20-year-old with primary amenorrhea. Now you all will answer, okay? Primary amenorrhea. Breasts were found to be poorly developed. All right. Vagina was present. Ultrasound revealed a normal uterus. Gonads were not there. 46XY. Can this be AIS? This can't be AIS. What is this? This is Swyer's syndrome. Did you all understand this? XY hai, can't be Turner. Can't be true. Can't be AIS because breasts were not there. So Swyer syndrome. Next, 15-year-old girl with primary amenorrhea, indications of virilization. प्यूबर्टी पे विरिलाइजेशन, मेरा आंसर तो पहले ही लाइन में है, बट लेट्स रीड. शी हैज अनडेवलप्ड ब्रेस्ट, pubic hair consistent with pre-pubertal stage, closed off vagina during her, despite her female sex, testosterone are male range, XY. What is the diagnosis? It is 5 alpha reductase deficiency. AIS will be a female more than female. Here I am going to have not virilization. So this is how we will know 5 alpha reductase. Are you now finding these questions a bit more tolerable? Yeah. 18-year-old girl with primary amenorrhea, no breast development, and raised FSH. Raised FSH with primary amenorrhea means gonadal dysgenesis. Karyotype में दोनों मिल गया. Mosaic. So Turner mosaic with poorly visualized gonads. This is an indication for gonadectomy. Whenever you have a Turner mosaic, these have very high risk of developing gonadoblastoma. So these gonads need to be removed. Otherwise, if it's a pure Turner with streak ovaries, you can let them be. No need to remove. But if it is mosaic, I need to remove these streak ovary or streak gonads, and because there is higher risk of gonadoblastoma. Next question, 17-year-old girl with primary amenorrhea. She has normal breast, normal pubic hair. So I am going on the lines of uterus not palpable. I'm going on the lines of MRKH. Is this all making sense to you now? If I can make you understand this in 10 minutes, then I will be very happy with what I have achieved, okay? Because this is probably the toughest topic, and if you see any gynae lecture, it will be like 4-5 hours at least to spend, to understand these two topics. If you can just remember this, I think it's good enough before the exams. All right. Okay, let's start off now with CA vulva. CA vulva is again one thing which ironically only AIMS will ask. NEET जब देखेगा कि अरे बच्चे CA वल्वा पढ़ रहे हैं एग्जाम से 3 दिन पहले, NEET will laugh at us. क्या कर रहे हो तुम लोग? But INICET is going to pick up that topic and it has asked you 2 questions. It's the only staging which I'm going to teach you, because I think if they want to ask staging related question, it will be from this. Okay, fine. So first point here is that CA vulva is gonna follow a very fixed lymph nodal spread. It has a very sentinel lymph node pattern where the first draining lymph node is superficial inguinal node. The second, from superficial inguinal, it goes to deep inguinal. If still left untreated, then it will go to external iliac. Okay, but there are and it's usually ipsilateral. अगर इस साइड का कैंसर है, इस साइड के नोड्स जाएंगे. So it follows a very fixed draining pattern. But then not from CA cervix. You can still see CA cervix staging, but that's very unlikely to be asked. All right, that's why I'm not bringing it up here. अभी इस पे ध्यान दो. If it is in the clitoris or the anterior or posterior fourchette, meaning if it comes in the midline, then it can be bilateral lymph nodes. That is what we have to understand. Now let's talk about the management and the staging. So here they've asked you a management based question. That's why I am testing. So 1A, 1B, 2. So what you have to remember is that if it's less than 2 centimeters, and most important is stromal invasion less than 1 mm, this is the only place where I can just do a wide local excision. No lymph node excision is required. Why? Because stromal invasion is the direct predictor of lymph node. And remember, lymph node is the most important prognostic factor in CA vulva. ये most important है, and it relates directly to stromal invasion. So if no stromal invasion which is less than 1 mm, don't explore lymph nodes. हो ही नहीं सकते. Fine. Then 1B is when you have more than 2 centimeter and stromal invasion is also there. So now I need to explore the ipsilateral lymph nodes. Did you understand this? Unless the tumor is in the midline, where I will have to do bilateral. That you have already understood. Apart from this, if any of the lower 1/3, which is urethra, vagina, and anal canal, get involved, I have to do modified radical vulvectomy with bilateral lymph node. अब और बढ़ गया है. And easiest, अभी मुझे याद ही नहीं रखना, anything except this, don't see. I have to give just neoadjuvant chemo RT followed by surgery. Okay, nobody will ask you this. So what do I need to remember कि भाई stromal invasion है या नहीं, 2 centimeter से बड़ा है या नहीं. If it is more than 2 centimeter, lymph nodes need to be explored. 1/3, 1/3, 1/3 going. I have to do radical vulvectomy. With this, now look at this question that they have tested. 76-year-old female presented with non-healing ulcer for 6 months, I don't care, measuring 2 into 3 centimeter. The moment I see more than 2 centimeter, can I not explore the lymph nodes even though they were not palpable? I have to explore the lymph nodes. But is there any indication of doing bilateral lymph node resection? Tell me, is there any indication of now exploring bilateral? ना ही ये midline में है, ना ही मुझे उन्होंने कुछ और दिया है that 1/3 of the structures are going. So I have to do a radical vulvectomy with unilateral lymph node dissection. This is from FIGO. There is no controversy. This is from FIGO only, right? That I'm showing. ये मैंने नहीं लिखा, ये FIGO ने दिया है. All right. So this is radical vulvectomy with unilateral lymph node resection. Another question which has come here, sentinel lymph node biopsy in which of the following? So this is CA vulva. All right, we do a sentinel lymph node. No other malignancy we are going to do sentinel lymph node in gynae obs. Why are you all typing no? No for? Just no. No means no. We don't want to study. Is that a no for that? Okay. Anyways, by the time I get your answers, I'll move on to the next one and then we'll see what was no. So woman presence, are you saying no, that is not answer? Because I've seen this answer given wrongly in a few places. तो उसके लिए तो no नहीं बोल रहे. Just specify no when you are saying no or something. A woman proceeds with presents with prolonged labor in emergency. अरे फिर से BTR group link. No BTR group link. Okay, even breast, but breast is not gynae, no? Breast is surgery. Yeah, everything female is not gynae. Okay, so yeah, out of the option, CA vulva and then CA breast also. ठीक है, इसके लिए नो बोल रहे थे क्या? No, ma'am, it was used in CA breast also. Anyways, so what do you do for a pregnant female? They have risk of supine hypotension syndrome. So supine hypotension syndrome, we have to keep the female always in left lateral decubitus. Okay. Yes, size is 2/3. You are correct, Ankita. What are you trying to say with that statement? So left lateral decubitus. What you have to remember is that it is under, okay, fine. No for bilateral, fine. Let's go back. So this is going to be left lateral decubitus. You can do that by placing a wedge under right hip, which way your IVC compression will get reduced in a pregnant female, which is the risk of supine hypotension syndrome. Okay, chalo. I'm not getting spamming comments only today. I've already blocked people who usually spam. तो मुझे आ ही नहीं रही. You can also try. Just block तो आपको दिखेंगे ही नहीं वो comments. That's very convenient actually. UTI in a pregnant lady in her second trimester is best defined as, so pregnant lady, we don't change our criteria and all. It remains the same. 10⁵ coliform in voided urine sample. Okay. Labia majora, it is midline. How? How is labia majora midline? Labia majora तो पूरा है ना. It is not midline unless they mention midline, anterior, posterior, fourchette, or they mention clitoris. Labia majora पूरा कैसे midline हो सकता है? Can't be midline, no. Where else how will they बिचारा write as a lateral tumor? They will say labia majora only. Okay, so don't assume that entire labia majora is medial. Okay, fine. Next question. All of the following statements about AMH are true except. Why I'm spending more time on that staging question is because it is indeed given wrongly in a few places. Okay, इसीलिए मैं इतना justify कर रही हूँ उसको कि मेरा answer ये क्यों है, बाकी it's your श्रद्धा what you want to believe. All of the following statements about AMH are true except. So can it only be done on day 2 of menstrual cycle? Answer is no, it can be done on any day. The good thing about AMH is you need not do it on any specific day, can be done on any day. It is indeed something released from granulosa cell. It correlates with the pregnancy rate and it decreases sensitivity to FSH. So others are true statement. Very important, MGSO4 we have done. Question miss hua? Okay, sorry. Which of the following is not true about lupus nephritis in pregnancy? So what you have to remember, what are these drugs? Aspirin, methotrexate, cyclophosphamide, steroids, azathioprine. Is methotrexate, even if you don't know others, is methotrexate safe in pregnancy? Absolutely not. Category X drug. The moment I see, I will know that this is the wrong answer. So immunosuppression can be continued. We can plan the pregnancy in lupus nephritis if it has been questioned for 6 months, and steroids are safe in pregnancy. All right. Going on to MGSO4, this we already know the Pritchard regimen. It causes uterine relaxation, but is dose dependent, is a true statement. It was also used as a tocolytic agent. It should be continued for 24 hours after last attack, is indeed a true statement. It has an inhibitory effect on cerebral cortex, thereby preventing seizures, is true. But does it lower the BP? No, it has absolutely no role in lowering BP. In renal failure, loading can be given, but maintenance should be adjusted. I've already told you the concept behind this. All right. So this is what you need to remember. Then next one, very important from surgery and gynae point of view. So 1.5% glycine was being used, and now we have a deficit, meaning that you are giving a lot of this fluid here. So what is going to happen? Anytime I'm using a monopolar cautery, we can't use an electrolyte rich medium like normal saline. So this is out of the option. That is why we were using glycine. So I can use glycine, or we can use distilled water here, right? So I can use either of this, which is non-electrolyte rich. The problem with both of these is they can lead to hyponatremia. So we have to monitor the patient for hyponatremia. No need to stop the surgery. No point of giving furosemide. Furosemide will further lead to more hyponatremia. No, so this is absolutely something that you will not do. So you just carefully monitor. If female goes into hyponatremia, you have to supplement and correct the sodium, but slowly. Rapid overcorrection will lead to what? Rapid overcorrection will lead to osmotic demyelination syndrome. Very direct, straightforward question. Normal uterocervical length is 6 to 7 centimeters. All of the following can be indicators of choriocarcinoma, except, so remember here, persistently enlarged uterus, high HCG, suburethral nodule, all of these. This is in fact one of the most common sites of metastasis in choriocarcinoma. This indicates that there are vaginal metastasis. Apart from that, lung metastasis. So vaginal mets, lung mets are common conditions, all right? So these are three indications, but just more thecal lutein cyst does not tell you anything, okay? So thecal lutein cyst could be a result of molar pregnancy which preceded choriocarcinoma. So this is not something that we take into account, okay? Then we have 30-year-old woman came to OPD with twins. So they have asked you the pregnancy obstetric formula. So क्या है इस female के साथ? She is pregnant right now and she has twin pregnancies. So will I make it extra gravida? No, one gravida only, because pregnant तो एक ही बार है ना. Even though she has twins, she is pregnant once only. पहले क्या हुआ है? She has one alive child and 2 abortions. So 1, 2, 3, 4. So G is going to be 4. What about the P formula? So G4, these two I rule out. How many living issues she has? She only has one living issue. How many abortions? 2. So para is 1, na? Live to 1 hi hua hai. So it is going to be G4P1A2L1. This is going to be the answer here. All right. UTI question to bataya na? All right. I hope this is clear. All right. What's the doubt? बीच बीच में कुछ comment आ गए थे. और everything is good. Fine. Then what we have, थोड़ा थोड़ा अगर controversial लग रहा है तो उसको बाद में we will settle. Okay. We don't have time to get into too many controversies. I am telling you my point of view right now. If you have other points of view, you just message on group. We will discuss and I will also research more. Okay, fine. What we have here is an accessory lobe, which is known as a succenturiate lobe. It is the most common cause of retained placental tissue. Retained placental tissue is the most common cause of secondary PPH. Secondary PPH is any bleeding that happens after 24 hours. Most common cause of primary PPH is uterine atony, right? So this is what we target in atony. Secondary, retained, succenturiate. Okay, so we have gone into stepwise ladder. Then what you have to remember, apart from succenturiate, can you also see how the membranes are basically outside the placenta? You are having the fetal vessels coursing in the membrane. This is what is known as velamentous insertion. So I am seeing both in this image. All right. Then what you see here is a single placenta, a single sac. You see this thin white membrane? That's a single sac on which both the cords are attached. So this is what is the meaning. When you see one placenta, obviously it's monochorionic. Then when you see single white membrane, that is monoamniotic. So this is monochorionic monoamniotic pregnancy. Which of the following instruments are used in cesarean section? So definitely we use BP blade. Doyen's retractor is also used. So Doyen's retractor is shaped like this, and it is going to retract the bladder anteriorly. But do I use Cusco speculum? You know what a Cusco self-retaining speculum looks like, no? Something like this. I hope you can understand my schematics and imagine instrument. So this is what I use for vaginal procedures, not indicated here. Alice's forceps and green Armitage forceps can be used for holding the uterine incision edges, right? So both of these can be used. Green Armitage will have essa, okay, at the distal end in the forceps. And Shirotka's uterine clamp is not used here. This is used for myomectomy procedures. So 3 and 5 nikal do. The moment I remove 3 and 5, I am left with 1, 2, 4, and 6. So answer is going to be C. Which of the following is not used to treat PCOD? ये तो कल बता दिया था. Yesterday's day before yesterday class we discussed this. Clomiphene can be given, metformin can be given, OCP can be given. Even letrozole can be given, but no role of tamoxifen. One of you only commented, ma'am, no tamoxifen. So देखो, you predicted answer. Next, primary amenorrhea means 13 years, 15 years. 13 years if no secondary sexual characters. 15 years we can wait if secondary sexual characters have appeared. So agar to Tanner stage 5 or stage 4 breast hai, I can wait for 15 years. But if it is Tanner stage 1, anybody who is more than 13 will be primary amenorrhea. Next, cord prolapse. What is the next step? Very, very important. Yes, inform the doctor and shift to OT is what you will do. But by the time you do this, what will you do with the female? What you will not do is never touch the cord. Never touch cord. है ना? हमारे instinct क्या बोलेंगे? मैम cord बाहर है तो डाल दो. Don't put it. Okay, so don't touch cord. Cord will go into vasospasm. That is the only thing you remember. So don't do vaginal examination. What you have to do is put her in Trendelenburg position. Another thing you can do is lift the presenting part. यहाँ पे presenting part है, यहाँ पे cord है. Don't touch cord. Lift presenting part so that cord से pressure हट जाए. Pressure of the cord is lifted. Fine. In the meanwhile, yes, you will inform the doctor and shift to OT. LSCS is the mainstay. All right. Then which of the following is not component of BPP fetal biophysical profile? First of all, you will tell me what are components of modified BPP while I drink water. two ही है. Two components है. Amniotic fluid index and non-stress test. In non-stress test, we have to look for 2 accelerations in 20 minutes. Acceleration should be more than 15 beats per minute, lasting for more than 15 seconds. So you remember 2 and 20 and 15 15. All right, so this is a reactive NST and amniotic fluid index, that is modified BPP. Apart from that, BPP has 3 more parts. You remember tubercular meningitis, TB meningitis. So tone, लिखा है ना, tone, breathing and movement. So tone, movement and breathing, that will be TBM. NST is a part. Contraction stress test is not a part. Okay, then Metastasis to lung. Somebody was saying answer to this. No, metastasis to lung is stage 3. Any other metastasis? Because I said, no, this is very common. So we don't give it stage 4 also. Tum to lung meds, tum normal. So we give it stage 3, but other metastasis is stage 4. Fine. Next, anti-D, RH immunization, very important, not given when. सब में ही देना है, amniocentesis, MTP, manual removal. But when you are treating complication of RH only by giving intrauterine transfusion inside fetus only, I am puncturing the fetus cord and giving blood to fetus only, this has no chances of feto-maternal transmission, right? So in fact, I'm doing this as a treatment of severe isoimmunization. So isme nahi dena. So this is not something where you give. So pretty logical, even if you don't know the list, don't memorize list. Very logical you have to, answer. All of these facts about how to approach exam, I will tell you on 4th. Kahan gaya? Okay. So few points about RH. Anti-D. How much we give? 300 microgram. 300 microgram, remember 30-30. All right, 330 will neutralize 30 ml of fetal blood. This is given once at 28 weeks and within 72 hours if baby is RH positive. If baby is not RH positive, then you don't give this 72-hour wala. And don't use methyl ergometrin. If there is PPH in this female, don't give methergine injection. That's one of the contraindications. Other contraindications of methergine will be CVS, any cardiovascular issue, hypertension, peripheral arterial disease, because it's a potent vasoconstrictor. Do you remember in forensic, I had told you ergot Blackfoot syndrome? Where did we study this? Blackfoot, it was in a list which was CEA. Cocaine, ergot, and arsenic were all Blackfoot. So this is that same ergot which causes vasoconstriction. Okay. Next, I'm speaking as fast as I can. So ab ye mat likhna, ma'am, you can go faster because I literally can't. Which of the following is not included in active management of third stage of labor to prevent PPH? So this is where you look at the options and decide, because ideally all 4 of these are done. So what is the best answer now? The best answer here will be, yes, definitely you give oxytocin. How much do I give? 10 units. How do I give? I can give as IM or I can give as IV bolus. No, never give oxytocin as IV bolus. Always give it as infusion, right? Otherwise, patient will have tachysystole. Patient will have uterine contractions very strong. We don't want that. So this is 10 intrauterine, obviously done. Delayed clamping, always done. Control contraction, modified Brandt Andrews, always done. So if 4th option is massage, you exclude. But if 4th option is say early cord clamping, then that's wrong. Then you include massage. So here we have to read the options carefully. Fine. Which is true regarding hormone replacement. So here remember, HRT reduces risk of colon and साथ साथ ही याद रख लो, it increases risk of B. Okay, be a female. Be a female. If you want to be a female, you will use hormone replacement. Okay. So if you be a female, you have higher risk of B, which is breast and endometrium, and reduced risk of osteoporosis. Yeah. So estrogen intrinsically, you want to be a female. Why? Because it protects you from osteoporosis. So reduced risk of osteoporosis. Okay. Then which of the following options is incorrectly matched? Prolapse, big headache. One question I want to tell you, Q-pop. Q-pop is the new staging that we have for prolapse. If question comes from this, you will give me party. Okay, all 6,000 of you will give me party. So this is Q-pop staging of prolapse. Apart from this, what do you want to remember? कि हाँ प्रोलैप्स के लिए डू वजाइनल हिस्टेक्टमी, वॉल्ट प्रोलैप्स डू लिगामेंट सस्पेंशन, सिस्टोसील डोंट डू सस्पेंशन, सिस्टोसील you have to do anterior colporrhaphy, rectocele you have to do posterior colporrhaphy. So this is the definitive management of prolapse. आगे का वॉल स्ट्रेंथन करो, पीछे का वॉल स्ट्रेंथन करो, बीच का काट दो. So anterior colpo, posterior colpo, hysterectomy, no suspension. So C is what is wrong. Apart from that, question can be how, what else can you do? Ring pessary, I can use it if there is a prolapse in a pregnant female or somebody who is like way old. There is no age that we can say that you are a very old person. But let's just say 80 is where you cross a line, that 80 tak jee liye to you have good enough life. No, now if prolapse is happening, I'm not operating. So very subjective. Don't take offense if you are more than 80 years old. So ring pessary for more than 80. Again, if you are elderly, like anybody who is more than 60 70, both जी लिया आप, है ना, and you have comorbidities like hypertension, diabetes. I should not say all of this in YouTube live, because then you guys make a recording and put on Insta without context. कि ये देखो ma'am is an ageist person and this person is teaching and talking to impressionable young minds. So don't take it out of context. I am not going to say such things only. So elderly with comorbidities, remember, we will do Leaford procedure where you just are gonna do colpoclysis. बंद कर दो, है ना, like this is their vaginal introitus from where uterus is coming, put it inside, बंद कर दो, रास्ता ही बंद, तो it will not prolapse. Okay, so this is about it. And finally, if you want to preserve fertility, you are young female, then you will do sling procedure or cervical amputation. Fine. So this is about prolapse management. Okay, next. A woman who is using, I'm getting all of your comments to my jokes like 1 minute later, which is fine. I mean, ठीक है. So women who is using OCP with vaginal discharge without teaching foul odor, very very good, है ना. Without teaching foul odor means that there is no problem, there is no vaginitis. Okay, typical lactobacilli है, pH भी acidic है, सब कुछ normal. Any pH which is not acidic is something which is abnormal. So this is normal physiological discharge. तो देखो, we study everything about all of these. मुझे सब कुछ आता है मैम, Amsel criteria, Chrome agar, I know everything. But then they ask you normal vaginal discharge and then we get it wrong because I have studied too much. तो मैम अब थोड़ा तो I will mark vaginosis because I know everything about vaginosis. This is what you do in the exam. You are so biased because I have studied. मैं पूरा Amsel criteria recite कर सकती हूँ, and that's why you feel the pressure and you mark that. So this is what you have to learn in the exam. Read question on its own merit. जो भी पढ़ा है, जितना भी पढ़ा है, forget it when you go for exam. Okay. Most common cause of puberty menorrhagia is anovulation. Okay, one person is like, ma'am, अगले का A है. In case you want to chat, I will go on and do my job. अगले का answer is A. Okay, so anyways, so A is anovulation, which is the most common cause of puberty menorrhagia. All right, last two are the ones which are, just things that I has asked, and we just have to see. So what is the sequence of normal labor? Here, this is what you have to remember. So first, how you will remember is, anytime you meet a boy or a girl who you are, in an arranged marriage setup with, you will remember first is your engagement. है ना? After engagement, then you will find out, because arranged marriage, no? So engagement hua, then you find out, oh, the girl is decent, the boy is decent. Okay, so then you find out कि हाँ लड़का तो decent है. So engagement, then you found out कि हाँ decent लड़का है. After that, what you will remember, you find out that he is not decent. So when you find out he is actually not decent, you will file a FIR. Okay, so flexion and internal rotation. तो अब internal rotation हो गया, then you will remember ER. So extension, restitution. First keep them individually. First E and then R and then club them. ER. Okay, so FIR करा, E R and then ER, and फिर baby बाहर आ जाएगा. All right, so this is what you are going to remember. इसमें नहीं जरूरत है mnemonic की. हाँ, you guys understand how baby moves and everything. If you understand, very good. Somehow I have no concept in how baby is delivered, so मैंने तो बना लिया है. You use it or not, very good. If you have concept, nothing like it. Okay, so we have first thing which was happening was engagement. That is not helping us at all. After that, what were you doing? We found out there was decent. So decent हो गया, उसका कुछ फर्क नहीं पड़ रहा. Okay, one more thing. Extension से पहले there was crowning. Okay, so FIR करा and there was crowning. We crowned that person with jail. Okay, so you will remember FIR के बाद jail था. Okay, so here what do you have? You have engagement, then crowning. After that it was E and then it was R and then it was ER. So next step is going to be restitution. So BAC and then D. Okay, understood, no? ठीक है. Then modified dropsin, just remember this answer. The best one, nulliparous, single, cephalic, no. Spontaneous. Okay, so the best one is spontaneous. So spontaneous, cephalic, singleton, nulliparous, this is what is one. Induce हो जाएगा तो type 2 हो जाएगा. Like that you remember. Okay, so if you are one of those who feels that ma'am मेरा memory is best in world, then I can remember all 10 of them, go ahead please. But people like me who have limited memory, all right, and who recognize that they have limited memory and I want to save everything for useful stuff, will not remember, will only remember one is best, most simple labor. All right, अब जाते हैं into next subject. So 1 hour we finished, right? 45 minute का block था, but we finished in 1 hour, so that's good enough only. Okay, तो अभी अगर हमने इतना target meet कर लिया in the exam, तो we will meet only. We will definitely finish in 40 minutes because right now we are joking also, we are commenting also, we are spamming also. Fine. All right, let's start. So let's go to microbiology. So microbio, I tend to teach this in great detail somehow, even though I don't really like this subject a lot, but now when I've started teaching, no, I keep liking this subject every passing day. तो मैं इसको थोड़ा detail में पढ़ाती हूँ. So that is what I have done with this. It is the longest in this class, जिसका number of slides is the most, most in number. So anyways, let's start. चलो शुरू करें. All right. So first I have stains for you. No break. Don't ask for break now. अभी break मिलेगा 8 बजे सीधा. So here we have the stains that you need to know. No break. Up break lo na. I keep saying you guys take break anytime you want. Feel free to take any break. So here what you have to remember, what is this? सबसे पहले तो यही बताओ. This is gram stain. Gram stain, what you have to remember is come in and stain. Okay, you are sitting outside your micro lab room, तो आपको JR बुला रहा है, come in and stain. Okay, so we went. So you have to remember come in and stain. So primary color that I have here is what? The color that you have here is violet, है ना? So this is crystal violet. इसको कार्बल फुश्चिन मत कर देना बस. You might do कार्बल फुश्चिन. So this is crystal violet because violet color दिख रहा है ना, सामने ही है ना? When in doubt, don't use mnemonic, just see color. So crystal violet. The mordant here is iodine, which I used to fix it. A is again acetone, and the counter stain will be pink, so that is saffronin. Okay, so we were calling come in and stain. So we are like, okay, I came. So came for Zeal Nielsen acid fast staining. So here primary you can see is pink. Pink matlab fuchsia. So this is carbol fuchsin, fuchsia color. Mordant here is heat. Heat we are using. Thank you so much that I'm teaching like a wow. So that is best compliment these days. So carbol fuchsin, heat. Then decolorizer here is acid alcohol. So acid, remember H2SO4, and then last is came. So last is M, which is methylene blue. You can see, no, background is blue. So don't get confused. Malachite green nahi, blue, because it's blue in color. Fine. Now this concentration of H2SO4. All of these, this table very important because all of these are acid fast. ठीक है, ये तो पहला चीज हो गया. How much percentage? So for TB, I need 20% H2SO4. Okay, so 20% H2SO4 is what we need. Then for leprosy, how much H2SO4 do you need? For leprosy, we need 5%. Okay, 5%. Nocardia, Legionella are also acid fast. Nocardia to pata tha, Legionella is news. So Legionella is also acid fast, 1%, and बाकी सब छोटू छोटू चीजें like crypto, iso, spores and sperms will be 0.5%. So how to remember something I just figured, जिसमें भी spore आता है. How cool, right? How cool are mnemonics that are made on spot? So anything which has spore are all acid fast thing which we will do it with 0.5%. And cold acid fast is quinine method. So cold acid fast quinine is what you do for all of these spores. So for crypto and isospora, coccidian parasites, we do a cold modification, quinine's method. Okay. अब 0.2 0.24 स्पोर्स है. अगर इतना नॉलेज है तो रखो, वो knowledge है ना, very good, but it's fine for exam. 0.5 will suffice. Okay, then we have fluorescent staining. So these are the fluorescent stains. Just tell me for what. Auramine, rhodamine, this is for TB. Remember, this is not rhodonine. Rhodonine staining is for copper. Okay, so rubianic acid and rhodonine is a copper staining. Fine. Then acridine orange is for malaria. Very important. Malaria ke slide ke liye we do in our program Jaswant Singh Bhattacharya stain, but one fluorescent stain that you want to remember is acridine orange. Calcofluor white. Calcofluor white is for fungus, है ना? So fungus में you have chitin. Chitin को it stain. So CNC and FITC is a fluorescent stain that is used in flow cytometry. Okay, so these are your fluorescent stains that you need to be aware of. Two things which you may confuse, and if this question comes, I will take party from all 6,000, 5.5K of you. Urinary LAM is positive in, and urinary LAL, not urinary, but just LAL. Lineolus amoebocyte assay is positive in. If you give me both answers, I will be very happy. LAM is what is a marker of TB. ये तो ठीक है. But LAL is what we use for endotoxin. Okay, so this is very cool stuff that I am teaching you here. एक stain भूल गए. What is this I am showing you here? Chinese letter arrangement of diphtheria. What are these granules which are staining differently? These are metachromatic granules or Babe-Ernst granules. The stain that I use for diphtheria is Albert stain. The components of Albert stain is TIM. What is TIM? Toluidine blue. I can see that the granules are blue. I for iodine again, and M, I can see rest of it is green, malachite green. So this is TIM Albert stain. What do these granules contain? They contain the diphtheria toxin. From diphtheria toxin, you will first tell me mechanism of action. Mechanism of action is elongation factor 2 inhibition. This is also a mechanism for pseudomonas toxin. Tell me two specific culture media for diphtheria. One is going to be potassium tellurite, which will have black colonies. It is the best one. But the one which can show you early growth is Loeffler serum slope. Loeffler serum slope will give you early growth. Potassium tellurite is most sensitive. Another thing, can you tell me which is the test for this toxin, for diphtheria toxin? What is the test? We have the LX gel precipitation test. It's a LX gel precipitation test, and there is a sensitivity test which is known as Schick's sensitivity test. All right, so Schick's is a sensitivity skin test. LX is the one that you want to remember. It's a diffusion test. All right, so this is all about the diphtheria toxin and diphtheria as in general that you need to remember. Do you remember clothes of girl? Do you know what I'm talking about? If you remember clothes of girl, you remember everything. ठीक है? Bull's neck is what I am talking about. Fine. Now let's talk about a microscope. So in a microscope, what do we have? We have an eyepiece. They've asked you order. They've asked you order of the arrangement. Very simple, something that you have seen so many times. So we have the eyepiece, then you have the objective lens, then you have the stage, and below is what is the condenser. Condenser is very important because condenser is what I can change. If I want to do a dark field microscopy instead of a light microscope, I don't need a different microscope. I can only change the condenser. In a light microscope, there is transmitted light which goes. In a dark field microscope, there is reflected light which goes. So if they ask you what will you change in a dark field microscope, your answer is going to be I change the condenser. All right, so this is the order. Next, what you need to remember now is stage is not below condenser, condenser is below stage. Okay. All right, next, what is the magnification? So remember that this eyepiece gives me constant magnification of 10x. Objective may we can rotate and see, right? So here you have a scanner lens, you have a low power lens and high power. One special oil immersion is also there. So what is the magnification? 4x, 10x, make it multiplied 40x and oil immersion is 100x. So if they ask you कि total कितना मिलेगा, तो ocular का 10 multiply कर दो. So maximum magnification I can achieve is 1000x, because ये तो multiply करेंगे, right, into everything. So this is what you have to remember about general stuff from microscope. Now let's go to the wall of gram positive, gram negative, which has a thicker wall. Why is gram positive, gram positive? It is gram positive because of thicker peptidoglycan. So it is peptidoglycan which makes something gram positive. It's a thicker cell wall. What you need to remember next, what else is unique to gram positive which is not there in negative, is lipoteichoic acid. Then unique to gram negative is where you get the question linulus amoebocyte assay, that's endotoxin. Endotoxin, porin, and periplasmic space with beta lactamases is unique to gram negative. In this periplasmic space, you also have endoflagella. Very, very important stuff. In the endotoxin, there are 3 parts. Remember, OCA. O is the O antigen. Remember Vidal, we have O and H antigen. H antigen is the flagellum, which both have. O is unique to gram negative. C is the core polysaccharide and A is the lipid A. If they ask you which is the one which is causing the sepsis, it is lipid A, OCA. So this is about the endotoxin. Endotoxin versus exotoxin. What you will remember, only gram negative have endotoxin, and any gram positive which you know, listeria. Listeria also has endotoxin. Endotoxin is only released on cell lysis and you can't make a toxoid. It is very low antigenicity, so you can't make a toxoid. But all of the exotoxins like diphtheria toxin are very antigenic. You can make toxoids and they can be released without cell lysis. So this is our table of endotoxin versus exotoxin in 2 minutes. Now in the next 5 minutes, I will summarize entire bacteria for you. Then in the next 2 minutes, I'll summarize parasito for you, and then so on and so forth. Okay, 1 minute got wasted in this only. So going back. So gram positive and gram negative. Remember this classification. So gram positive may we have to first go with main, which is gram positive cocci. Here I will start with catalase. So catalase positive is staph. Okay, catalase negative is strep. Catalase positive, you all know space. Space क्या है फटाफट? Staph aureus, serratia, pseudomonas. Common to all 3 of them is all 3 have pigments. A for, now fungus comes, aspergillus, cryptococcus and candida. And E for, बस E बता दो मुझे, क्या वो enterococcus है या वो enterobacter है? That is the only thing I want to know. Enterobacter, because enterococcus is going to come in streptococcus. It's a part of streptococcus, so it can't be catalase positive. Okay, all of these infections are more predisposed in chronic granulomatous disorder. Anyways, so we have staph, we have coagulase that we check. Agar coagulase positive hai, this is our OG, staph aureus. Coagulase negative, I have to check novobiocin sensitivity. Novobiocin sensitive negative is S. saprophyticus. S. saprophyticus is the second most common cause of UTI. Most common is E. coli in sexually active females. So if you have UTI, you can't go to pee. So this is how you will remember. Saprophyticus is a no-go. No-go से याद रखोगे, UTI and novobiocin negative, it's a no-go. Fine. And the one which is novobiocin sensitive is your S. epidermidis. It is a commensal of the skin and it is what causes infection in prosthetics, right? So whenever you use any prosthetic device, infective endocarditis ho raha hai, any other infection, this is the most common cause, which is S. epidermidis. So either they can write S. epidermidis or they can just write cons, which means coagulase negative staph. Okay, coming to strep now. So in strep, we classify on the basis of hemolysis. Alpha, beta, gamma. Partial is green, complete is clear, no hemolysis. All right. Alpha में you have to see optogen sensitive, bile soluble. यहाँ पे हमारा main OG, which is always positive, gives you everything, is S. pneumoniae. So strep pneumoniae will always be positive. Diplococci lanceolate with a polysaccharide capsule. Okay. And finally, if this is negative, it is S. viridans. Okay. Then beta hemolysis. Here you have group A, group B, which are your Griffith classification. So what you have to remember, if both are negative, it is group B. Group B strep, also known as strep galacti. This is what you will remember. B for babies. This is what is the cause of early onset sepsis in neonates, because it is there in vaginal flora. So babies, if you give everything, no baby, you are not bacitracin, no baby, you are not PYR, तो baby will be angry. So we tell चलो camp पे चलेंगे. So camp test is positive. Okay, so remember baby, and what is always positive is group A strep, which is S pyogenes. Okay, so this is strep pyogenes. Going on to gamma hemolysis, we have 6.5 NaCl and PYR positive. है ना, देखो, such hypertonic, it's growing. The strongest one, enterococcus. Is it catalase positive or negative? This is how we started. Catalase positive. No, it is not Acinetobacter. Acinetobacter is now the most common cause of ventilator associated pneumonia. है ना? So your answer is correct, but question गलत है. So enterococcus. And what is negative is S. bovis, S. bovis, S. gallolyticus. Remember, if you have infective endocarditis in CA colon, it is S. bovis is the most common cause. So co is bo. Bo is co, is how you remember. Okay, so this is about your gram positive cocci. Coming on to gram positive bacillus now. Gram positive bacillus, what is anaerobic? इसको खत्म कर देते, पहले one ही है, Clostridium. Okay, so this is anaerobic. What is aerobic? Three things I want you to tell me. I will give you buzzword, you tell me diagnosis. The one which has medusa head colonies, the one which has the only one with a D-glutamate polypeptide capsule. What is it that I'm talking about? I'm talking about bacillus. So first group is bacillus, MYPA agar and plet agar. I hope you remember cross pneumonic. My pulmonary anthrax is for bacillus cereus. Plate of Chinese food is for bacillus anthracis. Okay, so this is bacillus. The next one that you have, the only one with endotoxin in a gram positive, the one which has tumbling motility. Also remember, this is a differential motility. It will occur at one temperature but not at other temperature. And what else? Low se hi tumbling, differential, and cold. Rose in cold temperature. I'm talking about low se listeria. And lastly, one we have already done is Corynebacterium diphtheria. So these are your gram positive aerobic bacilli. Very important, branching filaments, the one which is aerobic, one which is anaerobic. So नाम में ही है, I am A, no. Actinomyces, you ask it, are you aerobic? A, no. Are you acid fast? A, no. So this will tell you answer itself. But don't go with no of nocardia. ए नो बोलना पड़ेगा, नो से कुछ नहीं चलेगा. Alright, so you have to say aerobic acid fast is nocardia. Both negative is actinomyces. Actinomyces can show you this Splendor-Hopley reaction where you have this eosinophilic infiltrates. This can also be seen with sporotrichosis. Sporotrichosis also shows, actinomycosis also shows. This is an image-based question of actinomycosis, and they show you these colonies which are molar tooth colonies. Okay, so now I know medusa head and I know molar tooth. Don't mix the two up. All right, so this is your entire gram positive, which I probably summarized in 5 minutes. Okay, next 5 minutes, 2 minutes, gram negative bacilli. Let's start off with diplococci. All cocci are gram positive except Neisseria. So Neisseria gonorrhoeae, Neisseria meningitidis on the basis of maltose. तो अगर maltose negative है तो M नहीं दे सकते ना, because M नहीं है. So Neisseria गोनोरी. एंड अगर तो माल्टोज यूटिलाइज हो रहा है, निजीरिया मेनिंजिटिडिस. ओके, कैप्सूल किसके पास है? ओनली मेनिंजिटिडिस. सो ऑलवेज दे विल आस्क यू ऑल हैव कैप्सूल एक्सेप्ट, एंड यू विल से गोनोरिया में कैप्सूल नहीं है. Fine, meningitis has capsule. Two syndromes you should know from each. What if there is meningitis with petechial rash? Petechial rash अगर हो रहा है, that is known as Waterhouse Friderichsen syndrome. And gonorrhea, if you have adhesions on the liver, Fitz-Curtis-U syndrome. Fitz-Curtis-U syndrome. Two syndromes we need to remember. Then let's go to gram positive comma shaped, which are all oxidase positive. Tell me quickly the one which grows in 42. Skirrhose culture medium. I am talking about Campylobacter. It can cause bloody diarrhea leading. There can be risk factor of Guillain-Barré syndrome. There can be reactive arthritis following this. Okay, so Campylobacter grows in alkaline. हम सबका दोस्त Vibrio cholera. Vibrio cholera, you know, TCBS agar. Yes, you know VR culture medium. You know Carrie Blair. These are your transport media. Fine. Urea is producing. You all know urea breath test. It is H. pylori has also got cytotoxins CAG-A, VAC-A. ठीक है. Now going on to gram-positive bacilli, the biggest category. I distinguish on the basis of lactose fermentation. So here I have to use McConkey agar. Fine, to distinguish. So McConkey agar, if it's lactose fermenting, I have to see slow or fast. Circe slow, Circe serratia. Fast, 2OG, E. coli, Klebsiella. How can I distinguish E. coli, Klebsiella? I can do it on the basis of IMVIC. So IMVIC, E. coli है, Klebsiella है. E है ना, तो शुरू करो IM से. So positive, positive, negative, 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 positive, positive. This is how IMVIC will help us distinguish between E. coli, Klebsiella. Let's just take a moment and distinguish all subtypes of E. coli, the most important points. Enteropathogenic E. coli. Pathogenic has pili as the virulence factor, and what else you will remember here? P for pediatric diarrhea. E-tech has toxins, toxin, toxicogenic diarrhea, T for traveler's diarrhea. Tell me quickly mechanism of LT toxin, ST toxin. LT is CAMP. You remember CAMP? What are all the CAMPs here? Quickly tell me. कॉलरा टॉक्सिन, एंथ्रैक्स, एम को चीटिंग करके एल बना दिया, pertussis toxin. All increases CAMP. What you'll also remember is cholera toxin is ZOT. Cot is ZOT. Zonula occludens toxin. Fine. So this is also repeat question. Zonula occludens. And ST is CGMP increase. This is CGMP इंक्रीज. जिससे मुझे एक याद आया, ये ईपेक का एक फिगर दिया था माइक्रोविलाई का फ्लैटनिंग. दे हैड शोड यू फ्लैटेंड माइक्रोविलाई इन द इमेज. ओके, सो इफ दे शो यू दैट इमेज, इट्स ईपेक. Fine. Going on to entero-invasive. So this is gonna invade the cells, and one more. So this is gonna cause bloody diarrhea because it invades. And there is one more test here which is known as Cerny test. If you inject this into the eye of a guinea pig, you will have keratoconjunctivitis. Okay, so keratoconjunctivitis in pig. ऐसा कुछ कुछ कर रहे हैं अजीब अजीब चीजें. That is, you are invading into pig's privacy. Okay, that's how you'll remember. Pig की privacy invade कर दी, आंख में बैक्टीरिया डाल दिया. Entero-invasive. Then you have EHEC. EHEC, what will you remember? O157H7. This is the most important species which is going to cause hemolytic uremic syndrome. The mechanism of EHEC is just like Shiga-like toxin. So Shigella toxin, Shiga-like toxin, both of them do what? Circe 60S ribosome inhibition. And what you can also remember is, you can also remember here, this is the one which is going to be sorbitol fermentation negative. ये भी सवाल है, McConkey पे sorbitol fermentation negative. Fine. Entero aggregating. Aggregating is persistent diarrhea. And imagine all of us, if we go outside somebody's house and we protest, तो उसकी दीवार तो टूट जाएगी. So you will remember stacked brick appearance. If everybody collects, aggregates, and becomes persistent, we will stack bricks. So there is stacked brick appearance on HEP2 cell lines. Okay, I'm using already, this is the thinnest pin, point pen only. Okay, so this is about this. Fine. Then we have, now I will use thicker pen. Then we have lactose non-fermenter. So then I have to see oxidase is a yes. I have much better handwriting than this. I can be very neat, but then the class will go on till midnight. So that's why I'm not being neat. Okay. So this is Pseudomonas and this is Burkholderia. ठीक है. Then we have oxidase no. So H2S producing, अगर H2S produce कर रहा है, अगर OG is salmonella, and salmonella के साथ उसका भाई आता है which is Proteus, and if no H2S then उसका भाई है Shigella, and Shigella का भाई है Yersinia. Yersinia is the food poisoning which can mimic appendicitis. Okay, so Yersinia enterocolitica can mimic appendicitis. All right, so this is all about, कुछ रह तो नहीं गया? हाँ, ये रह गया. Gram negative cocobacilli. So these are everything which is left. Haemophilus influenza grows on chocolate agar. Demonstrates satellitism with staph aureus. बाकी सब फालतू. Bordetella, Pasturella, Brucella, ये सब है gram negative coco bacilli. All right. So this finishes bacteria quick revision. Now we have 5 minutes to finish parasito, 2 minutes to finish other stuff. So we have lots of cycles and good stuff coming up, which we will do very quickly. Chalo, fatafat. Ande, Midnight Express. No Midnight Express. So fatafat, we will. It's good that still you guys remember Midnight Express. No, after so many years. Can't be slower, Tushar. There are so many people who want me to be faster, beyond human capabilities. So can't be slower. Chalo, shuru kare. Identify all undays very quickly. So first is all trematodes. Kya hai ye? This is Tinea. Tinea is solium also, Saginata also. Solium is pig, Saginata is cattle. What is this which is non-bile stain? Chota baby, Nana baby, H. Nana. Non-bile stain. Only one host, which is humans. Only one host. This is solium, pig, Saginata, SA is CA, cattle. Then this is the one which is H. diminuta. Okay, H. diminuta is your rat tapeworm. Naam hai diminuta. It is like a rat. You, liar. You are not Nana baby. Nana baby is H. Nana. Nana means small. Okay. So Nana means small in Gujarati. Diminuta is rat tapeworms. So all of these are intermediate hosts. Sab mein hi definitive host is humans. Fine. Then what is this? The only trematode with the only cystode with an operculum. The only cystode with an operculum is Diphyllobothrium latum. D latum has two intermediate hosts. One is cyclops, second one is fish. Hence the name fish tapeworm. And the unique thing here that you want to remember is that it causes megaloblastic anemia. It infects the ileum and causes megaloblastic anemia, stopping the absorption of B12. So you remember iron fist bro, iron from duodenum, folate from jejunum, bro, B12 from ileum. Okay, so this is about trematodes. This is about cystodes. So this finishes cystodes. Then all trematodes, remember, will have the same appearance with this operculum. So we can't distinguish them. So you only need to know these three which have spines. So when I see a lateral spine, it is what? S. mansoni. You know Tedimansi? Tedimansi, inferior mesenteric plexus. When you have no spine, advanced in technology, what are we talking about? Japonicum. Japonicum, no spine. So these go into superior mesenteric plexus. And terminal cancer, squamous cell C of the bladder. What is this? S. hematobium. Terminal cancer, terminal spine. ठीक है? Finally, not a trematode, but just an egg for you. What is this? This is giardia, the only infection which can cause malabsorption. So they'll give you malabsorption in the history. This is the cyst form. So cyst form is what is the infective form. All right. So what we can also see here are the trophozoites. What you will remember, giardia ka trophozoite, you all know uncle. Uncle ki do aankheं, uncle ke kitne baal? How many hair does uncle have? Uncle has 8 hair. On the other hand, do you all know auntie? Auntie has 1 eye. How many hair? Auntie has 5 hair. So who is auntie? Auntie is trichomonas. Trichomonas has no cyst, only trophozoite. Uncle ke paas cyst or trophozoite dono hai. All right. So you all know this is falling leaf motility, whereas trichomonas is what motility? Twitching. Auntie is twitching, whereas uncle is falling leaf. Okay, I don't know why I did that. So that is giardia. Fine. Now we have nematodes. All right. So we have these nematodes here. So in nematodes, the first one, which is plano-convex. All right. I forget that I'm not in offline class. Somehow it feels like offline class only when we are revising everything. So what this is plano-convex. So plano-convex is Enterobius vermicularis. Again, something which is not bile stained, right? Not bile stained. Then when you have barrel-shaped leaf on both the side, what is this? This is trichuris. Trichuris, trichura. Then what also you want to remember here in vermicularis, we can do an NIH scotch tape. test, night swab or scotch tape test. Okay, then we have two ascaris. So which one is fertilized? Mota. When you are fertilized and you are pregnant, you become very fat. So this is fertilized egg of ascaris, whereas this is unfertilized egg of ascaris. Whereas non-bile stained, again non-bile stained, I am seeing these O's here. So this is O for hookworm. Hookworm can be ankylostoma or Necator, old world or new world. ये क्या है? The only one where I don't see egg but a larva in the stool, strongyloides, because it is ovoviviparous है ना, तो वो अपना larva दे देता है. This is what larva? This is rhabditiform larva of strongyloides. Okay, what is this egg which has cilia? The only protozoa with cilia. This is Balantidium coli. So you'll remember ciliated motility. Cilia is Balantidium coli, and they have shown you these worms. कौन है ये worms? ये है ascaris. You know, now don't go and see like सबके worm देख के जाना है, because ma'am we do previous year topic not question. तो देख लेना all worms and see, you send me also how different worms look. But if I was you, I would have seen ascaris looks like this. Okay, cool, you will be ascaris. Fine. So this is about all of the worms and parasito. Few extra things from parasito. First, we talk about trypanosoma. So trypanosoma is American and African. American trypanosomiasis causes everything R and C is what you remember. So here, this is Chagas disease. They give you this sign which is known as Romana sign, and the vector here is Rosehi redu with bug. So you remember C and R and everything else is sorted because cruzy mein C and R hai. How nice. No, so this is cruzy. Then we have Trypanosoma brucei and African. So here this is known as sleeping sickness spread by sese fly. So if you just remember CR, everything else is brucei. That's how you go about it. Malaria ki baat karte hain, what are the infective forms? So through a mosquito bite, which mosquito? Female Anopheles, I will have the spread of sporozoite. But in transfusion, you have spread of trophozoite. Placental transmission, merozoite. How will you remember? अगर placenta से जा रहा है, you will say मेरे बच्चे को मेरा. All right, so you will say मेरे बच्चे को malaria. So placenta is merozoite. So this is how you will remember and मेरा बच्चा. Everything else is sporozoite. Fine. Then you have optimal card test. Optimal card test is Vivax and falciparum. Vivax is going to be LDH and aldolase. Anything with an L. Anything which does not have an L, histidine rich protein 2, HRP2 is for Plasmodium falciparum. Okay, so this is optimal. Let's identify mosquito. So next time when you see an insect on your hand trying to bite you, before you do this and you kill it or you make it fly, what will you do? You will first recognize them. Okay, so what is this? The one where adult is sitting at an angle pe baitha machhar, that is Anopheles. This is sophisticated mosquito because it lives in clean water, spreads malaria. Who? Female, obviously. So female Anopheles. Then when you see stripes, tiger mosquito lives in artificial collected water, has the shortest flying range. This is Aedes, will spread almost all of the diseases. So remember this table, very, very important. Dengue, chikungunya, yellow fever, Zika, Rift Valley. Okay, we have the Brotus index. Okay, for Aedes mosquito. Yellow fever, abhi kabhi bata deti hu. 2-3 points you need to know. It has Taurus bodies. It has a quarantine period of 6 days and it is spread via Aedes. Itna yaad rakh lo. And vaccine strain is 17D. 1, 2, 3, 4. 4 questions have always come. Okay, thank you so much. So this is about Aedes. Then this is Culex, which lives with this hunchback. For Japanese encephalitis, very important, and for filariasis and for West Nile. And this is Mansonia with long legs, lives with this plant, which is Pistia plant, and is in Brugia malai. Okay, so this is about all of the machars. Then what is this? This is a sand fly. Sand fly is for Kala Azar. Everything that I'm about to say now is very, very important. If you do a bone marrow aspiration, you're going to see A mastigotes. The repeat question. RK39. Very important. Kinetoplast, skin test, Montenegro. Everything about Kala Azar, drug of choice is liposomal amphotericin B. Okay, this is the drug of choice. Miltefosine can be given, but liposomal is the drug of choice. All right. Then what you need to remember? Oh, I was stuck at your comments, but fine, I didn't miss anything, right? So this is about Kala Azar. Then what we have here is a life cycle. Can you guess all life cycles now? So this, when you see a cute cat, always think of toxoplasmosis, right? So toxoplasmosis can be infected through various route. है ना, आपको दिख रहा है कहाँ कहाँ से आपको मिल सकता है. You can get from blood, you can get from eating cat, you can get from cat itself, you can get from being a child of a mother with toxo. So ingestion में क्या मिलेगा? You will have oocyst. So see how cat feces has oocyst. So if you eat food mixed with cat, so if you have cat as a pet, you will have oocyst. अगर आपने cat feces खा लिया गलती से, which will have bradyzoid. All right. So this is bradyzoid. No. Sorry. This is oocyst. Okay. Cat feces ingestion. Ingestion of cat feces, ingestion of meat. So this is oocyst and cat meat is bradyzoid, and vertical transmission. Vertical transmission to bacha again is going to be tachy via tachyzoid. All right. So placental transmission of toxo is tachy. Fine. How to remember? So we ask, no, who is cat person, who is dog person? So what you will say is, if somebody says I am a cat person, which is very unusual, we will be like, ooh, you are a cat person. Okay, so this is how you remember. Ooh, cyst is cat person. Apart from that, if somebody says I ate cat meat, so achanak se our heart will only stop, right? So you will go into bradycardia. So this is how you'll remember. Ooh and brady, bach gaya wo tachyzoid. All right, so this is about toxoplasma. Going on to mycology now, very quickly, entire myco will be summarized in 5 minutes. Very high yield slide. Okay. So a yeast, what is a true yeast in fungus? It is Cryptococcus. In Cryptococcus, we have this negative staining, which is known as India ink. India ink staining or negrosin staining. However, what is the most specific test here is latex agglutination. So latex agglutination card test is better. Here they will give you HIV person with meningitis. Okay, HIV person with meningitis. All right. Bird seed agar is something that you can also remember. So bird seed agar, and this is also linked with bat droppings, bird droppings. All right. Then what is yeast like is candida. It has pseudo hyphae. They can show you this. This is germ tube formation, which is known as Reynolds broad phenomenon, and we can distinguish different species of candida now on the basis of this chrome agar. In chrome agar, you can also see this cruzi here. This is the one which is resistant to even azoles. Okay, so this is one of the worst species which is resistant to azoles also. Candida, remember, curdy cheese, cottage cheese, everything C will come in candida. Okay, and if they give you white patch that can be removed, it is candida. If I can't remove, it is leukoplakia or lichen planus, but candida can be removed. ठीक है? Now coming to mold. So mold, very important image-based question. Septate hyphae, acute angled branching. So you will see ASP, acute angled septate. This is aspergillus. But if it is aseptate, broad, obtuse, it is mucorrhizopus, zygomycetes. So this is mucorrhizopus or absidia also. Fine. So this is how they will ask you clinical questions with micro integration. Dimorphic pe yaad rakho. Cold and heat. So these can have two forms. So cold mane, in culture, you have cooler temperature than inside the body. So cold is culture, and cold will show you mold form, hyphae form. Heat is histopath, will show you yeast form. What do we remember? We remember HSBC bank. So we have histoplasma. Histoplasma can have intracellular yeast form or these macroconidia known as tuberculate macroconidia. And why? Because histoplasma mimics TB. This is one clue, mimics TB. Then we have blastomyces, which is going to show you broad, B for broad based budding, figure of 8. Then we have coccidiomycosis, which can show you these spores, and it can show you these barrel-shaped arthrospores. Then we can have paracoccidio, which is going to show you this captain wheel or this Mickey Mouse appearance. And finally, this is a broom brush appearance, a red fungus. Serratia is red pigment bacteria. This is red pigment fungus. Broom brush appearance. This is Talaromyces or Penicillium marnefi. Okay, so these are all of your dimorphic. One more dimorphic which shows you this bodies is porotrichosis. These are known as asteroid bodies. All right, so these are your asteroid bodies here. And just to complete the list, this is not a dimorphic fungus, but these bodies are very important. These are your copper penny bodies which are seen in chromoblastomycosis. Here you will have linear lesions, ulceronodular lesions in a gross gardener or a farmer. Here you will have warty lesions, okay, in the foot of a person. So HSBC bank kya hai? Histoplasma, sporotrichosis, blastomyces, coccidio, and B is actually 2 P's. So paracoccidio, penicillium. So these are all of the things. You may not remember the American endemic areas because it's not relevant to us, but just go through that BTR wala page, no? So you can integrate, but most important is the morphology. ठीक है? Most important question, in fact, is this: what is positive in beta glucan or galactomananaceae? It is invasive aspergillus and candida. What they ask you is what is negative, which invasive infection is negative? You remember BCM. So blastomyces is negative. Most important is cryptococcus and mucormycosis. So C दोनों में आता है. So this is where you will get confused. So it's crypto and mucor which are going to be negative. All right. So this is about mycology. All right. Almost every question gets covered if you finish this much. Okay. Now going on to sterilization, general micro, just thoda because this is ekdam last minute ratta stuff. So we'll just go through it. Hot air oven में कुछ भी glass वाला डाल दो. All glassware, anything which is greasy or with paraffin, liquid paraffin. That's a repeat question. So glass and paraffin go in hot air oven, 160 degrees Celsius, 2 hours. Autoclave is under pressure. So autoclave is where most, if you don't know the answer, you mark autoclave. So this is where all that you throw in yellow bag, yellow auto, everything in yellow bag comes here. So stuff like culture media, except LJ and Loeffler serum slope. So LJ, LSS, both are inspissated. Inspissation is a new media, a new method. Everything else is here. Okay. Thank you so much. अगर बहुत मजा आ रहा है इतना पढ़ाई करके, that's the best thing ever, right? So this is culture. Apart from that, all of your surgical instruments जो OT में आते हैं, all of your linen in OT is all autoclaved except sharps. Scissors वगैरह को autoclave नहीं करना. Fine. And what else? Sutures except chromic catgut. Okay, so ये सारा कुछ जाता है into autoclave. Then all of your scopes are gonna go into glutaraldehyde except arthroscopes. So ortho वालों को अपना अलग चाहिए. Arthroscopes and urologist. Okay, two male, more male bashing. Two male dominant fields want कि हमारा sidex सबके जैसा. No. We want special. So we can do gamma rays and we can do plasma both. If both come in the option, then you can mark plasma as better answer. Okay. So this is where you put arthroscopes and urethroscopes. तो बच जाता है एक stethoscope. So stethoscope, do I need sterilization? Is it going inside somebody's mouth or body or mucosa? No, right? It's going on skin only. So it doesn't need sterilization. Just disinfect it with isopropyl alcohol. That's the difference between disinfection and sterilization. Sterilization मतलब ये सब कुछ spores को मार सकता है. So this is why I'm giving you this slide. If they ask you what all can kill spores, all of these can kill spores. ठीक है, इस लिस्ट में जो भी नहीं है विल नॉट किल स्पोर्स, एंड इसीलिए हाइपोक्लोराइट नीचे है, इट कांट किल स्पोर्स, ओके, नॉट स्पोर्स, एवरीथिंग एल्स कैन किल स्पोर्स. आई होप दिस इज क्लियर to all of you. And ETO is a gas, okay, ETO is a gas, so this is what I've used for gas, cardiopulmonary machine के लिए ETO. Fine. Plasma sterilization पे काफी सवाल आते हैं. Remember, this is the one that I use for anything which is heat sensitive, because this is where I don't use heat, I use hydrogen peroxide. Okay, so we use vacuum, there is no medium, and we use H2O2. So for heat sensitive structures we will use this. All right, finally we talk about Sidex, मतलब glutaraldehyde, इसको बोलते हैं ना साइडेक्स. कभी हॉस्पिटल में देखा होगा ना, उसमें सारे स्कोप्स, आर्थ्रोस, ब्रोंकोस्कोप, ये सब डालेंगे. नाउ गोइंग ऑन टू द कंट्रोल. सो सबटिलिस इज सबसे पहला हॉट एयर अवन. बिगेस्ट नेम, बिगेस्ट प्रेशर, बिगेस्ट लिस्ट ऑल्सो, autoclave. Even plasma will be stereothermophilus. Pumilus has I, infrared rays, Globig is gas, so ETO. Fine, so this is your list. Milk pasteurization के 3 मेथड है. This does not obviously kill spores. Okay, so pasteurization, this is when you hold it for 30 minutes, holder or vat method. Then we are like, यार जल्दी करो, इतना टाइम थोड़ी लोगे, फ्लैश में करके दो. So फ्लैश में करा 15 seconds. Then we are like, no, use ultra high temperature. So 125 3 seconds, ultra high temperature. So these are your 3 methods of milk pasteurization. Very quickly, virology, ज़्यादा टाइम नहीं देना, फटाफट we will do cycles and then we have PYQs. Okay, is the speed okay? We are on to second subject completion, then we have 3 more left. ठीक है, 8 तो बज ही जाएंगे. चलो शुरू करते हैं. DNA वायरस. So the one which is different, pariah, single stranded DNA, pariah, parvo virus. Do you think pariah virus को कोई envelope देगा? Nobody will give. So non-enveloped. It is the smallest, बिचारा pariah virus, smallest. It causes erythema infectiosum. Very, very important. 5th disease, slabbed cheek appearance, erythema infectiosum. These are your dog ear projection. So they affect the red cell lineage, leading to pure red cell aplasia. Okay, so pure red cell aplasia कराता है, erythema infectiosum कराता है. Very, very important. Dog ear in erythroblasts. Apart from that, what else parvovirus can do? It can cause non-immune hydrops. It is the most common cause of non-immune hydrops in babies. Obviously, most common cause is isoimmunization. Fine. So ये हो गया parvovirus. B19 is the most common strain. Double stranded, enveloped. So whenever you buy HP laptop, it comes with a box, right? So you'll remember herpes and pox virus. Herpes may you have HSV1, HSV2. Then we have varicella zoster virus. So this causes chicken pox. The name has chicken pox, but it's a herpes virus. Then you have EBV and CMV. EBV, remember, we do a monospot test, which is also known as Paul Bunnell test, which is going to have heterophile agglutination, alag species के साथ agglutination. Repeat question. Fine. It can also give you downy cells, even though EBV affects B cells via CD21. Very important question. In smear, I am going to see cytotoxic T cells, CD8 T cells as downy cells. Okay, very, very important. Fine, ये सारा चीज एकदम important है. Okay, then EBV CMV हो गया. Then we have HHV 6, 7, 8. Do you remember yesterday I told you everything about this? 6, 7 was pityriasis rosea. HHV 8 is Kaposi sarcoma. So this is your herpes ka summary. Pox virus is largest, complex symmetry, the only one which replicates in the cytoplasm. In pox, everything which has a name pox is pox virus except chicken pox, and molluscum contagiosum doesn't have the name pox but is also pox. You remember HP bodies and those umbilicated lesions? That's that. And the one envelope which replicates through RNA intermediate is hepatitis B. ठीक है. नॉन एनवेलोप पे आते हैं AP. सो वी हैव एडेनोवायरस. एडेनोवायरस की 2 बातें याद रखो. इट इज शेप्ड लाइक अ स्पेसशिप जैसा बनता है, एंड इट इज यूज्ड एज अ वायरल वेक्टर. ओके, स्पेसशिप भी हम इसीलिए बनाते हैं ना, सो दैट वी कैन सेंड स्टफ टू स्पेस. सो ये भी हम इसीलिए बनाते हैं, सो दैट वी कैन मेक वायरल वैक्सीन्स, बेसिकली वेक्टर फॉर वैक्सीन्स. ओके, एंड देन वी हैव Papova virus, which is your HPV, and you have polyoma virus, which includes two letter वाले, JC and BK. दोनों मिक्स कर दिया. JC and BK. All right, so we have bad kidney, junky cerebrum. So JC virus is going to cause progressive multifocal leukoencephalopathy, and BK is going to cause graft nephropathy. Renal graft में अगर nephropathy हो रहा है. ठीक है, here what you have to, हाँ थोड़ा थोड़ा स्लो चली जाऊंगी इसके बाद. What you have to remember, if they tell you renal graft में infection हो रहा है between 1 to 3 months, will you mark BK virus? No. CMV, most common cause of infection in renal graft. Very very important question. ठीक है, इसको बाद में एक बार जरूर रिवाइज कर लेना गाइस, इफ यू आर वेरी कॉन्फिडेंट कि मैम मैं रिविजन आई एम डूइंग दैट राइट नाउ ओनली, देन यू जस्ट सी पीडीएफ. बट दोज ऑफ यू हु आर फीलिंग कि ये चल क्या रहा है, then you should definitely see this class one more time. It will be worth it. Okay, I'm sure you realize that कि worth it होगा इसको फिर से देखना. So this is about DNA virus. Then what you have to realize, RNA viruses में just remember the exceptions that I'm telling you. All RNA viruses are single stranded, except the only double-stranded RNA is rotavirus. It's the most common cause of diarrhea in infants. Remember, this is the one which is linked with intussusception also. So this is asked as a question, and it has this NSP4. The shape is like a wheel, rotating wheel-shaped virus. NSP4 is the antigen that you want to remember. Fine. Then all viruses have single copy except retrovirus. Retroviruses have two copies. Okay, so retroviruses have two copies. So you have HIV and HTLV. Unsegmented, 4 are segmented. All are unsegmented except 4, very important. B for Bunya viridae, I for influenza virus, R for rotavirus, and A for arena virus. Okay, just remember influenza के 8 segments होते हैं. So they ask you life cycle. If you see 8 segments, it is influenza. Then talking about nucleic acid replication of all DNA viruses happen in the nucleus, except, can you tell me exception? I have already told you, पॉक्स वायरस लार्जेस्ट है, कुछ भी कर सकता है. RNA all happens in the cytoplasm except 3 RNA viruses which replicate in the nucleus are rim viruses. So obviously retroviridae, because it has to become DNA, है ना, because retrovirus है. I for, thank you so much for your kind words. I for influenza and M for measles. Okay, so this is how you will solve life cycles. Don't sit every life cycle, don't sit and study every virus life cycle. क्योंकि if you just do this much, no, you will be able to solve. Segmented दिख गया तो influenza है. If it's going inside cytoplasm to nucleus to divide, it's measles. If it's becoming RNA to DNA intermediate, it's retro. So that is how you will be able to solve. यही सवाल आए हैं अभी तक. अगर वायरस का लाइफ साइकिल का हिस्ट्री देखो, they have asked you hepatitis B because it replicates through RNA, DNA becoming RNA. Other is retro. They've asked you influenza, they've asked you measles. So this is how you can solve these life cycle questions. All right. So this is what is very very important. चलो फटाफट से न्यू थिंग्स के वायरसेस के लाइफ साइकिल बता दो. दिस इज वेयर यू विल गेट क्वेश्चंस फ्रॉम, एंड इफ क्वेश्चन कम्स आई विल टेक पार्टी. ओके, तो बताओ ये क्या है. इन द एग्जाम यू मे नॉट बी एबल टू जूम, तो आपको क्या देखना है मोटा मोटा. यू हैव टू सी कि भाई बैट्स है, चिंपांजी है, ह्यूमंस आर एक्सीडेंटल होस्ट, एंड ह्यूमन टू ह्यूमन ट्रांसमिशन इज ऑल्सो हैपनिंग, है ना. तो ह्यूमंस में थ्रू एनिमल साइकिल इट इज coming. So what are we talking about? We are talking about Ebola. This is not Nipah, this is Ebola virus. Okay, so Ebola में आपके पास bat और chimpanzee होंगे. That is the trick, because bat will also, you were correct, we will have bat also in Nipah virus. But Nipah में ना, these are fruiting plants के bats. So you will see some fruiting tree there. ठीक है, तो ये आपका ट्रिक है यहाँ पे. एंड यू डोंट सी चिंपांजी, यू सी हॉर्स एंड यू सी ह्यूमंस एंड एवरीथिंग. सो पिग्स आ जाएंगे. तो दिस इज हाउ यू विल रिकॉग्नाइज. यही दो इमेज देख लो, यू विल बी क्लियर. ऑलराइट, सो वी हैव इबोला which is a not a flabby. One of you said flabby, it is a filoviridae, है ना. Ebola, Marburg are philo meaning they are filamentous. If you look at them, they are filamentous. Can you tell me the two filamentous bacteria that you know? Gram positive wale, Nocardia and actinomyces. These are two filamentous viruses. Okay, so filoviridae. They have asked you, is there a mosquito involved in the life cycle? No. Ebola में नहीं है ना. Where did we see mosquito? We already know yellow fever, Japanese encephalitis, all of that. Fine. This is how you will answer. Then when I see कि अरे यहाँ पे तो ticks है, there is hard tick which is involved, then there is cow which is involved, you have goat. तो गुजरात में बड़े सारे काऊ मिलते हैं, है ना. सो इफ यू जस्ट वांट टू नो फ्यू anecdotes from my life, Zara loves to see cow. In Delhi, to show her cow, we need to go on one route which is like 10 kilometers away to show her one cow. But when I go to my house in Gujarat, she gets to see cow just outside my house. I open door and there is cow. So in Gujarat, you will remember there are too many cows. And that is why this disease, which is Crimean Congo hemorrhagic fever, this is what we see in Gujarat, right? There are cases of Crimean Congo in Gujarat. This is endemic in India. That is what is a question. कि अरे मैम के घर के बाहर ही Crimean Congo है, cow है. Alright, so cow is Congo. That is how you will remember. Okay, so this is Crimean Congo hemorrhagic fever transmitted through ticks. So what a mistake a lot of you did was, जैसे ही tick देखा, you all said what? Canasur forest disease. So every tick is not Canasur. Even Crimean Congo is spread by Canasur forest disease. It's spread by ticks. Okay. Then we have Japanese encephalitis. Japanese encephalitis. May you need to know everything about life cycle. Meanwhile, in chat, people like, ma'am, say something in Gujarati. By my speed, do you think I have time to speak something random in different language? No, we don't have time to waste. So now in JE, you need to know about all of these things. Okay, now you need to know about all of the parts. So waterfowl, water aquatic birds are going to be your reservoirs. Okay, I'm too much inclined to read your comments and chat and gossip, but we don't have time, no. So later after exam, we will keep on YouTube free live for just chatting. So this is reservoir. Mosquito, Culex is your vector. Pigs are your amplifier and humans are accidental dead end. You see, humans एक दूसरे को नहीं दे रहे, सिर्फ हाथ पकड़ा है. So humans are dead end host. So this is Japanese encephalitis. Very, very important. And finally, एक चीज बताना भूल गई. Recent new drug in Ebola is Inmazeb. Inmazeb has all of these drugs. So just see, this is new drug approved for Ebola. ठीक है. So this is about all cycles. Then 3 parasitocycles. Fatafat. How do you recognize quickly is fresh aquatic vegetation. When you see aquatic vegetation, what is it? It is fasciola. So this is fasciola fossa, fresh aquatic vegetation fossa, fasciola. That is your secondary intermediate host. Everywhere primary definitive host is going to be humans. Primary intermediate host is going to be snail. है ना. तो डोंट लुक फॉर स्नेल बिकॉज एवरीथिंग विल हैव स्नेल. ऑलवेज लुक फॉर सेकेंडरी, है ना. तो वो फ्रेश एक्वाटिक मिलेगा तो फेशियोला है. Then when you see auto-infection, you see that a larva is coming in the stool, rhabditiform. This is strongyloides, right? That is the marker. When you see larva, not egg, you see larva. That is strongyloides. Then when you see, okay, dog definitive, sheep intermediate, human accidental, not spreading. What is it? It is your hydatid, right? So hydatid is Echinococcus granulosus. So this is how these are all of your previous year questions. Let's just do pharma here of all of these drugs because this is something you tend to miss and you do get a lot of questions from here. So for cystoles and trematodes, what is the drug of choice? ये table इस पे लिखो hashtag छोटी copy. You will revise this and go. Take a screenshot. You will revise this and go. So cystodes and trematodes is praziquantel. Okay. I hope that through these sessions,
I'm not just teaching you, but I'm also teaching how you should study. थोड़ा थोड़ा आइडिया लग रहा है कि कैसे पढ़ना है, कैसे रिवाइज करना है, कैसे इंटीग्रेट करना है. इफ यू कैन गेट दैट, आई विल बी सर्विंग अ बिगर पर्पस देन जस्ट गिविंग यू information. Okay, that is my aim. So anyways, cystotrematodes is praziquantel. Liver fluke is different, it is tricla bendazole. Hydatid and nematode is albendazole. Filaria is DEC, very important. Oncocerca, and this has mass drug administration. Okay, so this is one of the things which has mass drug administration. Oncocerca strongyloides is ivermectin. These two, all three coccidian parasites, very important. I'll show you PYQs from that also. Cryptosporidium is nita zoxanide, and these two are cotrimoxazole, TMP, SMX. So these are very important. You tend to miss this, and इसमें से काफी question आए हैं. All right. So this is about the drug of choice for all of the parasites. चलो अब बस थोड़े थोड़े micro, because now I've finished everything now in micro. So yeah, in fact, like through the TNDs, definitely I think you learn much more, because you learn how to solve MCQs. And the good news for those of you who have done BTR TND, not just promoting it or selling it, but the good news is that we have actually solved USMLE questions, so others can just have that FOMO that, oh, ये बच्चों ने तो USMLE questions भी देख लिए हैं. And how AIMS is moving towards USMLE pattern, it won't be a surprise if you actually get questions from U world, and questions based, the big questions that you were all crying na कि मैम कैसे टेस्ट सेट करते हो, we hope you don't set paper. I hope you guys are happy now कि मैम अच्छा हुआ we solved those, तब रो रहे थे तो वो worth it था, है ना. So that is what was the aim, ki, to orient you, and so that those questions now don't scare you. When you see those questions, you feel happy that, oh, we have an extra edge and we have learned this stuff. Fine. So anyways, chalo ye ho gaya. So now let's go to this bacitracin sensitivity. कहाँ पढ़ा bacitracin sensitivity? Babies were like हमें कुछ नहीं दिया तो हमें camp पे लेके जाओ. So it was group A, S pyogenes, right? Whereas babies will be negative. What is the incubation period of lymphogranuloma venereum? So LGV is 10 to 30 days. Okay, 10 to 30 days. Then तो ये तो बस याद ही करना है, इसमें कोई कॉन्सेप्ट नहीं है. HHV8 is associated, all accept. बताओ फटाफट. T cell leukemia, no, because T cell leukemia is caused by HTLV. So this is very important. Not just Kaposi, Castleman and primary fusion. इस पे सवाल आएगा. Very important. ठीक है? This is what you need to remember. Which of the following is not toxin mediated? So food poisoning definitely. And is it preformed in staph? Yes, it is preformed. It happens early, 0 to 6 hours. Toxic shock? Yes, because there is toxin that they have, and staphylococcal also, because they have exfoliative toxin. But sepsis of staph is not because of toxin. ठीक है? Exfoliative toxin, I told you mechanism, it acts on DSG1. So there will be no oral involvement. There will be flaccid ulcers, no oral involvement. ठीक है? Specimen handling would require BSL2 because it is molecular testing. If they were asking about culture, which we can't do, but if we could do, then it would be BSL3. For molecular testing, it is BSL2. MV, malaria vaccine, comes from this mycobacterium species, which is Indicus prani, that you just need to know as a one-liner. This, I will not be sharing group link right now. I'll be sharing it in the Zoom class tomorrow for subscribers, okay? So we have A, B, C, D. This is ether sedimentation test. A is ether, B is debris, C is formalin. You need not know any of it. What you need to know is that the ova and all will collect in part D. That's the only thing that you want to remember here. Fine. A quinion positive oocyst. So when you see that it's an oval oocyst, this is isospora. So this is isospora. Both cyclo and crypto are round, only their size is different. So this is around 2 to 4 micron. This is 8 to 10 micron. But that will not help. You can't see and say na कि यार ये ना 7 micron का लग रहा है. That you can't. You don't have those superpowers. So they will not ask you these. They'll mostly ask you isospora only. Fine. But if they do ask you, what they will do is they will tell you the size. Okay. which in this case is not helping again, because it is falling exactly bam in between the two sizes which I just told you. So let's see what they are asking. Which of the following is true? They are not even asking diagnosis. Pathogen does not show autoinfection. Cryptosporidium parvum is most common. So Cryptosporidium does show in autoinfection. So this is wrong statement. Okay, so I'm just going to put a wrong here. We know parvum, but remember, parvum is not the most common. It is Cryptosporidium hominis. ऐसा कोई है which I also didn't know before today, कि ऐसा species is most common. Somehow parvum has gained more fame overall, no? Us cysts are immediately infective. That is a true statement, and it is an obligate intracellular. No, ये तो खुला घूम रहे हैं. They are not intracellular. Okay, that is what you need to remember. Even staining. So the Cryptosporidium, मैंने उल्टा लिखा है by the way. Crypto is smaller. Okay, so this is 2 to 4 micron. Cryptosporidium is always acid fast, whereas Cyclospora, which is bigger, is going to be acid fast plus minus. It may or may not be acid fast. Okay, so this is what you need to remember. Now going to the next one. All right, what is this cycle? So very अजीब क्वेश्चन. दिस इज अ ट्रोबिक्युलाइड माइट. सो जस्ट रिमेंबर, ऐसा कुछ कुछ दिख रहा है, ट्रांसओवेरियन ट्रांसमिशन. दिस इज माइट. माइट कैसे पहचानोगे? माइट इज गोइंग टू बी ऑल रेड. इट टेक्स अ लॉट ऑफ माइट टू वेयर ऑल रेड. सो दैट्स हाउ यू recognize. What is this cycle? When you see that there is trophozoid, there is quadrinucleate cyst, चार nuclei है, that is entomoeba histolytica. Okay, that is how you'll recognize, and it can also eat up RBC. Erythrophagocytosis also can be shown. So this is E. histolytica. You see that it's affecting the cecum. There are flask shaped ulcers. Okay, ठीक है. I have taught hominis in more. Okay, good to know. So which of the following is correct statement regarding CMV? So this is the correct statement where it's because of this gene resistance. ये बस हमें जानना ही है. It cannot be cultured in any mammalian cell. In fact, very important, fibroblasts में culture होता है CMV. Remember this fact. Commonest manifestation is not watery diarrhea. It's usually asymptomatic. If symptomatic, it will have a presentation like EBV, infectious mononucleosis. Okay, that is the most common symptom. And it is showing cross resistance to foscarnet also. This is wrong. It does not show. Everything becomes resistant. Okay, yeah, even crypto shows auto-infection. How do we know that, Shivam? We know that through chest pneumonic. Do you remember chest pneumonic are all the things which shows auto-infection? So Cryptosporidium, and then all things which we have seen in two above mnemonics. I hope you know what I'm talking about. H. nana, Enterobius, Strongyloides, and Tinea. So chest is your auto-infection. Fine. Then we have to remove MRSA ka nasal carriage. How do we remove carriers? It's going to be via mupirocin. You give topical mupirocin for MRSA. It is effective. All right. Remember MRSA. What to do with these unheard one-liners? Hear them now. And remember, that's what is my job, no? Whatever should have been heard, I have covered in the first half of micro. Whatever is unheard, I have collected them as questions and I brought them here. So this is the best chance for you to hear them and finish them and have no FOMO now कि हमने PYQs नहीं करे, because I have literally covered every single question from May 2017. Okay. Some of the recent 2023 might have been missed because I didn't have that paper, but बाकी सारे हो गए. 2023 also I've covered mostly for all subjects, but the only thing जो आप सबने anyways करा ही होगा is the latest paper. Fine, but 2017 तक everything else I've covered. All right, so this is MRSA. What is chest? Chest is auto-infection. All the things which cause auto-infection. Repeat: chest, Cryptosporidium, H. nana, Enterobius, Strongyloides, Tinea. If you didn't know chest now, just repeating will not help, because this is a summary of two things on the top. What are the two things on the top? The two things on the top are things which are neha, which are non-bile stained, and things which are floating, which are not floating, which is soot. Okay, so now you will ask me full form of both. No, don't ask. Then transmission assessment survey is carried out for, किसके लिए करते हैं? It is for filariasis. ठीक है, just one liner. ठीक है. Then choose the wrong statement about plasmodium. species. Wrong statement. प्रेजेंस नहीं, एब्सेंस ऑफ डफी एंटीजन इज प्रोटेक्टिव, है ना. डफी का एब्सेंस इज प्रोटेक्टिव. ड्रग रेजिस्टेंस इज सीन. एल्जिड इज सिवियर. रिलैप्स इज इन ओवेल एंड वाइवैक्स. व्हाई? बिकॉज ऑफ शाइजोंट, बिकॉज ऑफ मीरोजोइड्स. दैट इज व्हाई वी गिव प्राइमा क्विन. Okay, it's not stuck, right? Is it stuck? No, I can see myself moving actively. So we have SD plasma destroys lipid envelope. So they are basically asking that which is an unenveloped RNA virus. So just remember, hepatitis A is not enveloped. HIV does have envelope. HCV also, and Hep B is a DNA virus with envelope. We have already seen. Okay? Which is molecutes. So cute. Cute means they don't have cell wall. Who is your cute? Who are your jokers? Mycoplasma, ureaplasma, your jokers which do not have cell wall, and that is why no effect of beta lactams. Beta lactams have no role in giving in mycoplasma. So the drug of choice becomes macrolides. A pneumonia which is treated with macrolides is mycoplasma. Okay. Primary, secondary, very easy. Primary takes more days. Antibody response is more potent in secondary. This is IgM, this is Ig. So affinity obviously is going to be higher in a secondary response, the second time the infection happens. So 4 is the one which is wrong one. Affinity maturation. ये बस याद कर लो आंसर, सोमैटिक हाइपर म्यूटेशन. इफ यू गो ऑन टू अंडरस्टैंड ऑल दिस तो हम यही बैठे रहेंगे 2 बजे तक and we'll still not understand. So remember, affinity maturation is somatic hypermutation. Giemsa stain of a thin peripheral smear is prepared, which cannot be diagnosed. It is Coxiella. Coxiella will not take up the Giemsa stain. Interferon beta is because of virus infection के against beta interferon बनता है. What you have to remember, अरे BTR group link फिर आ गया. I will not send no BTR group link today. I will send it tomorrow in any session on app. Okay. So what you have to remember now in interferon, who produces it? Alpha, beta, gamma. Remember LFT. So who produces interferon alpha? These are going to be your lymphocytes. These are fibroblasts, and these are T lymphocytes. Okay, so we have interferon alpha, beta, and gamma. This is how you will remember this. Okay, gamma interferon is going to be for granuloma formation. A is leukocyte. You are correct. Okay, so lymphocyte or leukocyte, interferon alpha. Okay, then all of the following can be seen intracellularly in hepatocytes except. Ma'am, will this question be repeated in November? Such a nice question, right? You think if I say yes, you will believe me, or if I say no, you will believe me, or should you believe me? मुझे कैसे पता कि नवंबर आने में क्या आने वाला है? अगर मुझे पता होता क्या आने वाला है, would I be taking time to teach you for 15 hours, 19 subjects? No, I will teach for 1 hour, give you 200 question. आपका भी टाइम खत्म, मेरा भी टाइम खत्म, है ना? So if I knew नवंबर में क्या क्या आने वाला है, that would be a great place to be in. But I am not in that place. So if unless somebody is doing a recall session before the exam, you join that, but otherwise we'll have to study everything. So all of the following can be intracellularly seen in hepatocytes except answer is babesiosis. Babesia is in RBC, everything else can be intracellular. अब ये देखो, this is best thing. Okay, this is just wow. All of the features of Zika virus except. So Zika virus can have Guillain-Barré, fever, and conjunctivitis. So here pedicle rash is not common. Now see next question. Next time they asked a pedicle rash is associated with all of the following except. So then they are like, array, roseola infantum has never can have a pedicle rash. It has a very erythematous maculopapular rash. It cannot have pedicle rash. So tab Zika mein maybe you can have pedicle rash. Okay, so this is how it is contradictory, but ऐसे ही है. Okay, जो है वो. Then which of the following is a xenodiagnostic method? Xenodiagnostic method is any time I put the thing into the vector itself. So rabbit is not vector for E-tech, but Aedes mosquito, Indies is vector for dengue. हैमस्टर इज नॉट वेक्टर फॉर लीशमैनिया, इट्स सैंड फ्लाई. डिप्थीरिया का कोई वेक्टर ही नहीं है. सो व्हेन यू इंजेक्ट दैट बैक्टीरिया इनटू वेक्टर, दैट इज व्हाट इज वेरी वेरी इंपॉर्टेंट. स्ट्रिक्ट एनारोब इज प्रेवोटेला. बस, नो कॉन्सेप्ट. Last two questions, just match the following here with the respective host. तो option नहीं दिए मैंने. Diphyllobothrium is cyclops, right? I told you it is cyclops and it is fish. ठीक है. Then we have Paragonimus. Paragonimus is crayfish or crabs. Brugia malai is Mansonia and Fasciola is sheep. Okay, so this is what you need to remember here. Fine. ठीक है. Then which is this virus life cycle, if I ask you? So you can see how it's replicating. It's a double stranded DNA virus, double stranded DNA. So what can I exclude? It can't be corona, it can't be HIV, it can be herpes simplex, it can be HBV. So what do I need to see? I need to see whether it is becoming RNA or not. So I can see how it's not becoming RNA. So this is herpes simplex virus and not hepatitis B. So this is how you are going to approach these life cycle questions. Okay. Yeah, fasciolize fresh vegetation, but sheep भी life cycle में आ रहे थे ना. Now if it's not there in the option, हम क्या कर सकते हैं? We can't do anything, right? So this is what is your HSV will be a better answer here, not HBV. ठीक है? Okay. All right. चलो आगे बढ़े. Oh, we have two more questions. I didn't know. So if you have rodent carriers, rat urine, very very important. This is leptospira. All right. So this is leptospirosis is what you need to remember here. ठीक है. So this is leptospirosis. Leptospira very very important. What do you see? This is microscopic mat. Remember, microscopic agglutination test. Okay, microscopic agglutination test is seen in leptospira. You will have Weil's disease, icterohemorrhagic fever. This is leptospira. Finally, they gave you this image where they asked you to match. Don't sit and study every parasite का ये hook. ठीक है. तो ये हो गया हमारा H nana. So this is the non-bile stained one. This is H nana. This is Diphyllobothrium latum. This is Taenia. This is Ascaris. So this is H nana. So if you are very eager to study all of their heads, this is what they look like. चार जब suckers मिल रहे हैं in a single row. That is what was shown here. 1, 2, 3, 4. These are suckers. This is what is your H nana. Taenia solium, Taenia saginata will have these spaced out suckers. D-latum has just this shape. तो ऐसे करके थोड़ा थोड़ा देख लेना. Okay, fine. So this takes care of micro. Now I'll just give you a break for 2 minutes because I need to go and check on Zara. All right, so I'll be back like in a flash. So you also be back in flash. Okay, just give me 2 minutes. I'm gonna pause my video for 2 to 3 minutes. Come back in 2 to 3 minutes. Okay, fine. ले लो break. Okay, guys, back. Shall we start? I don't know what's the deal with the date and the time. The moment I stop teaching, it goes to the correct time. But when I'm not, when I'm teaching, it goes to 9th Jan. What is this weird, spooky deal? I don't know. Does it happen with other teachers or it's just me? I don't know. Okay. Hemant is saying इस बार repeat questions नहीं आएंगे. Uh, it's okay. Repeat questions never come, but the topics get asked. No, so आप पढ़ोगे क्या इस time पे? What will you study? Anything other than previous year questions is what you want to study? Let's just do all topics which have not been asked. So very little will be left. If you look at the study material of almost the content of almost every faculty, because I do refer to a lot of it and I combine and compile. So uh, it will be based on the topics which have been asked. That's been happening for years. It's never a direct question which is repeated, but it's always those topics which keep getting asked. They twist it more and they ask you such that it appears new. So we have to focus on these areas. These direct questions may not come, but I'm just covering these so that any of these one direct bouncer also comes and you get it right. You get that edge. Because others who have not done PYQs, if this question comes, ऐसा सवाल आ गया प्रेवोटेला स्ट्रिक्ट एनारोब, कहाँ से आएगा? नहीं आएगा, है ना? So this is for extra edge. The second half where I'm solving PYQs for you is for extra edge only. कि भाई ये direct question आ गया तो अच्छा होगा, but बाकी तो हम पढ़ ही रहे ना. We are understanding the concept and that is what we have done. In the last moment, this is what you have to do. Alright, चलो शुरू करें फिर. इससे स्लो जाएंगे तो बहुत मुश्किल हो जाएगा. Very tough. Okay. All right. Thank you so much for your kind words. Let's begin now. PSM. So we now have 2 hours to finish 3 subjects. I think we can do that. 45 minutes, 3 blocks. We can easily do it. चलो शुरू करते हैं. Riketsia, mostly, what do you want to know from Riketsia? Just that one slide of everything you need to know. I didn't include it. I wanted to. मैंने बहुत ज़्यादा पूरा ही micro पढ़ा दिया फिर, इसलिए मैंने वो slide हटा दी. So just remember that one slide. Epidemic typhus, endemic typhus, epidemic louse. Love is epidemic. Endemic typhus, you remember flint, that is flea. Then you have Rocky Mountain spotted fever. Everything else which is tick mediated, remember game pneumonic. So granulocyte is anaplasma. Ehrlichiosis is monocyte. These are all tick-borne. And finally, you need to know scrub typhus and rickettsial pox. These are both by mite. Shushugumashi is scrub typhus. Remember, eschar is there in scrub typhus. But itna kar lo to rickettsial chapter ho gaya. That one slide that we need to know. All right, chalo shuru karte hain then. Okay. All right. PSM. So in PSM, I'm starting with vaccines because this is something which is the highest yield. Okay. Radio is the only subject which I don't have to refer, which I can just teach. You ask me and I can teach. So that's the only subject where I don't have to refer to any other source. Everywhere else, I try to study as much as I can because I don't know if you notice, I can study a lot. So we have national immunization schedule. Here nobody will ask you recite national immunization schedule. So questions are unlikely. What they can ask you is what are the diseases covered in Mission Indradhanush. So Mission Indradhanush, what you want to remember is 12 diseases are covered. So if you know the schedule, you will remember everything. So birth pe I'm giving 3 vaccines. So polio is one of the diseases, TB is one of the diseases, and hepatitis B. Right? Then what you want to remember, 6, 10, 14. 6, 10, 14 is going to be your pentavalent. So penta में ही आपकी 5 vaccine हो गई, out of which one is hepatitis B. So you have DPT, Hep B, and Hib. All right. So these are the 5 diseases. Now we have also introduced F. Fractional IPV is given at Fractional IPV is given alternatively at 6 and 14, and pneumococcal is given at 2. So we have pneumococcal, which is included. Apart from that, we have rotavirus, which is included, and then you have MR at 9 to 12 months. So these are the 12 diseases, 1 to 5, so 7, 8, 9, 10, 11, and then Japanese encephalitis. Okay, so JE is given from 9 to 12 months, and then another one from 16 to 24 months. Okay, so then they ask you questions from delayed immunization. Delayed immunization में आपको क्या याद रखना है? That all of these can be given up to 1 year only. Usually they'll give you 18-month child comes, what can I give? So you can give these vaccines till 5 years, measles, vitamin A, OPV. HIB you give till 6 years, DPT till 7, JE till 15 years, and DT, TT can be given till any age, right? Even in pregnancy, we give DT or TT. Okay, this is what you want to remember. Okay, yeah. Then what you need to remember about is open vial policy. So here it is not applicable. This was the question that was asked, ki MR mein, can I apply open vial? Open vial means if cold chain is followed, an open vial can be used for 28 days. Not applicable for MBJ. MBJ mane MR, BCG and JE. These have to be used on the same 24 hours, same day, same vaccination schedule. COVID and yellow. Rota used to be a part of it, but now has been removed, right? So MBJ, COVID, yellow fever are your exceptions to open vial. Then we have a few. Before I go to this, we have something about heat sensitive, cold sensitive vaccine. So this is your ice lined refrigerator, which is there at what level? PHC. Remember, sub center and villages mein we are going to take our vaccine carrier and day carrier respectively. A vaccine carrier is going to carry around 16 to 20 vials. Okay, this is what you are going to take to a sub center. Okay, whereas a day carrier I'm going to take for village vaccination, which is going to have around 6 to 8 vials for village. 1:1,000 population. Okay, not 1:1,000 population. So this is your day carrier. So in a PHC, this is the smallest place where I can keep it, where I can store my vaccines. Here again, cold chain should be maintained 2 to 8 degrees Celsius. And this is a refrigerator which can go on. Only it requires electricity for 8 hours. ठीक है? अब आपको क्या याद रखना है? कौन है heat sensitive, कौन है cold sensitive? So the heat sensitive vaccines, remember, are going to be so for heat sensitive vaccines, we use this vaccine vial monitor. These are your BCG, which is recombinant, followed by OPV, and then you have varicella, and then you have measles. Okay, so recombinant. अगर BCG lyophilized है, it's not heat sensitive, उसको कोई जरूरत नहीं है. But then you have OPV. So अगर वैसे पूछते हैं, mark OPV. If they ask recombined, not recombinant, reconstituted, my bad, reconstituted, that's BCG. All right. So OPV, varicella, and measles. What you see in vaccine vial monitor is the overall vaccine potency. How has the heat affected the overall vaccine potency? So anything where it is lighter, where the square is lighter than the circle, I can use it. But when it is equal or the square is darker, I cannot use it. Means that the vaccine potency is now gone. It has been subjected to heat. Now talking about the freeze sensitive vaccine. So we have two freeze sensitive vaccines. Remember, hard. Okay, freeze करेंगे तो water hard ice बन जाता है, hard. So you have Hep B and you have DPT. Okay, so DPT की जगह Penta also can be written. So Hep B and DPT are your freeze sensitive. इसके लिए we do a shake test. If your vaccine sediments, it means it has been damaged because of freezing. So now how should I arrange these? This is asked. You know, how do I arrange them? So obviously, heat sensitive vaccines, I'm going to be keeping them in the lower part, है ना, because नीचे सबसे ज़्यादा cold temperature होगा, heat will be ऊपर. So my cold heat sensitive OPV, measles, BCG I'm keeping down, and my freeze sensitive I'm keeping them on the top. Do you see this? So this is how you can predict the arrangement also. All right, so this is about ice-lined refrigerator, cold chain, VVM, shake test. Every important question. Now what you want to remember are the numbers. So ideal WHO ANC visits are how much? 8. Repeat question. Minimum government of India says 3 लगा लो. But ideally government of India says 8 plus 13 equals 11. Okay, so they say 12. Okay, so what you have to remember here are the ideal government visits. So minimum ye or ye. All right. So these are the three numbers that we have to remember here. All right. 13, sorry, not 11, 13. Okay. So 4, sorry. Minimum government of India says is 4. So 8 plus 4 equals 12, but 12 ko bana do 13. Okay. So 8, 4 and 13. Then we have Asha. Asha ka we have home-based newborn care and home-based young child care. Home-based newborn care ke liye itne din pe jana hai 1, 2, 3, 4, 5, 6 visits. But if born at home, we will do at 0. We will do at birth also. And then young child is the new one where 1, 2, 3, 4, 5 visits the Asha will also do at the child to see the child. This is the new update. All right. So we have 6 and 5. All right. So these are the numbers that we need to memorize. Okay. Chalo. Ab jate into all post exposure prophylaxis. ठीक है. तो 3 infections in one page. Very, very volatile, very, very high yield. So now tetanus का क्या करना है? सबसे पहले tetanus में look at the wound. If it's a good wound, less than 6 hours, clean, non-penetrating, no tissue damage, or anything else. So here now I look at the patient. Wound dekh liya, now look at the patient. Has the patient gotten an injection in the last 5 years? No matter what wound, nothing to be done. ठीक है. This is where if you get question, just thank God. Thank you God, दिमाग नहीं लगाना पड़ा. Less than 5 years, कुछ नहीं करना. If it was 5 to 10 years, then also you can thank God, because no matter what the patient is, good or bad, एक टेटनस लगा दो. थैंक यू गॉड, टेटनस लगा दो. अब थोड़ा दिमाग लगाना पड़ेगा. इफ दैट टॉक्सॉइड वाज मोर देन 10 years, now you have to apply the mark and classify wound. If it was more than 10 years, agar good wound, only toxoid, but bad wound will also require immunoglobulin. ठीक है. So this is the only place where you have to use brains, because if it is B, वैक्सीन ही नहीं हुआ और unknown, again it's very obvious, you complete course and you give immunoglobulin. So the only thing you want to remember is this one. ठीक है. More than 10 years. So this is for tetanus. Let's now go to rabies. Again, I first need to classify the wound. टचिंग हो गया, इंटैक्ट स्किन हो गया, नो प्रोफाइलैक्सिस रिक्वायर्ड. निबलिंग हो गया, माइनर स्क्रैचेस विदाउट एनी सॉर्ट ऑफ ब्लीडिंग, जस्ट डू वैक्सीनेशन एंड लोकल ट्रीटमेंट. बट इफ यू हैव blood coming out, or you have broken skin or mucosa or bats, anything which is khatarnak, I need to now give immunoglobulin in addition. Okay, so here let's now talk about the vaccination regimen. So jitne letter hai utne days hai. This is as easy as it gets. Re-exposure मतलब एक बार कुत्ते ने काटा फिर से कुत्ते ने काटा. Re-exposure 0, 3. Pre-exposure, you have full confidence in your ability कि मुझे कभी ना कभी कुत्ता काटेगा ही, so let me take vaccine. So that is pre-exposure. 0, 7, 21. Don't remember dates. 3 letter, 3 ये. Then you have post exposure. This is where कुत्ते ने काटा, now you are going. So thigh and SN. Thigh and SN में क्या important करना है? थाई में 4 लेटर है, so 0, 3, 7, 28. This is what is recommended now. These are 4 days, but what I do is every time I have to give 2 intradermal injections. Okay, so technically 8 injection, 2 intradermal. SN is where you call 5 times, because 5 letters. 0, 3, 7, 14, 28. Okay, so these are 5 letters, 5 times, but हर बार एक ही injection लगेगा IM. Okay, so this is what you need to remember. Okay, all right. Slight oozing is which cat? Meaning? Slight oozing will be category, okay, category 2. Okay, so which cat? So we're talking about dogs. So rabies, and then we have tetanus. Now let's talk about diphtheria contacts. So diphtheria contacts में every contact, remember, irrespective of vaccination status, is going to get throat swab. You have to monitor ki symptoms ho rahe hain, and everybody gets erythromycin. Now what you have to remember is, if the booster is within 5 years, if that person has gotten booster, you need not do anything. All right, nothing else needs to be done. Just give them erythromycin. If booster was more than 5 years, then what do? Then you just give them one more diphtheria toxoid. Okay, give them diphtheria, toxoid, and then what you have to remember? You may be wrong, but BTR में 02 लिखा हुआ है. No, it's 03 only. Even if it's 2, it's okay. I think it's a minor thing. Okay, you can just check. And unimmunized is antitoxin also. Now I have to give this portion, and I have to give diphtheria toxin, and I mean complete vaccination series. Okay, so this is what you need to remember. Fine. तो ये हो गया हमारा डिप्थीरिया कॉन्टैक्ट का स्टोरी. सो दिस वाज द क्वेश्चन फ्रॉम रेबीज. अभी के अभी कर लो. A child presents with slight oozing. So I am wrong. That is category 3 wound. All right. Because you look at the options and it makes you say it is category 3. Okay. So slight oozing. If oozing is blood, है ना, तो जैसे मैंने बोला अगर blood है जो ooze करे, just like not blood oozing, which is what? So if it's slight oozing, I stand corrected. It is category 3 wound. Do you have to wash the wound with normal tap water? Answer is yes. Do you clean the wound? Yes. These are the 2 things that you have to do. But never suture a dog bite. All right. Never suture snake bite, dog bite, any bite को suture तुरंत मत कर दो. Do I have to give equine immunoglobulin? Yes, but not twice. So this is wrong. Intradermal vaccine, 4 things. Yes. So 4 regimen, thigh regimen. So clearly 6 needs to be there. So this is wrong. Clearly 5 is wrong. So answer becomes D. 1, 2, 3, 6, which fits with what I have told you. Okay. So this is about 12. Oh, इसमें answer है. I am sorry. चलो तो ये हो गया. ये आई एम स्टिल नॉट सीइंग. यू सी हाउ माय फोकस इज सो शार्प. आंसर इज गिवन. आई एम नॉट इवन नोटिसिंग इट. So this is how you have to be so focused in your purpose. Now let's go to post exposure prophylaxis of HIV and Hep B. So I have just collected everything that you are gonna get wrong in these 2 slides. So just revise this. Then in HIV, what we have to remember, what is the most common route of transmission? It's sexual transmission. Obviously, it's most common, but the efficacy is pretty low. So if they ask you by efficacy wise, what is most efficacious, then that is blood. Via blood, HIV gets transmitted most. Okay, so that is what you want to remember. So we can suture, but not immediately. All right. So remember, we may suture the wound, but not immediately. So this is the best answer which fits. In fact, look at the options. 4 तो उन्होंने बोला कि तुम रहने दो. We are not giving only. You don't use your brain. It's not there only. So what can I do? Okay. Anyways, it's not there in the option what to do. चलो ये देखो अब. So blood is 90%. All right. Also remember vertical transmission of HIV is 30%. अभी इस पे ध्यान दो. Don't go into details now. We are not doing thesis. We have to complete 3 subjects in 2 hours. So post-exposure prophylaxis, what do you do? Any needle prick post-exposure is TLD. So tenofovir, lamivudine, dolutegravir. Remember, TLD is your post-exposure prophylaxis. Begin within 72 hours and you have to give it for 28 days. For 28 days, you have to give post-exposure prophylaxis. Now, if there is a pregnant female who is diagnosed with HIV during pregnancy only, what will you do? Same. She has to start HRT. She has to start antiretroviral therapy. She has to start TLD. Newborn of a mother on ART. If you are a newborn whose mother was on ART, what will baby get? Baby will get nevirapine for 6 weeks. Very, very important. Baby will get nevirapine for 6 weeks. But if mother was not on ART, mother is not on ART, that's a high risk baby. What do we have to do? In addition to nevirapine, I am also going to start zidovudine. So nevirapine and zidovudine is what is started, and you will also give them prophylaxis. TMP SMX prophylaxis is given from 6 weeks till 18 months against PCP, right? This is against pneumocystis jirovecii pneumonia. Okay, so this is about this HIV prophylaxis. Now let's talk about Hep B. So let's say you got a needle prick in the emergency. You were vaccinated against Hep B. What is the first thing we will do is to see your titer. If titer is more than 10, very important, nothing else needs to be done. If titer is less than 10 or you are not vaccinated, you will get the vaccine along with HBIG. Okay, so same thing, you will get the vaccine with immunoglobulin. Itna sa yaad rakh lo. Fine, this is about this. Now let's start with person who is on ART with relation to ATT. So everybody is going to start now. There is no cutoff, no CD4 जिसके ऊपर start करेंगे. Previously we used to take 350, 500, nothing like that. Anything you start. But also person comes out to be TB positive. अब क्या करेंगे? We have to start ATT first. Okay, we have to give ATT first, because otherwise you can have iris, immune reconstitution syndrome. The immunity improves because of ART and the TB can exacerbate. Okay, so we don't want that. So you start ATT first, and then between 2 weeks to 2 months you will start ART. The only thing in ATT you change is when ART has started, don't give rifampicin, give rifabutane instead. ठीक है, ये हो गया हमारा question here. Then few international health points from PSM. So now this is core PSM that I'm going to teach you. USAID is the one which is taking care of everything: family planning, TB, HIV. International Red Cross, remember, disaster and war, disaster management. Right now war is going on, so it may be asked who is the organization taking care of war victims. It's going to be International Red Cross. Ford Foundation is also a repeat question. They have aided in the construction of toilets in the rural area. Very important question. Rockefeller Foundation may be asked. This has been responsible for development of All India Institute of Hygiene and Public Health. Just remember this name, okay? Hygiene and Public Health. किसने करा? Rockefeller Foundation. SIDA and DANIDA, I am sure you know these two programs. SIDA is aiding in the TB program and DANIDA is aiding in the blindness program. Colombo plan was asked last time. It is for cobalt-based radiotherapy plants, okay? So CO is CO. Just remember this one list, okay? All right. Next question is about units. Just see this, like very crazy question they ask you. Luminous intensity is candela. यहाँ पे याद रख लो cross mnemonic. So flux is not lux. Lume is lume. So this is cross mnemonic. You will remember कि ये ऐसे ऐसे है. ठीक है? I hope you know what is cross mnemonic. So this is about these units. Now going on to biostats, because AIMS will love to ask you biostats. What is this plot known as? This plot is what is known as your forest plot. This is to compare different studies. So what is a study of studies? It is a meta-analysis. So here I have studies by all of these authors and I'm comparing. My question for you is, which is not a significant study out of this? Which should the meta-analysis exclude? So remember, anything where one comes in between, all right, anything where one comes in between is not significant, because what are you saying? You are saying that bhai aapka risk factor bhi hai aur aapka protective bhi hai. 0.5 means protective, 2.6 means risk factor, so that's not a significant study. Hatao isko. Anything where 1 and 3.4, again you are saying no association and risk factor, hatao isko. 0.9, 3.2, hatao. This is the range that they are giving, right? This is the range. This can be used, this can be used. So these are the two studies I'm going to select and then analyze the cumulative difference. So this is forest plot. Then what tests the publication bias? Remember, funnel plot is for publication bias. So anything where the results are, arranged symmetrically around the peak, it's something where you have no publication bias. And now treatment and PP is both this only. Okay, it's both PP and treatment is TLD is the first line treatment. Fine, you can just check Simran. Next, what you need to remember, so anytime there are missing points, so this means asymmetric funnel plot, so there is publication bias. ठीक है? So ये हो गया funnel plot. Now let's talk about these guidelines. Just read them once. Don't need to like sit and memorize. RCT के लिए we have consort guidelines. Remember, for systematic review we have Prisma. इतना ही याद रख लो, बहुत है, because others are not very very important. These are not impact studies. Randomized trial and systematic reviews have the highest impact, right? Highest is meta analysis, then systematic review, then RCT. Okay, तो इतना याद कर लो तो बहुत है. Fine. Now what you have to remember are few numbers again. So iodine RDA has been tested. So child में 90, 150, 250, 280. 280 याद रख लो, 280 micrograms per day is the iodine requirement in lactation. ठीक है? Then caloric requirement in pregnancy has been tested. Grossly याद रख लो 350, 450, but lactation में maximum है, not 550 but 600 and 520. So just remember 300, 400, 500, 600. 600 होता है lactation 0 to 6 months. That is what you need to remember. Then which program are we talking about? Anemia Mukt Bharat. 6 into 6 into 6. 6 beneficiaries, 6 type of techniques they have, and 6 infrastructure they have. Okay. So who are the 6 beneficiaries? They are listed. Remember the dosages. So what you need to remember, iron, again 20, 40, 60. But it's 45, not 40. So grossly याद रखो 20, 40, 60. Folate का कैसा है? 100 microgram. So this is mg. 100, 400, 500. Okay, so this is how you will remember two sets of numbers. Now in छोटू babies 6 to 59 months, I give them bi-weekly. Week में 2 बार syrup पिलाएंगे. Then everywhere you are just gonna remember it is weekly, except pregnant and lactating where you already know it is going to be OD. So बाकी सब में it is going to be weekly. So no need to stress about this table. Just these two numbers we have to remember. Fine. So this is anemia mukt Bharat. Now let's talk about a few formulae from biostats that you guys struggle with. Very, very important. So this is the formula for standard deviation. Okay, this has been tested twice now. So this is standard deviation where every individual data set you minus with the mean and you add them up upon the sample size minus 1. Coefficient of variation is, they will not ask you to calculate SD, they'll just ask you formula. Coefficient of variation is SD square. What is, variance is what is variance is what is SD square. Coefficient of variations is to compare two different studies. So what you have to remember here is this is standard deviation upon mean into 100. What does this mean? Look at this question. There are two different studies which I am telling you. One study had diastolic pressure with standard deviation this, and the other one has vitamin D with standard deviation this. So there are two different studies. So now what do I need to do is calculate their coefficient of variation. So SD by mean into 100. So पहले DBP का क्या है? 11 upon 110 into 100. And vitamin D का क्या है? Standard deviation upon mean into 100. Right? This is what you have to do in both the cases. So क्या बन जाएगा? This becomes 10. 10 is the coefficient of variance. इसका क्या बन जाएगा? 6 1 जा 6, 40. So 16. So I can say that vitamin D, I hope my math is correct. In front of 5,000 people, I don't want to. So this is vitamin D where you have more. So the answer will be coefficient of vitamin D is more than DBP. Okay, as simple as that. देखने में डर सा लगेगा. What are you asking? But when you end up doing it, it's pretty easy only. Okay, मेरा math सही है. I will get to know 1 minute later that I was right or wrong, but ये है, ठीक है? Now, what is standard error of mean? Very, very important. This is when you generalize it to the population. So this is standard deviation upon under root of n. Okay, standard deviation upon under root of n. Agar proportion, don't stress too much about it. If they specifically write proportion, then you will do then you will do PQ. P is the prevalence they will give you, any 1% they will give you. So if P they are giving as 40%, Q will become 60, 100 minus 40. Okay, so PQ upon N is what you will do, है ना? So this is about under root PQ upon N. INI में तो pen देते हैं, they probably give pen. Even if they don't give you, तो आप mentally कर सकते हो, इतना कोई tough math नहीं है ये. Sample size is 4 PQ by D square. Okay, so 4 PQ by D square is what you need to remember. D is the absolute error. Okay, D is absolute error. So this is what you need to remember here. Hemant, you are confusing confidence interval with this OR values. Okay, you will get to learn in a while. थोड़ी देर रुको, I will only teach you. So this is sample size for, ये बस formula याद रख लो. They will give you absolute error. We just have to do 4 PQ. All right. Now 3 indices. We have HDI, we have PQLI, and we have global hunger index. Development starts from birth or after 1 year? Starts from birth. So you will remember life expectancy at birth. For development, you need money, you need schooling. है ना? Knowledge चाहिए, knowledge के लिए पैसा चाहिए. So knowledge is schooling. For school, going to school, you need money. So knowledge, schooling, income, life expectancy. 0 is HDI. Now talk about PQLI. PQLI में you have to remember LI. Focus on LI. This is life expectancy at 1 year. L1. L1 से ही हो जाएगा literacy and 1 से ही हो जाएगा infant mortality rate. So this is how you will know. All right. Now global hunger index. The focus is on 5. So underweight in children 5, death before 5, I mean death in under 5, and total population which is hungry. That is the name itself. Okay, so this is what you need to remember. So HDI, PQLI, global hunger index. So these are the parts of this. Now let's talk about the health programs and their symbol. This is Janani Suraksha Yojana. This is to promote institutional delivery. So here what we are doing is we are giving money to mother also. We are giving money to Asha also to promote more institutional delivery. Then we have JSSK, Janani Suraksha Shishu Suraksha Karyakram. Here we are giving everything free to pregnant females. Let's say this is pregnant female and to baby who is less than 1 year. क्या क्या फ्री दे रहे हो? Transport, so pick up drop you are giving them delivery, drug, diagnostic, transfusion, सब कुछ आप उनको free दोगे. That is JSSK. Then what you have to remember is PM सुरक्षित मातृत्व अभियान. SMA, SMA याद रखो. SMA is for 9th of every month is your free ANC day, free checkup मिलेगा. Then लक्ष्य में Q पे ध्यान दो. This is for improving labor room quality. Okay, so this is labor room quality. Then let's talk about the others. This is Suman. Suman is for postnatal care till 6 months. So this is for mother. Nobody till now was focusing on mother after delivery. This is the one which said that mummy ki health bhi to important hai 6 mahina. So that is Suman. Then we have RMNCH, which they have now made as RMNCH plus N. So what is the plus N? So reproductive, maternal, newborn child, and also adolescent, and N is for nutrition. So just remember now RMNCH में plus N is nutrition. All right, so this is what you need to remember here. Then we have all confusers lined up. We have Ujala, Ujjwala, Ujjavala. ये सिर्फ इंडिया में हो सकता है ऐसी चीजें कि एक डिपार्टमेंट ने अपना उजाला डाल दिया, दूसरा डिपार्टमेंट इज उज्ज्वला, तीसरा डिपार्टमेंट मिनिस्ट्री इज लाइक हमने उजावला लॉन्च किया है. यू सी स्पेलिंग, यू डिसाइड विच मिनिस्ट्री. ओके, तो हाउ टू रिमेम्बर दिस इज जैसे जैसे स्पेलिंग बढ़ता जाएगा वैसे वैसे यूज इम्पैक्ट विल इंक्रीज. सो उजाला इज फ्री, लैंप दे दो, एलईडी दे दो, get a low impact, small name. Ujjwala is fuel, okay, relatively important, safer fuel, Ujjwala. Biggest problem is trafficking, right? So biggest spelling, Ujjwala. So this is what you want to remember. फिर एक और बार निश्चय, निक्षय, निकुष्ट they have launched. So what is, how to remember first of all? So here first you remember निक्षय में अक्षय. Akshay Kumar has made every movie except TB, which will be probably next because none of his other movies are working. So he will have to make some movie which is close to government. So this is TB. So Nikshay is for TB. ठीक है, इसमें हम क्या देते हैं? हम पैसे देते हैं. We give 500 per month every month for your nutrition. Nikusht बीमारी, कुष्ठ बीमारी means leprosy. Okay, so Nikusht is for leprosy and Nishchay is for free UPT, which Asha is giving to mothers. Okay, not mothers, probable mothers. So this is free UPT. Ab Sapna kaun hai? Sapna is the mascot for leprosy again. What is Sparsh? Somebody will write Path in chat. Yes, Sparsh sir is Path teacher, but Sparsh is also something which is a part of leprosy program. ठीक है? And Meena is the girl child mascot for UNESCO, for UNICEF. Okay, so this is for UNICEF mascot, WHO mascot overall. Okay, so this is girl child mascot. Fine, so this is what you need to remember here. Fine, तो ये हो गया हमारा health program. तो अब जाते हैं into all of the PYQs. ठीक है, रिसर्चर तो ये वो हेमंत का डाउट सॉल्व करेगा अबाउट पी वैल्यू. तो हेमंत ने बोला है बट बहुत सारे लोगों को और डाउट होगा. मीना में यूनिसेफ ही दिखा ना मैंने, हाँ. So researcher discovered a new drug which is effective in chronic hypertension with a p value of less than 0.1. What does it mean? What is the meaning of p value? सबसे पहले तो ये बताओ. इसके लिए हमें जाना पड़ेगा into the depths of alpha error and beta error, which is very painful only for me to teach, but still I will teach you. So सबसे पहले सबसे easy से, the probability of attempting alpha error, of having alpha error, is known as p value. इसको in simple terms remember, how much is the chance that something is going to happen by chance. Okay, so what is the probability of a result coming by chance is p value. So we don't want every result to come by chance, है ना. तो अगर आपसे कोई पूछे आपका rank 1 आया, what is probability that it is just by chance, you just got lucky, you are not intelligent but still you got lucky. We don't want to hear that ना. Rank आने के बाद कोई बोले तेरा तो by chance आ गया. So we want to keep that p value less, कि लोगों का by chance कम rank आए, कम result should not come by chance. So पहले ही we have set the limit that p value should be less than 0.05, meaning probability should be less than 5%. So now when I say p is less than 0.1 means 10% result should not be, like 10% ke beyond should not be by chance. So look at statement A, not more than 10% could be by chance. Understood this? So this is about p value ka meaning. Now understand alpha error, beta error by two examples. Okay. Now, let's say we are back to COVID pandemic times. During COVID-19, I make a new drug. Okay, I am making a new drug which is actually bakwas drug. Okay, it is something like cow urine I have taken, and then I am saying that my drug is better than your steroid. Tum steroid de raho, ye lo cow urine lo. So I am saying my drug is actually better. Okay, but actually it is bakwas drug. It is a bad drug. So now what happens when my study says that your drug is actually good drug, your public is going to take that drug. So public is now actually taking a very bad drug thinking that it's a good drug, isn't it? So do you agree कि ये तो बहुत खराब चीज हो गई, that the public is now taking cow urine unnecessarily? So this is bad error. This is the worst error, which is known as type 1 error. The other error, which is type 1 or alpha error, the other problem here, remember, is going to be that my study said your drug is kharab drug, your drug is a bad drug, but actually it was a good drug. So what happens, that my public is now deprived, is the buzzword you remember. My public is being deprived of a good drug because my study said your drug bakwas drug. That is a beta error. Okay, so this is what you will remember, that public taking bad drug is bad error, type 1 error. Public deprived of good drug is beta error. Okay, with that, now read this question. RCT comparing efficacy of two drugs showed a difference. Whenever I say showed a difference, p value is significant, less than 0.05. मतलब क्या है इसका? That my study said good drug, but in reality no difference. Reality it is not good. मतलब काव urine, study ने बोला अच्छा अच्छा दे दो, actually not good. So this is an example of alpha error. Did you understand this, everybody? If you just remember these 2 points, you will not go wrong. Okay, fine. The other thing you can remember, alpha error is false positive. Remember, alpha fetoprotein, beta error automatically becomes false negative. Fine. Which of the following is not a parametric test? Friedman is not parametric. Student T, ANOVA, Pearson are all parametric. Just have to memorize. Another most important is chi-square, which is a non-parametric test. Okay. Next. Okay. Under RBSK screening, which is not covered, just need to remember congenital glaucoma is not covered. Cataract, ROP, vitamin A. Now don't sit and memorize all 30 diseases which are covered or 28 diseases which are covered. Glaucoma is not covered. ये आपको पता ही है, विलेज लेवल पे आशा बनाती है ये विलेज हेल्थ सैनिटेशन न्यूट्रिशन कमिटी. आशा is what is supervising this committee. The midday meal program. So what I am doing here is 1/3 calorie, half protein. Okay, so आधा protein, and because it's one है ना, एक ही meal दे रहे हो, so 1/3 of the calorie of the day we are giving via this. Okay, now very important conceptual question from sensitivity specificity. So first have a look here. Here they ask you, ये देखो जरा, what you have to see here is B to A. If I shift that my cutoff is no longer B, but my cutoff is A, What will change? Sensitivity, specificity, how will it change is what we need to remember here. So what you see is one thing. When I go from B to A, my false negative is decreasing, isn't it? My false negative is decreasing. How you have to go about it is Fn is inversely proportional to sensitivity, Nn. So sensitivity will increase. Now both ends stick together. SN NPV increase, specificity PPV decrease. This is how it always goes. Sensitivity NPV same direction, SP PPV this direction. This is what they asked you. If I now change from green to pink, meaning now do you see, I am decreasing both false negative and also false positive. Both I am decreasing, then what will happen? FN कम करा तो सेंसिटिविटी बढ़ गया, FP कम करा तो स्पेसिफिसिटी बढ़ गया. So what does this mean? It means my answer will be both of them are increasing. Did you understand? So this is how you have to approach this question about false negative, false positive. Do you want to remember series and parallel also? So series and parallel, I'll give you an example which you will like or you may not like. So series and parallel. Series ka meaning hai that I will give one test, only those who are positive will be eligible for the second test. Meaning I will give you next one exam. Only people who will clear next one exam will get next two exam. Who will clear next two exam will be declared as passed and will get a seat. So now tell me, इससे overall कम पास होंगे, ज़्यादा पास होंगे? Overall people will pass less, so the sensitivity decreases, but jo pass honge, whoever is passing is going to be really good, so the specificity increase. With this I can also see NPV decrease, PPV increase. Parallel means I am giving you exam on 5th of November INICT, you write it on 6th of November also. Whichever is better, wherever you are positive, I will accept that. So I administer two tests. Wherever it's positive, we take that as positive. So now do you agree more people will clear? Sensitivity increases, NPV increases. Specificity decreases, PPV decreases. Understood this? Now you will never forget both of these. Okay. So ये हो गया हमारा series and parallel. ठीक है. Now, next question, not involved in meta-analysis. So we select studies, we analyze study, we do abstraction, but randomization is not something that you do. Randomization is done in an RCT, not in a meta-analysis. Okay. Now we talk about, this is just a fact-based questions. Now all are fact-based only. Mobile medical units. So these are run by government. Okay, these are run by external agencies and medical supply can be given by government. So these are also run by government and given by government. Basically, they are not run by external agency. कहना ये चाह रहे हैं. So answer is 1, 2, 3. Okay. अब बताओ, when can a patient with dengue hemorrhagic shock be discharged? After return of appetite. This is true story. I had dengue last year, last year, and they did not discharge me when my fever went because they said that febrile phase khatam hoga, then you have platelet which start to decline, right? So they didn't discharge after fever was over. Urine output to, because they give you IV fluids, it's always normal. And not after recovery of shock. It's after your appetite returns. That is one of the things for discharge. HIV sentinel includes all except. So the general population proxy is antenatal. So this is included. Then we include these migrants and truck drivers because they are high risk. So commercial sex workers and your bridge population. Bridge population माने जो ये sex workers से लेके normal में फैलाएंगे. Like male migrants, like truck drivers. So those are included, but STD clinic is not included. Okay, that is what you remember. Perinatal mortality. Two formulae you want to remember is stillbirth rate and perinatal mortality rate because their formula is slightly different. In perinatal mortality rate, it covers both, है ना? So this is the best indicator of combined obs and pediatric care in a country. So perinatal में हम क्या ले रहे हैं? Anybody who is more than 28 weeks plus stillborn or till 7 days of death. So perinatal mortality rate and total birth is the denominator. Stillborn is any stillborn who is more than 1000 grams or who is born more than 28 weeks upon total birth. ठीक है? This is what you need to remember. ठीक है? तो ये हो गया पेरीनेटल एंड स्टिल बर्थ रेट। तो इसमें क्या आएगा न्यूमरेटर में? नॉट पोस्ट नियोनेटल, अर्ली नियोनेटल, yes. Stillbirth of fetus can also be included. So if they give you multiple, this is included. But see this is less than 500. So we don't include less than 500. We include more than 1000 grams. So ये नहीं include होगा. And abortion after 16 not included. 28 weeks वाला. So the answer is going to be early neonatal death B. ये बस पता होना चाहिए किसका लार्वा है, बस एक बार देख लो, बाकी कुछ खास इसमें है नहीं। सेप्टिक टैंक है। सो डर्टी में कौन रहता है? डर्टी में रहता है क्यूलेक्स। ओके, सो डर्टी वाटर इज क्यूलेक्स, सो आंसर इज क्यूलेक्स। बढ़िया, ऐसे अगले वाले का ही आंसर दिया करो तो मुझे वो टाइम पे मिलता है, ठीक है। हमेशा बोलो मैम नेक्स्ट का ये है। anemia mukt bharat, mild to moderate anemia in pregnant female. So now we are not giving prophylactic, we are doing ट्रीटमेंट। ओके, हाँ, डिनोमिनेटर में टोटल बर्थ्स होगा, लाइव बर्थ नहीं होगा बेटा, इसीलिए मैंने बोला कि ये एक्सेप्शंस है, बाकी एवरीवेयर यू विल हैव लाइव बर्थ, यही दो टोटल बर्थ होगा, ठीक है। नाउ हाउ डू वी ट्रीट माइल्ड टू मॉडरेट अनीमिया? सो obviously we have to now give the treatment BD. अभी तक OD तो prophylaxis दे रहे थे, now we have to give BD. But if there is non-compliance, now you have to give IV iron sucrose. So others are clearly wrong. 3 तो देना ही नहीं है। 2 iron folate OD plus sucrose, no, ये नहीं work करा, then sucrose, and not just IM. Okay, so this is the best answer, which is B here. Fine. Then VVM, this I've already told you. So this is for monitoring heat exposure of the vaccine. This is a true statement. Cumulative exposure to heat, this is a true statement. Efficacy of vaccine, no, this is testing the potency. Remember, this is testing the potency of the vaccine. Can I calculate expiry date? ये कहाँ से आ गया? No, this is only for heat, है ना, ये expiry date और ये सब नहीं करना। Same in color है तो use कर सकते हैं? No, it has to be lighter, the square has to be lighter. So answer क्या बना? 1 and 2. So answer is going to be 1 and 2. Fine, that is what you need to remember. ठीक है, all of the following can be done to remove confounders except all of the. All right, one of you has clarified on MMU that it can be run by external agencies, but the supply has to be government only. Fine, so that I think this is the buzzword, that supply has to be from the government. Fine, yeah, so that's what we noticed, right? Run by external with government. ठीक है, बेसिकली मोरल ऑफ द स्टोरी है कि गवर्नमेंट होनी चाहिए, है ना, वन ऑफ द रोल हैज टू बी गवर्नमेंट, या तो रन कर लो या सप्लाई दे दो, दोनों एक्सटर्नल एजेंसी नहीं होना चाहिए। दैट इज हाउ यू रिमेंबर, ठीक है। चलो, व्हाट ऑफ विच ऑफ द फॉलोइंग कैन बी डन टू रिमूव कन्फाउंडर्स? ब्लाइंडिंग इज व्हाट आई डू टू रिमूव बायस, इट्स नॉट टू रिमूव कन्फाउंडर। व्हाट इज दैट कन्फाउंडर? इट इज एनी फैक्टर विच इज लिंक्ड विथ रिस्क फैक्टर एंड डिजीज बोथ। ओके, बोथ में वो लिंक्ड है, बोथ में वो आना चाहिए। लाइक लेट्स से कॉफी, स्मोकिंग एंड CA lung. So this is hypothetical. Okay, let's just all pray that coffee is not a risk factor for CA lung. Otherwise, we are all doomed. So coffee is linked with smoking. People who smoke more have caffeine more, and coffee is also independent risk factor. So this is an example of a confounder. But something like asbestos. Okay, asbestos meaning smoking CA lung. People who are working in an asbestos factory will have higher risk, but it's not linked with both. इसको बोलते हैं इफेक्ट मॉडिफायर। दिस इज व्हाट वी कॉल एज एन इफेक्ट मॉडिफायर। ओके, सो ये सब हम रिमूव कर सकते हैं बाय रैंडमाइजेशन, रिस्ट्रिक्शन, मैचिंग। मैचिंग इज फॉर नोन कन्फाउंडर। ओके, ओनली व्हेन आई नो कि भाई कॉफी है, यू विल रिमूव इट फ्रॉम बोथ द ग्रुप्स, बट अदर्स आई कैन यूज फॉर both. What is the best method if I ask you to remove confounder? Thank you, Komal. What is the best to remove unknown confounder? दो को मिला दो। स्ट्रैटिफाइड रैंडमाइजेशन, स्ट्रैटिफाइड रैंडमाइजेशन, दो मेथड को मिला दिए। ऑप्शन में होगा ब्लाइंडिंग, ब्लाइंडिंग इज नॉट वन ऑफ द मेथड्स। सैंड फ्लाई डज नॉट ट्रांसमिट फ्रेंच फीवर। ओके, तो लव, यू नो हाउ लव इज एपिडेमिक, सबको ही लव होता है, right? So that's our mnemonic. Love is epidemic, epidemic typhus, epidemic relapsing fever. But then if your heart is broken in love, you are down in the trenches, right? So you fall down in trench. So that's how you'll remember कि वैसे तो love अच्छा होता है, shiny shiny दिखेगा, है ना, shiny shiny insect, we become shiny in love, but trench में भी love ही गिराता है. So that is trench fever. Okay, so that is sand fly, that is not sand fly. Then what you have to remember, linear regression. Linear regression का equation है y equals a plus bx. Okay, तो माइनस तो आ ही नहीं सकता, b मतलब एक नंबर होना चाहिए, so answer is c. All right, c is what fits here, y equals a plus bx. This is the formula for a linear regression. Okay, चलो ये हो गया. This completes PSM. So 3 subjects done. Biochem, anat. Biochem, these were 2 of my most hated subjects. But now I like biochemistry. Now anat still remains my only hated subject, which I hate to teach and study. बट अब मजबूरी है, करना पड़ता है, सो वी विल डू. बट पहले बायोकेमिस्ट्री, ठीक है. अभी कॉफी ब्रेक, फिर से कैसे कॉफी ब्रेक, अब तो सीए लंग की बात हो गई, अब कॉफी नहीं पियेंगे. ओके, सो नाउ वी विल स्टार्ट. चलो, मुझे कौन सा सब्जेक्ट नहीं आता अभी देखो बताया, एनाटॉमी. ऑलराइट, चलो लेट्स स्टार्ट. मैम लर्न मैथ्स ना, ठीक ठाक ही मैथ्स किया है. टुडे इन लाइव इन फ्रंट ऑफ 5000 पीपल आई हैव डन, what did I do? I did 100 divided by 6. Can a person with poor math do that? I don't think so. Okay, so I think even that problem now I have worked upon. My AC has stopped working. Okay, so this is about this. Chalo, shuru kare. Number needed to treat agar dekhna hai, see bonus BTR na. First half of bonus BTR only I have taught you. तो वो मैंने आज नहीं करा, बाकी उसमें कुछ नहीं है. सी इवेंट रेट एंड सी द अदर रेट. ओके, नॉन इवेंट रेट और इवेंट रेट में से सब्ट्रैक्ट कर दो एंड उसको उल्टा कर दो. दैट इज योर नंबर नीडेड टू ट्रीट. एट्रीब्यूटेबल, आई मीन ARR, एब्सोल्यूट रिस्क रिडक्शन को हमें कम करना है. इफ यू अंडरस्टैंड दैट, दैट्स गुड. अदरवाइज जस्ट सी दैट आई हैव गिवन यू एन एग्जांपल देयर. ठीक है, आई डिडंट सी दैट क्वेश्चन सो आई डिडंट ब्रिंग इट अप. चलो शुरू करें. All right. No, Mega BTR1 will not be made live, Dr. K. I'm sorry. You need not type it again, but I'm very sorry. It's available on the app. Okay, you can get it from the app. All right, let's start. So all one-liners in this one slide. So we are going very heavy on molecular biology because AIMS loves to ask molecular biology. And then we have vitamins, and then we have a few facts for you, very high. All of these slides I think I've worked the most hardest on biochemistry. चलो शुरू करते हैं. ओह सॉरी. चलो, insulin mediated glucose uptake is by what GLUT receptor? GLUT4. GLUT4 is present where all? Muscle and fat. Okay, so we have fat, we have muscle. What muscle? Skeletal muscle and cardiac muscle. Okay, so this is insulin mediated. Who has highest thermic effect? The highest thermic effect is going to be with proteins. All right, so all of these are one-liner questions that we need to remember. Okay, so this is protein. RQ of carbs is 1. Respiratory quotient of carbohydrates is 1. Just remember these questions. No, was a one-liner ही है. Wobble hypothesis is because of degeneracy. What is degeneracy of codons? It means that out of the 3 base pairs, the third one is ऐसे फालतू. That's I read pharma in a very wobble degenerate way. मैं ड्रग का आगे का नाम याद कर लेती हूँ, पीछे का पढ़ती नहीं. Fast we read, no? All of you have also become like me only. So we don't read Purana because in option it will be given, right? So in the option it will be there. So that's how you be fast readers. Pura nahi padhna hai, fast padhna hai. So degeneracy. Third one, they can change position and it will still remain the same. So degeneracy is because of the third codon position. That's the wobble hypothesis. Liver can't utilize ketone bodies. Why? Because it lacks what enzyme? Thiolase or thiophorase? Thiophorase. Okay, forase. Lase to liver है ना. लिवर में ल है तो ल तो होगा ही उसके पास. So thiophorease is absent, that's why it can't utilize. Fluoroacetate inhibits what? It inhibits the Krebs cycle because it inhibits the enzyme aconitase. It inhibits aconitase, hence inhibits Krebs cycle. Whereas if I ask you sodium fluoride inhibits what? It inhibits enolase of glycolysis, right? That's why I'm using this in the gray vial of glucose estimation. ठीक है. Kcat by Km, just the formula has been asked. This is enzyme efficacy. Remember how vaccine vial monitor was potency and not efficacy? So efficacy is like मुझे तो कहीं answer लो. So we are like okay, efficacy. You are answer here. English translation, we took potency in VVM, so efficacy is like take me somewhere, so we took it here. So Kcat by Km is efficacy. Okay, then HbA1c estimation is ion exchange chromatography. Okay, ion exchange chromatography. Okay, this question has somehow come twice. Okay, this has been asked twice now, that kaun-sa study is best for HbA1c estimation. This is just two facts I am throwing at you. Human Genome Project had found out 3 billion base pair, and that we have 25,000 genes. Okay, so this is what Human Genome found out. And what did Human Genome Project use? They used the traditional Sanger sequencing, which is very slow, and that is why it took like decades to figure out our genome. Okay, fifth, we have CG higher than what? So wherever you have wherever you have CG bonds, okay, wherever you have CG bonds, this is going to be having a higher melting temperature. Okay, so this is going to have higher melting temperature. You know, you guys keep asking कि मैम PDF दे दो, PDF दे दो, PDF में तो rank है. If you get PDF, what will you do? CG higher TM. Even I for a minute couldn't understand कि कहना क्या चाहते हो. So what will you do with PDF without understanding video? So stop focusing on PDF and learn stuff. Okay, learn. So CG is higher melting temperature because these bonds are higher. With this only, one more thing you want to remember is CPG. These are the areas where methylation happens. So DNA methylation ka target is these CPG areas. Okay. Then we have deamination of methylated cystone. इससे क्या होता है? So this is thymine. Okay, this results in formation of thymine. Okay, fine. Who is this 16,569 base pairs? No. ये किसका नंबर रटा हुआ है? It is not this number, it is some other number applicable somewhere else because it is 3 billion base pair. Okay, हाँ, वो जो नंबर है वो वो नंबर है माइटोकॉन्ड्रियल डीएनए का. एक नंबर रट के छोड़ दिया, वो भी इतना एग्जैक्ट, बट वो भूल गए कि किसका था. तो क्या फायदा हुआ ये 569 नंबर का? Okay, so what you have to remember is thymine. Fine. Then quantification of DNA methylation. Quantification of DNA. So these are all just names I'm going to tell you, which you remember. Okay, इसमें से सवाल आया तो you give me party. So quantification of DNA methylation is by sulfite sequence. Okay, so this is why bisulfite sequencing is when you estimate quantification of DNA methylation. Histone modification can be measured by a chip assay. Okay, so this is chip assay. This was a repeat question. Digital droplet PCR. Droplet का gene थोड़ा भी दे दो तो we will manage. So this is for very low concentration DNA template. DNA template थोड़ा सा हल्का सा ही है. किसी का एक बूंद saliva मिला and you want to see who is father. Okay, then you can do it with digital droplet PCR. Fine. Then where do we do blue-white screening? Blue-white screening is done for recombinant. है ना? This is for recombinant bacteria. If you want to see, one will be blue color, one will be white color. Okay. Then what you have to remember? No, Sanger only. Sanger is first generation. Okay, next generation is next generation. Sanger is first generation. There is no first generation. It's Sanger only. Then you have to remember Fret and Frap. So these are two confusing names. Just remember what I am telling you. Fret is used for protein-protein interaction. Okay, protein-protein interaction. Fret for protein structures. Then Frap. Don't see full form. You will be scared and you will leave class. So don't be scared. Frap and Fret. Frap is for seeing mobility of cells. Okay, so this is for mobility of live cells. We do Frap. ठीक है? Okay. Then we do not require, what does not require capping at 5 prime end is tRNA. This is also all of these are repeat question जो मैंने एक एक लाइन में आपको डाल दिए हैं, और potential question. ठीक है. And one line is triglycerides are not amphithetic. Fine. तो ये हो गया हमारा ये. Ma'am, for you low yield is digital or pyro or next? But those are different things, no? एक दो चीजें sequencing है. One is PCR. Digital droplet PCR is for low concentration. Next generation and pyro sequencing is for sequencing of DNA. है ना, तो अलग चीजें हैं. Fine. Now let's talk about RFLP. RFLP is restriction fragment length polymorphism. So first point you want to know is that it is going to cut at palindromic sites. So at restriction, and so the restriction endonuclease is going to cut at palindrome. What is palindrome? Malayalam, meaning आगे से भी same, पीछे से भी same. But in genome, palindrome means that if I make the template, it will be the same. So look at this, GAA-TTC. If I make the template, GAA-TTC. So this is how palindromic sites are identified, and the restriction endonuclease will cut this. ठीक है, तो ये हो गया हमारा RFLP. So what they do is they cut the genome into various pieces. So this I can use for crime, disputes, genome mapping. So let me give you one example. There is one child who is C. Okay, C है हमारा child. No, B is our child. Okay, कौन है child? Figure करने दो पहले मुझे. I should have come prepared. So one of these is child and one of these is mother. A1, A2, A3 are the three father candidates. They are three father candidates that we have. So now my question to you is, tell me which of these is the father. Okay, that is my question to you कि इनमें से father कौन है. So what we have to do is just match. Okay, just match their fragments. So इतना इन दोनों में common है between child and mother. So now what do I need to figure out that ये कहाँ से आया? B is your child. Okay, ये कहाँ से आया? So this has come from A2. A2 has this fragment. So my father, I mean not my father, this person's father is A2. So A1, A2, A3. This is how you will remember. Okay, so A2 is the father of B and C is mother. All right, so this is how we could do RFLP pe paternal testing. Similarly, from criminal scenes, we can do genome mapping. We can do like that. Okay, fine. Chalo. Now let's go to this technique. What is the technique that I'm showing you? This is fish fluorescent in situ hybridization. Very important question. It can detect MAT. What is MAT? Microdeletion, translocation, amplification, aneuploidy. It cannot tell you the sequence. It cannot tell you point mutation. Okay, this is what is very important. Then blotting में याद रखो snow drop. You can remember roti dosa, वो भी याद रख सकते हो. मेरा है snow drop. Okay, so snow drop is snow लिख दिया, drop लिख दो, DRP. So this is DNA, RNA, protein. All right, so this is what. So now if I say southwestern, it becomes south and west. So it becomes DNA binding protein. So DNA binding protein, remember, is also known as southwestern blot or DNA footprinting. Fine, so this is about blotting. Metalloenzymes, you need to remember the cofactors. Various questions have come. यहाँ पे hashtag CC लिख रही हूँ, revise this one day before the exam. Okay, so iron is succinate dehydrogenase. अब इसको छोड़ दो भाई, इसमें mother कौन है, child कौन है, वो भूल जाओ. Now I have told you this is child, this is mother, this is the use of this technique, है ना? So just have to understand concept which we have done. Fine. चलो. So here iron is succinate dehydrogenase. What is succinate dehydrogenase? It is complex 2. Can you tell me inhibitor of complex 2? Malonate. Malonate is the inhibitor of complex 2. Complex 1 का inhibitor कौन है? Complex 1 inhibitor has one in its name. Rotatone, phenobarbital, 1. Metformin. So metformin को बना दो metformin. So it's all going to be 1. So that's complex 1. Complex 3 के लिए inhibitor कौन है? N3, anti and 3 mycin. 4 is the one which has all things ending with ides. So cyanide, carbon monoxide. All right, everything. H2S, hydrogen sulfide. Okay, those are your complex 4 inhibitors. That is what you have to remember. And ATP synthase inhibitors is going to be What is ATP synthase inhibitor? Oligomycin. Okay, oligomycin ATP synthase inhibitor. So here if they give you too much H plus is there, but ATP is not forming, that means it is oligomycin. Fine. All right. Zinc, very important, is carbonic anhydrase. Then magnesium is all of your glycolysis, gluconeogenesis wala pathway. Copper, obviously you know ceruloplasmin and lysyl oxidase. Manganese, so this is MSOD, this is C, cytoplasmic SOD. Selenium has been asked. If you have to remember one thing from this toxic slide, remember this. So glutathione peroxidase, deiodinase, and thioredoxin reductase. Okay, so peroxidase and reductase is where it acts as a cofactor for, and MO is exo, moxozo, all O's. Okay, so this is how you will remember. Let's go into enzyme kinetics. Just tell me what I am showing you here. Manoj, आपका doubt आएगा भी. We will solve that as an MCQ. Okay, right. So here we have Vmax, which is same, but the substrate is different. So the Km is increased, but Vmax is normal. Cause से Km, cause से competitive inhibition. When you see both are changed, bun, Km is reduced, Vmax is reduced. Remember, both go low, both bun, uncompetitive inhibition. And when you have Km is the same, Km is normal, but Vmax is reduced. This is what is your non-competitive inhibition. This is how you're going to approach. है ना? तो इतना easy है, इसको लोग इतना complicate करते हैं. This is all that you have to see. Just remember this formula, you can get a numerical. So the velocity is Vmax into substrate, Km upon substrate. So they can give you velocity, substrate, and they can ask you to calculate the Km here. Okay, so remember this formula, hashtag CC. एक बार लिख लेना और याद कर लेना. Mitochondrial DNA, one of you had already answered exact number of base pairs. So it contributes how much percentage of the total DNA? 20%. It codes for 13 proteins. All right, 13 etc proteins it codes for. The inheritance, okay, उल्टा तो कुछ नहीं है. क्या उल्टा है? सही है. Okay, inheritance is gonna be maternal. Okay, so maternal. All right, ठीक है. क्या उल्टा लिखा मैंने? Same only, no? It's fine only, right? Okay, yeah, sorry, it constitutes 1% of the total DNA. It codes for 20% of the ETC. It codes for 20% of the ETC. Okay, is what you need to remember. How many copies are there? So in a normal cell, there are 2 copies. Yeah, there are 2 copies, but here there are multiple, many copies, up to hundreds of copies there are there. And the DNA polymerase, which is for mitochondrial, is gamma. Okay, so gamma DNA polymerase, gamma, mother, can it proofread? So remember, here there is no proofreading. That's why there is very high risk of mutation. Okay, so this is about mitochondrial DNA. Now let's switch to collagen. So collagen 1, again remember 1. Okay, so it is bone and tendon. Okay, Satish, एक बार आप अपना check कर लो, ठीक है? मेरे हिसाब से this is correct only. Fine. Everybody else also seems to agree only. So I think you can once check and let me know. So we have bone and tendon, which is type 1 collagen. What you have to remember, every cartilage is going to be 2. All right, so cartilage is 2, but fibrocartilage, repeat question, is the one which has type 1 cartilage. What is again very important in wound repair, early is 3, but eventually it all becomes 1. है ना? हमें पहले लगता है कि हम तो 3 लोग ही अच्छे, है ना? 3 friends are good friends, but then after college you realize हम अकेले ही better है. Okay, so 3 is to 1. This is what you will remember. And 4, if you know Alport syndrome, you know where type 4 collagen exists. So glomerulonephritis, SNHL, and lenticonus. So that is type 4. Type 1 is absent in 1, osteogenesis imperfecta. Type 3 is deficient in Ehlers-Danlos loss because it's seen in blood vessel in the most lethal type of EDS, which is your vascular type. Okay, so this takes care of all collagens. Now we go on to all molecular biology in one slide, then vitamins in one slide, then metabolism in one slide, then inborn errors in one slide. Okay, let's do this in 10 minutes total. Okay, by 7:15 we need to finish biochemistry, then by 8 o'clock we will all finish anat. ठीक है. So epigenetics, are they chemical changes in DNA? Yes. Is it transmissible? Yes. Is it reversible? Yes. Can the sequence be changed? No, sequence is not changed. I'm just doing a chemical change. So we have DNA methylation, acetylation, deactivation. Methylation mutes, meaning it silences. Acetylation activates, deacetylation deactivates. Okay, that is what you need to remember. Okay, chalo, ab jate to next. Gene knock in, knockout, knockdown. So, knock in is when you are doing gene insertion, knockout is when you are doing gene deletion. Both of these things I can do with this technique which we have acquired from bacteria known as CRISPR. This has been acquired for COVID-19 in a test, card test known as Feluda card test. So, what we do in CRISPR is how do you delete a gene that has been given the name of non-homologous end joining? This is a repeat question, non-homologous end joining. And how can you insert a gene? That's via HDR. Okay, so just remember these two phrases. NHEJ has been asked, non-homologous end joining. Very nice follow-up. So theophylline acts through histone deacetylase. That's a very important point. And theophylline has two other actions. What are the two other actions that it does? So one, it is going to inhibit phosphodiesterase. Yeah, that is why it causes bronchodilation. And the second one is adenosine receptor. It is going to block. And that is why what can you have? You will have diuresis. Okay, so you will have diuresis and you can have cardiotoxicity because of these. So these are the three mechanisms by which theophylline acts. That's also a repeat question. All are actions of theophylline except. ठीक है, बहुत बढ़िया. चलो अब जाते हैं into gene knockdown. So gene knockdown is when you are silenced, you are suppressed. So gene knockdown is RNA interference, which is post-transcriptional. So this is also a repeat question, post-transcriptional gene silencing. Okay, so this is after transcription. You are using microRNA. They have asked you microRNA is acting on what site? On 3' UTR. बस ऐसे याद रखो, 3' untranslated region कुछ होता है, वहां जाके ये bind करेंगे. So this is knockdown. Don't confuse. All right, don't confuse this with RNA editing. Okay, RNA editing may, this is something body does physiologically. We are not playing with the genome. This is what we are doing here by ourselves because I want to create two proteins from one gene. So this is an exception to one gene, one protein theory, where from the same gene I can have ApoB48 and ApoB100. Just remember this is RNA editing. Fine. Now remember germ cells, we have telomerase. That's why they have ability to divide again and again. What is telomerase? It is TTAGGG. It is a RNA dependent DNA polymerase. So this is the RNA chain which is there on which we will have DNA template. Okay. It is not a ribozyme and there is Hayflick limit. What is Hayflick limit? There is a certain amount, only 30 to 50 times a telomerase can also divide. Otherwise we will all become immortal. है ना? So we don't want that. है ना? लंबी उम्र चाहिए but immortal भी नहीं बनना. That's why you should not do too much karwa chauth rat. Your husband will become immortal. Your husband doesn't want to become immortal. So this is, that's because he has Hayflick limit. So that is 30 to 50. All right. If you actually want your husband to long live, what will you do instead of Karwa Chauth? You will give him more sirtuins. How can we increase sirtuins, which are anti-aging? Give him red wine. तो Karwa Chauth की जगह red wine पिलाओ husband को. Ask him to eat less food. Calorie restriction. So you see how ironical Karwa Chauth is. Actually, Karwa Chauth से किसकी life बढ़ रही है? It is female. Female is doing calorie restriction. She is going to have more sirtuins. So the first time I have discovered this. And I think nobody else has discovered it so far. Because करवा चौथ फीमेल कर रही है, लोगों को लग रहा है हस्बैंड की लाइफ बढ़ रही है, फीमेल की लाइफ खुद बढ़ रही है यहाँ तो. So this is what is sirtuin. Okay, such a big scam is going on, which I have now revealed. Anyways, if you have a problem with telomerase, you will get dyskeratosis congenita. Okay, so dyskeratosis congenita is what is going to be a defect. This is new stuff I have discovered yesterday only. If you have deficiency of telomerase. Okay, people asking what is Karwa Chauth, ma'am, please don't talk in Hindi, talk in English. Karwa Chauth ka English I don't know. It is a festival. Okay. Now we have nucleotide excision. We have DNA repair defects which are there. So nucleotide excision. क्या defect है? Xeroderma pigmentosa. I will tell you two more. One is trichothiodystrophy. You will tell me ये कहाँ पड़ा है और क्यों पड़ा है. अभी 2 दिन पहले ही पढ़ा है, right? This we have studied yesterday only. There was tiger hair, you remember? That is also nucleotide excision defect. And there is one syndrome known as cocaine syndrome. Okay, cocaine syndrome. This is what is very, very important. Fine. Then we have base excision repair. Base excision repair is MUTYH polyposis. Mismatch repair, you all know, is HNPCC. Non-homologous end joining is defective in skid and radiotherapy induced damage. Okay. Homologous end joining is Burka and helicase is seen in blue and Werner or Vermeer. क्या लिखूं? N लिखूं या म लिखूं? वैसे तो हम डिजेनरेसी वर्बल हाइपोथेसिस में कुछ भी लगा देते हैं, यहाँ नहीं लगा सकते. इट इज वर्नर सिंड्रोम बिकॉज व्हाट इज वर्मर सिंड्रोम? वर्मर सिंड्रोम इज मेन वन, है ना? सो दैट इज मेन one. All right, so this is about DNA repair defects. Then what all do I need for PCR? For PCR we need all of these ingredients. Obviously I need a template, I need a primer, I need a heat stable polymerase, and I need nucleotides. So the option here they'll give you is, do you need dideoxynucleotides? Answer is no, this is not needed. This is needed in sequencing because this is where I want to stop the DNA production. So dideoxy is used in DNA sequencing, not in PCR. What you want to remember in PCR is 3 steps. So you'll remember that there is denaturation when you heat it, there is annealing where the primers will join, and then there is elongation. So these are the 3 steps: denaturation, annealing, elongation. Sequencing is traditional Sanger's, and next generation is more sensitive and more economical and more faster. Everything is advantage in next generation, but human genome में हमने use करा था Sanger's. Okay, that is what you need to remember. चलो अब जाते हैं into this slide. All right, now we go into vitamin summary slide. So B1, chalo फटाफट. If you do this slide, no, you will get 100 questions correct. So B1 cofactor is B apt. Okay, so B apt. What is thiamine a cofactor for? Branch chain ketodehydrogenase. This is an enzyme which is deficient in maple syrup urine disease. 3 branch chain amino acids, you tell me. Will. Valine, isoleucine, leucine. Okay, so biochemistry now it's going to be all integration. Hopefully you will be able to keep up. So branch chain, maple syrup, will. Then the second enzyme, B, apt. A for alpha ketoglutarate dehydrogenase, pyruvate dehydrogenase, and T for trans ketolase. So trans ketolase is the assay that I do, which is an enzyme of the HMP shunt. Okay. So PDH, pyruvate dehydrogenase, is a link enzyme. It has all cofactors from vitamin B1 to B5. So B1, B2, B3, 4 होता नहीं वरना होता. So B5 and lipoic acid. So these are the 5 cofactors which are there in PDH. Okay, very good. Now going to B2 assay. B2 is riboflavin. Remember ribbon and glue. So riboglue is glutathione reductase. So B2 is glutathione reductase. B3 is niacin. I'm not asking assay because assay is NAD only. Where is it derived from? Which amino acid? Tyrosine or tryptophan? Tryptophan. Tryptophan gives rise to niacin and serotonin and melatonin. Tyrosine, on the other hand, gives rise to all enes, epinephrine, dopamine, all right, melanin. So that is tyrosine. Fine. B5 deficiency will lead to burning foot syndrome. So what you will remember is 5 means panto, pantothenic acid. Draw pants and draw feet. Do you understand? This is pant and feet. So feet से याद रखो burning foot syndrome. B6, 6 मतलब X. X मतलब xanthannuric acid. Xanthannuric acid is your xanthannuric acid is increased in B6 deficiency. Then B6 is a cofactor for a bunch of important enzymes. One is transamination. So transamination, पहले सारे लिख देती हूँ. Glycogen phosphorylase. So for breaking down glycogen, I need B6. For all decarboxylation reactions, I need B6. And very important for ALA synthase, the first enzyme here, I need B6. So अगर B6 नहीं होगा, sideroblastic anemia hoga, because ALS synthase is not there. If B6 is not there, glycogen phosphorylase will not happen. I will have hypoglycemia. Then I need decarboxylation for producing GABA from glutamate. If I have no GABA, I will have seizures and neuropathy. This is how you remember vitamins. You will not be memorizing any of it. नाम होगा बुरी तरह रटो, but tell me कितनी चीजें हमने बुरी तरह रटी है, हमने सब कुछ अच्छी तरह समझा है, isn't it? So that is what you have to remember here. जितना समझ के concept से हो सकता है वो करो, जो बच जाए no concept, that those are the MCQ one liners that we have to memorize. That's how you triage, that's how you study. Okay, अच्छा, what was I saying? इसीलिए in refractory seizures, in refractory convulsions, we give pyridoxine. Okay, तो अब ट्रांसअमाइनेशन की बात कर ही रहे हैं. रिमेंबर दीज टू, SGPT, SGOT, ALT, AST. We raise a toast in OT. Toast in OT is what you remember. Then you will never go wrong, because now you will have both of the things. O for oxaloacetate, AS for aspartate. Okay, so this is reversible. PT, pyruvate to alanine. So this is how alanine and all glucogenic amino acids can become gluconeogenesis substrates, right? So this is what you need to remember. And this is how aspartate and oxaloacetate, this is a link between the Krebs cycle and the urea cycle. Another link between Krebs cycle and urea cycle is fumarate. Okay, again common between both of those. So these are two links between Krebs cycle and urea cycle. ठीक है, coming back to carboxylase cofactor is B7, which is biotin. किसको होगी biotin deficiency? Somebody is eating raw eggs. Raw eggs is gonna have avidin, which is gonna block biotin. MMA increase mane just B12. It can't be both, it is B12. Homocystinuria can be seen in 3 vitamin deficiencies: 6, 9, and 12. 3 2s are, 3 3s are, 3 4s are. That's how you remember 6, 9, and 12. How? Because from homocysteine to methionine, I am going to need B12 and folate, which is 9 and 12. And from homocysteine to cysteine, I am going to need B6. So in all 3 deficiencies, we will have high homocysteine. Remember homocysteine urea. There is inferonasal ectopia lentis, and you can have marfanoid habitus. You can have tall limbs marfanoid habitus with inferonasal dislocation. All right, very, very important. Folate assay is FIGLU, misincorporation of uracil in DNA. So what folate does for you? The active form of folate is tetrahydrofolate. It converts uracil to thymidine. When I have folate deficiency, this will not happen, and you will have uracil misincorporation. Can this also happen if folate is there but B12 deficiency is there? Yes. How come? Now, my methyl tetrahydrofolate is getting converted into its active form because of B12. So if B12 is deficient, all of my folate is trapped. Very, very important folate trap concept. So ideally, can I say that this misincorporation will happen in both folate and B12 deficiency? Yes, but if I have to choose, I will choose folate, because that's the direct culprit. All right, and that is why both of these have megaloblastic anemia. Did you understand? क्योंकि replication नहीं हो रहा ना, that's why you have megaloblastic anemia. Okay, चलो फटाफट ये कॉन्सेप्ट समझ आ गया तो बहुत ही बढ़िया. Now prolyl and lysyl hydroxylase, who is doing this? Vitamin C. That is why in vitamin C deficiency, you will have collagen deficiency, scurvy, you will have bleeding gums, everything. Lysyl oxidase is copper. That is why you have Menkes kinky hair. Here, what vitamin increases iron absorption is vitamin C. इसीलिए बच्चों को iron vitamin C के साथ देते हैं. And L-gluconate oxidase is lacking. That's why we can't synthesize vitamin C. This is a repeat one-liner question. Okay, quickly doing the images. So one important point, all carboxylases are biotin except gamma glutamyl carboxylase, which is by vitamin K. Very, very important. ये क्या कर रहा है? This is activating 2, 7, 9, 10 and protein C and S. Very important. This enzyme, epoxide reductase, is inhibited by warfarin. Hence, warfarin will inhibit synthesis of all of these. Okay, activation of all of these. Very important, anticoagulant bhi block ho rahe. That is why warfarin has a side effect, which is dermal skin necrosis. Purple toe, and how nice that I have written it with purple pen. This was not on purpose because I don't have time, but see how universe helps those who help themselves. So this is purple toe, which is dermal skin necrosis, which is because of protein C and S blockade. Okay, now I have vitamin K1, K2 and K3. K1, K2 are my natural forms, but K3 is the one which I have made because vitamin K1, 2 is fat soluble na. ये हमें बनाना है water soluble. Only then I can inject. So this is what I give as IM injection. At birth we give vitamin K 1 mg to every baby to prevent hemorrhagic disease of newborn. अब मैंने हिंदी में क्या बोला? Did I say anything in Hindi? What did I say? Now I have stopped realizing also when my language is changing. Did I say something? I didn't say anything, man. If you didn't understand, tell me. I will repeat. Okay, so this is what is this. Purple glove, purple toe, कुछ भी लगा लो. What you have? Wobble hypothesis. What is this? Chalo, quickly spotters for you. What is this? This is B2. How many eyes do you have? You have 2 eyes. How many lips do you have? People say 1 here. Every class I ask how many lips you have. लोग बोलते एक. कैसे? 1 and 2. Lower lip, upper lip. So cheilitis. Everything 2 you will have affected in B2. So corneal neovascularization, cheilitis is B2. Tongue, I will accept 1 as answer, but imagine you had 2 tongues. You will have magenta tongue. Okay, magenta tongue. ठीक है. ये कौन है अंकल? सेम अंकल विल कम इन एवरी एग्जाम. अंकल को है कासल नेकलेस. अंकल को है niacin deficiency. Okay, so uncle is niacin. Then what does auntie auntie have? Auntie has perioral dermatitis. आंटी ने रो एग्स खाए होंगे. बायोटिन डेफिशिएंसी. इनको क्या है? दे हैव विटामिन ए डेफिशिएंसी, फ्राइनोडर्मा, सो केराटिनाइजेशन एंड बाइटॉट स्पॉट्स. ओके, ये हो गए इमेजेस. चलो, last 2 slides very very quickly. Oh my god, we have 2 minutes to finish 2 slides on all PYQs. हो जाएगा, but बायोकेम में everything I covered as theory, तो ज्यादा कुछ है नहीं. In biochem I covered everything in theory, so not much is there. So now we have fed and fasting. Fed is insulin, fasting is glucagon. Okay. So here just remember what I am telling you as concept. So fed is insulin, everything will be anabolic because you have fed, no, you have lots of stores. So body will start making stores. Body will be like anabolic pathways activate kar do. So what will be activated here? First of all, why have you eaten food? Because you were hungry for energy. Glycolysis activated by insulin. Then everything else where you have to synthesize something. So one is glycogen synthesis. Then you want to make protein synthesis, you want to make cholesterol, you want to make fatty acids. Everything is going to be anabolic pathway. Okay. Then what you want to remember is what gets activated in fasting pathway. So in fasting, glucagon is going to activate everything else. So I now need to break down stuff. So glycogen, breakdown, glycogenolysis, gluconeogenesis sounds like anabolic, but I will do it in fasting, isn't it? So gluconeogenesis done in fasting. Fatty acid oxidation and ketone body synthesis and breakdown, isn't it? Dono hi will happen in fasting. Then very important, we remember a mnemonic, high coat of La, HC of La. So HSL is catabolic, lipoprotein lipase is anabolic. Remember this question, very, very important. So can I say that every enzyme of this will be inhibited by insulin and activated by glucagon? Yes, and vice versa. Okay, so this is one step. Second step, all of these enzymes by insulin are going to be activated in their dephosphorylated state. All of these enzymes are going to be activated in their phosphorylated state. So यहाँ पे phosphatase will be acting, यहाँ पे protein kinase will be acting. Okay, extremely important. Then all of your anabolic pathway are happening where? They are happening in the cytoplasm. Whereas all of the pathways of catabolic are happening in the mitochondria, except glycogen breakdown, which is happening in the cytoplasm. Okay, so these are all the points which will take care of every question from metabolism from biochem. Okay, then what you have to remember, HCl is, HSL is catabolic, lipoprotein is anabolic. That's what I said. Okay, right. The pathways which happen in both cytoplasm and mitochondria. So you need two people to hug, right? So two people for hugging, two compartments for hug. So H is going to be heme synthesis, U is urea cycle, G is gluconeogenesis. Three pathways require both. अब कुछ कुछ वन लाइनर क्वेश्चंस बता दो फटाफट. आरबीसी में देर आर टू पाथवेज विच हैव जीरो एटीपी, डोंट जनरेट एटीपी. फिर क्यों कर रहे हो ऐसे यूजलेस साइकिल आरबीसी? शी इज डूइंग इट. Why is RBC she? Just so she is RBC is doing it because it wants some products out of it. So RL shunt is going to give it 2,3 BPG. Okay, so 2,3 BPG is what is the end product of RL shunt, and this is going to help in release, repels. 2,3 BPG repels, causes a right shift of oxygen dissociation curve. That's why it is going to be needing it to release oxygen. Then HMP क्यों कर रहे हैं? Because it is giving RBC NADPH. NADPH is very important for its oxidative stress management, and it also gives it ribose 5-phosphate, only source of 5 carbon sugars. Okay, so this is about HMP. Now let's focus on SI, energetics. So glycolysis, if you just do glycolysis like our girlfriend RBC is doing, she will only get 2 ATP, है ना, क्योंकि उसके पास ना PDH है ना कुछ है. So this is 2 ATP. What is the only incoming substrate that can give us 3 ATP from glycolysis? It is glycogen, because glycogen comes as glucose 6-phosphate, है ना, वो सीधा एक phosphate लेके आया, so 1 ATP less I have to spend. Repeat question. Then aerobic. Now if pyruvate goes into PDH and goes into Krebs cycle, it will result in 32 ATP production. So RBC को दे रहे हैं 2 ATP, but अगर पूरा का पूरा हो रहा है 32 ATP. So these are your energetics. Now everything can be substrate for gluconeogenesis. Pyruvate lactate, because they are reversible lactate dehydrogenase. You can have glucogenic amino acid because you know alanine can become pyruvate. Any TC intermediate because they can become oxaloacetate and go into gluconeogenesis. And glycerol, because glycerol can become what? It can come as DHAP. It can become DHAP and come into gluconeogenesis. Do you understand when I'm doing this and this, how it's coming? Yeah, you know that page that I'm targeting right now. And how does propionic acid come? Propionic acid comes as, how are you guys so silent? Am I stuck? Or you're just gone silent? I can see myself moving. Okay, I guess I am here. So we have PMS. What is PMS? Propionyl to methylmalonyl and methylmalonyl to succinyl. So this is how it will enter the Krebs cycle and it will become gluconeogenesis. Okay, let me just check. I'm not getting any message. Okay, now I am getting. I was not getting only. Last message I got was okay, fine. Now I am getting. So this is PMS. Propionyl to methylmalonyl. You remember vitamin B12 was the cofactor, right? Okay, not this. Here, methylmalonyl to succinyl-CoA. B12 was a cofactor. That is why M will increase. Fine. तो ये हो गया हमारा gluconeogenesis. The only point is कौन नहीं है? Who is not substrate of gluconeogenesis? It is acetyl CoA. Acetyl CoA is the most potent stimulator of gluconeogenesis, but it is not a substrate for gluconeogenesis. ठीक है? Stupor में आ गए हो? बस बायोकेम कर लो, ठीक है, फिर अनाट पे छोड़ दूंगी, आई विल लीव यू, अनाट खुद पढ़ लेना. Then we have three urine tests. So what are the three urine tests that we have? This is reducing sugar test. What is the name of reducing sugar test? My brain also has now become very tired. So we have three tests. This is the first one for reducing sugar. This is second one, heat test for protein, and this is your Rotheras test for ketone bodies. Okay, so reducing sugar, Benedict test, heat, protein test, Rothera is ketone body. Except कौन सा ketone body doesn't detect? Beta hydroxy butyrate. Okay, so except this, it detects everything. So now when I tell you in one person urine, 1 and 3 both came out positive. Diagnosis क्या है? Diagnosis is gonna be diabetic ketoacidosis, isn't it? But if I say just 3 is positive, it means person is starving. Only ketone bodies are there without sugar. Okay, that is very, very important. Chalo. Next, we have this. Next we have all of these. फटाफट image based question बताएंगे, answer बताएंगे. 2 minutes. Okay, what is this? Erlenmeyer flask deformity, and you have tissue paper crumpled appearance. What am I talking about? Gauchers. Oh my gosh, he broke the bones. We need to glue it. Glue it. Beta glucosidase or cerebrosidase, because alpha glucosidase is Pompe है ना, common lysosomal glycogen disorder. So Pompe is cardiomyopathy and hypotonic baby, low tone of the baby. So this is Gaucher's, most common lysosomal storage disease. My favorite activity is ceramics. फिर क्या है? My favorite activity is ceramics. We made a galaxy. So what am I talking about? Favorite. So Fabry's disease and ceramics, because ceramide accumulation, and a galaxy because alpha galactosidase, and it is X-linked recessive. And what are these? These are your Maltese cross. Babesiosis पढ़ा था, that is RBC में Maltese cross. This is urine में Maltese cross. Okay, then 2 places of cherry red spot. What are the 2 places? 2 places will be, one, if I tell you no hepatosplenomegaly, your diagnosis is 6 small Jews eating onions. So 6 small Jews, Tay-Sachs. Okay, so Tay-Sachs, remember, small Jews, no hepatosplenomegaly happens in Jews, and 6 because hexosaminidase A. And finally, if you have hepatosplenomegaly, my big finger, है ना? So big finger, pick your nose with your big finger. So Niemann-Pick, sphingomyelin, hepatosplenomegaly. Okay, चेरी रेड स्पॉट देख के नहीं बता सकते भाई कि अगर टेसैक है या नीमन पिक है. चेरी रेड स्पॉट देख के तो ये भी नहीं बता सकते कि CRAO है, बर्लिन इडीमा है, टेसैक है, नीमन पिक है, वो भी नहीं बता सकते. Okay, then if you have adrenal calcification, then it is known as Wolman's disease. If this question come, you will give me party. Okay, Wolman disease is acid lipase deficiency. Okay, that is what you have to remember. How to distinguish macula from cherry red? Very good question. Around this red, you will have this fading. Okay, that is how. All right, then we have these buzzwords for you, very, very important. Non-ketotic hypoglycemia and dicarboxylic, this is MSAD deficiency. So your even chain fatty acids are not getting broken down. Retinitis pigmentosa. They can also give you ichthyosis. RE is RE, Refsum disease. Problem with peroxisomes. So phytanic is not breaking. If you have both phytanic and very long chain, peroxisome hai hi nahi, Zellweger syndrome. Both will accumulate. ठीक है? Then you have normal HDL but absent other lipids. Spore cells. This is A beta lipoproteinemia. It is MTTP gene deficiency. Orange tonsils low. 2 diseases with low HDL. Reverse pathway of HDL is affected here. This is Tangiers. ABCA1 gene is mutated. And when you have this is fish eye disease. Partial L cat deficiency. Okay, so both of these, low HDL is your buzzword. Fine. Now very quickly going on to the questions. So not many hai probably. Let's go back. So here they what you have to do is, when they give you template DNA and they ask you mRNA, सबसे पहले क्या करोगे? सबसे पहले, see, this is 5 prime to 3 prime. Just start from here, no, because this is how you have to have your RNA. So just in your mind, mentally ऐसे करो. So what you are going to do mentally is G A T की जगह RNA has to have U. So I just have to see कि भाई 5 prime से GAU कहाँ शुरू हो रहा है, and I will find one answer and that will be correct. So in 1 second I can answer this question without creating everything. Technically, if you want to create everything, you can do that by completely making 1 3 prime to 5 prime of this and then making RNA of that. But this is the easiest thing to do. Okay, if you didn't understand, in bonus BTR I have done this complete exercise. You can just see that. Klinos fragment lacks what? So it lacks 5 prime to 3 prime. So remember, in any DNA polymerase, let's say DNA polymerase 3, it has 3 activities, right? What are the 3 activities? One is the polymerase activity, which happens from 5 prime to 3 prime. So everything has 5 prime to 3 prime polymerase. Everything has 3 prime to 5 prime exonuclease, which we are going to use for proofreading. This 5 prime to 3 prime exonuclease is for primase removal. है ना, primer removal के लिए. That I don't want in my clino fragment, so I remove it. So this is the part which is removed here. Okay, that is what you want to remember. So this is one question which one of you was asking and I said it will be answered, है ना? तो ये लो, which can identify changes in DNA sequence. So flow cytometry, there is no way that it can identify change. It is just saying कि भाई ये दो CD receptor नहीं है आपके पास. Okay, so it is not identifying DNA. So now see, do I need any knowledge? No. So such multiple choice question ना आपको बहुत फायदा देंगे, बहुत काम आते हैं, because it actually helps you rule out a lot of options. If you know one, don't just give up कि भाई मुझे तो नहीं पता कि RFLP करता है या नहीं. You don't need that fact only. Got it? That's how you solve MCQs. That's how you get rank. पढ़ाई तो सब करते हैं पर rank सबका नहीं आता. This is what you have to understand. So this is first thing. Now pyro sequencing, definitely sequencing can detect DNA sequence. RFLP can also detect DNA sequence because now you are recognizing those endonuclease wala site, right? Your restriction enzyme wala sites. You are recognizing the क्या बोलते हैं, the tandem sequences, the sequences which were palindromic sequences, right? So this is what it's recognizing. So it can tell you about the DNA sequence, but fish again does not tell you about DNA sequencing. All right. Chalo, next. DNA methylation is related to mismatch repair. HNPCC pada. Gene silencing for sure. RNA interference. Chromatin remodeling also. Euchromatin to heterochromatin it can do. So no role with capping. Fine. वेरी वेरी इंपॉर्टेंट. अब ये देखो, पढ़ने में लगेगा कि भाई क्या हो रहा है. इट विल बी लाइक ये छोड़ देते हैं, छोड़ देते हैं, छोड़ देते हैं. दैट इज व्हाट योर ब्रेन विल टेल यू. बट नाउ लेट्स जस्ट सी हाउ इजी दिस क्वेश्चन इज. इन अ रिएक्शन, अ सबस्ट्रेट इज अवेलेबल इन अ कॉन्सेंट्रेशन 1000 times the km value. 1000 times km value. After 9 minutes of reaction, 1% of substrate is converted to product. ठीक है. If concentration is changed to 1/3, concentration of enzyme I changed to 1/3 and concentration of substrate is doubled. Already it was 1000 times, आपने उसको 2000 times कर दिया. बहुत ही बढ़िया. Will it make any difference? Tell me. If you increase the concentration beyond a certain limit, the enzyme will show you plateau, na, because there is only certain thing it can do. Enzyme substrate can form at certain sites only. So this is not making any difference. So the only thing which is now affected is आपने इसको 1/3 कर दिया. So पहले अगर 9 minutes लग रहे थे, now it's gonna take 3 times more time. So it's gonna take 27 minutes. अब लोग कहते मैम पेन नहीं दे रहे. पेन की रोल थी, पेन का रोल ही नहीं था. You just had to read and understand the question. Okay. Alkali disease of livestock is because of selenium. So selenium deficiency is Kishan's disease, which is cardiomyopathy. Excess is causing livestock में alkali disease. Fine. Enzyme common for glycolysis, gluconeogenesis. Pyruvate kinase is unidirectional. PFK is rate limiting, unidirectional. PEP carboxykinase is your pyruvate to enolase wala, again unidirectional. But all others are reversible. In fact, these are the only 3 irreversible steps that they have given. ठीक है. Enzyme not used in cholesterol synthesis. इसमें अगर ऑप्शन में थायोफोरेज होता ना आधे बच्चे थायोफोरेज मार देते बिकॉज दैट इज वन आंसर. पीवाई क्यू करा है, दैट इज वन आंसर. Don't read question, just read answer. This is one more mistake that so many of you do. You have done PYQs so many times that the moment you see थायोफोरेज मार दो यही है बट क्वेश्चन तो पढ़ लो, क्वेश्चन कुछ और है. Okay, so don't make this mistake. So the one which is not used in HMG in cholesterol synthesis is lyase. All right, reductase synthase both are the initial steps. It is lyase. Fine. Which cannot be used to precipitate protein is this. In fact, when you move the pH away from isoelectric, you are like one way to precipitate protein is to take the pH to isoelectric pH. That's one way. All right. So this is definitely wrong. Repeat question hai, one liner hai. Phenyl butyrate is what is used to reduce the levels of ammonia. फिर ये ऐसा क्वेश्चन है जिसके लिए बस थोड़ा कॉन्सेप्ट पता होना चाहिए. हाउ डू वी मेक रिकॉम्बिनेंट डीएनए? सो लेट्स सी. SDS page, elution, hybridization, all of this will come later on. First, you have to put our gene into the bacteria. After you put the gene, you will have to kill the bacteria. Hai na? So you put it in your bacterial vector as a plasmid, then you lyse and you take that gene out. Okay. After that, now you are going to do page. Page is when you break down the gene into different parts. And then what are you going to do? Then you are going to do hybridization and then you take out your protein. So, क्या बनेगा? A. 21354. A will be your answer. ठीक है. Next. Choose the right steps in conversion of cholesterol. Brain transplant कर सकते, प्रॉब्लम है डोनर किसको लोगे? Who will you trust as donor? Okay, I am not donating. बाकी किसका लोगे बताओ? जिसका भी लोगे क्या पता तुम्हारे से कम ही दिमाग हो. Can't risk that last day before exam. चलो. Choose the right sequence of steps in conversion of cholesterol to testosterone. So here, the first step you remember is desmolase. So desmolase सबसे पहला step है, and then you have 3 beta. बस इतना याद रख लो, desmolase सबसे पहले होता है, तो आंसर वैसे ही सॉल्व हो जाएगा. Fine, don't memorize. Desmo पहला. All right, then you have this small enzyme 3 beta hydroxy steroid dehydrogenase. अब ये ऐसा क्वेश्चन है जिसके बाद यू माइट थिंक कि ओ डू आई नीड टू मेमोराइज all chemical structure of glycosaminoglycans? Answer is no. Chondroitin sulfate. So you have to just remember कि भाई chondroitin sulfate है which is having this glycosaminoglycans. Okay, चलो अब आते हैं into this. So which is the most abundant? Why they asked you this question is because it's most common. So when you have a doubt कि भाई answer क्या होगा, just mark most common one. No. So this is chondroitin sulfate. So these are all glycosaminoglycan questions. If this comes, I will take party. Okay. Which is the GAG with no protein, no sulfate. कुछ है नहीं इसके पास. This is hyaluronic acid, and hyaluronic acid we will also use for morphogenesis, wound repair. Okay. फिर gag with no uronic acid and corneal transparency. This is keratin sulfate. Okay, keratin in corneal. उसके पास uronic acid नहीं है. Sclera and atherogenic is dermatan sulfate. And the one which is having lipoprotein, which binds to lipoprotein lipase, is a plasma membrane receptor responsible for GBM charges, heparin sulfate. Again, just to compile this chota sa table that you just did in passing, it has taken me literally hours to compile this. Okay, so this is the easiest that we can do GAGs as, if you can just see this table once. Fine. So this is about this. Very nice. One of you, Falak, very good. Falak is giving very nice answers today. So Staph aureus also has hyaluronic acid capsule. Yeah, those are the only two exceptions. Everything else is polysaccharide. Okay, so is it S aureus? S aureus tha? S pyogenes hai na? So S pyogenes has hyaluronic acid capsule and glutamate is in bacillus. ठीक है, चलो तो ये हो गया. Now we go on to anatomy. हो जाएगा? आर यू गाइस ओके? कितना है? 13 स्लाइड्स ओनली, 12 स्लाइड्स ओनली। अभी ब्रेक नहीं, अभी खत्म ही करेंगे। इफ यू डोंट वांट टू स्टडी आई विल डू इट देन टुमारो, इफ यू वांट टू डू टुमारो, क्योंकि टुमारो की क्लास वैसे स्मॉल ही होगी, because I have only tonight to prepare, so it will be less extensive only. Do you want me to shift anatomy tomorrow? Are you guys very tired, or you want to finish? ज्यादा कुछ है नहीं। 1 2 3 4 5 6 स्लाइड्स ओनली, कर लेते हैं, खत्म करें। हम्म कर लेते हैं खत्म, चलो कर लेते हैं ना खत्म। वेरी अनलाइक yesterday, crowd today is divided. Few are saying कि कर लो ना, खत्म करो। If you want break, you take break. You take break, then you do it tomorrow. It will be there on the app as recorded. तो फिर तुम कर लेना। I will do today only. खत्म करते हैं, because tomorrow we have surgery, medicine, path, pharma, physio, peds. तो काफी है, heavy duty. चलो let's do. इजी है, डोंट वरी, इट लुक्स स्कैरी बट आई हैव केप्ट ऑल क्यूट 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 एनाटॉमी को क्यूट पार्ट्स में ब्रेक करके लाई हूँ। सो रेटिकुलर फाइबर्स आर एब्सेंट इन थाइमस, दैट इज फर्स्ट क्वेश्चन। लिगामेंटम फ्लेवम इज रिच इन इलास्टिन फाइबर्स। चलो, 3 थिंग्स विद अबडक्शन, बताओ बच्चों। 0 to 15 degree abduction is going to be done by supraspinatus. Okay, so this is done by supraspinatus. 15 to 90 degree abduction is what is done by deltoid, which is the main muscle, and overhead abduction is what is done by trapezius and serratus anterior. So now you will tell me muscle supply of all of this. Supraspinatus is going to be suprascapular nerve. Deltoid, very, very important, axillary. So axillary nerve damage, you will not be able to do abduction 15 to 90 degree. There will be regimental bat sign, lateral arm में anesthesia हो जाएगा, right? Trapezius serratus anterior, nerve supply of trapezius is spinal accessory nerve. Serratus anterior, you all know the nerve supply is long thoracic nerve, right? So this is long thoracic nerve. There are people who are still saying tomorrow ho gaya, that ship has sailed now. Okay, so this is about abduction. Once question came, which is the nerve route for abduction? So they give C5, C6, C7 ऐसे करके options दिया था. C5 is the best answer because that is the root of axillary nerve. It is the main muscle, which is the deltoid muscle. All right. Then let's just finish upper limb muscle identification and nerves, because that gets you lots of questions. So abduction वाले हो गए. Now look at this. Now look at back muscles. पहले label करो. This is levator scapulae. These are two rhomboids. Which is minor, which is major? ऊपर minor है. So this is minor, this is major. Okay. Both of them have one function, which is going to be to retract the scapula. All right. So rhomboids mainly, rho se retract, levator elevates the scapula. They both have common nerve supply, which is the dorsal scapular nerve, which arises from C5 root. Okay, so this is about levator rhomboids. Then they have asked you this question: which muscle is triangular? Which is this triangular muscle, guys? This is your traps, right? So these are your trapezius muscles. Trapezius, we have already seen, it helps us in overhead abduction, and the nerve supply of trapezius, spinal accessory nerve. Then what is this muscle coming and going this way? These are your lats. So latissimus dorsi, what is the nerve supply? Thoracodorsal nerve. What is the function of latissimus dorsi is important. So this is going to be the extensor, adductor, internal rotator. I want you to remember these two separately. Remember extension and remember Adir. Okay, you know Rani Mukherjee's daughter's name is Adira. Just random facts for you. If these facts were not enough, ये लो, एक और लो. So Adira, Adira से याद रख लो. Latissimus dorsi में Adira है. ठीक है, I will tell you one use somewhere. Okay, very quickly. तो ये हो गया about muscles of the upper limb. Before I go into sideways, let's just do muscles of lower limb. Okay, I wrote 11 for trapeze. कहाँ? 9 ही तो है. Have you forgotten Roman or have I forgotten Roman? 9 ही तो लिखा है भाई. ठीक है, my brain has stopped. Oh, sorry. I have written 9 instead of 11. My brain indeed has stopped working. Sorry. Sorry, guys. Lo, you want this brain? This brain you were asking for? Ab bolo, you have second thoughts. All right. So now we have now we have all of the insertion on pelvis. So we have iliac crest. We have iliac crest pe abdominal muscles. Okay, so abdominal muscles, your transverse and everything is gonna come here. Don't remember this. What you want to remember is ASIS. Okay, so ASIS is sartorius. Okay, so ASIS, so say sartorius. Then anterior inferior iliac spine, rectus femoris. So they can ask you image based question. अब फिर से आ गया, मैम कल ही कर लेते हैं, आप पे ज्यादा ट्रस्ट अब थोड़ा कम होता जा रहा है. With every 5 minutes when you mix up Roman numbers, no, our trust is reducing. कल ही कर लो. No, it's okay, it will be okay. ऐसी छोटे छोटे mistakes only I don't do big mistakes. Fine. So ASIS is sartorius, anterior inferior is rectus femoris. Then this is where questions come. So GT is gluteus medius and minimus. All right. And lesser trochanter is, अभी ध्यान दो सब लोग, बहुत इंपॉर्टेंट स्टफ बताने वाली हूँ. सो ग्लूटियस मीडियस मिनिमस इज एट जीटी एंड लेसर ट्रोकैंटर पे वी हैव इलियोसोआस. ओके, सो इलियोसोआस इज योर मेन फ्लेक्सर ऑफ द हिप. This is the thing which I am testing. By what test? Iliopsoas का flexion अगर काम नहीं कर रहा, which test we are going to do? We are going to do Thomas test. Okay, we are going to do Thomas test. Gluteus medius minimus. What is the function of gluteus medius minimus? They are the main AB abductors and they are also internal rotators. Abir. Okay, from adira we have gone into abduction and internal rotation. What is the nerve which supplies them? The nerve supplying them is superior gluteal nerve. The roots will be superior hai na, so L4 L5 S1. Just stay with me till here. Now what you are having here, repeat question, which muscle inserts at this red line that I am asking you? The red line is going to be gluteus maximus, isn't it? So here we have gluteus maximus. So gluteus maximus, I will write all of this again neatly, but here you just go with it. Gluteus maximus, 25% fibers are gonna insert here. And what is the function? It is the main extensor. Okay, so just like this is how I wanted to correlate. This is the main extensor, this is the main extensor, and this was adira, this is opposite. This is abduction. So if I remember adira, this becomes abduction, external rotation. Understood this? This is asked as a repeat question. What is the exact mechanism, function of maximus? Extension to sabko pata, it's the main mechanism. Then they asked lateral rotation. So it is extension and lateral rotation. So this way you will remember everything. At the tuberosity, we have hamstrings. At the symphysis, we have adductors. Okay. Now let's bring it together. Last 5 minutes mein high density of information happened. Let's bring it together neatly. Gluteus maximus. Where is it inserting? Gluteal tuberosity. What is the function? Just like latissimus dorsi, it is extension, but that was adira. So this is external rotation. Fine. The nerve which supplies it is the inferior. Even though it is maximus, it is inferior gluteal nerve. So L5 S1. What you want to remember? Minimus medius is going to be greater trochanter. Greater trochanter, this is superior gluteal nerve. So L4 to S1. ऊपर से शुरू हो रहा है. Okay. The function here is going to be, these are the main AB abductors, and because there was ER, these are IR. ठीक है? Iliotibial tract is also receiving 75% of the gluteus maximus, and this is what inserts at the Gerdy tubercle in tibia. Gerdy tubercle in the tibia, and together basically you have iliotibial tract is a combination of gluteus maximus and tensor fascia lata, right? That is tensor fascia lata for you. So this is how we have summarized everything. I hope this helps because this is so high yield. This is like extremely important. Okay, now क्या बोलना था? You all know Trendelenburg gate, Dolly. So droop of opposite side. Trendelenburg gate is everything GT, superior gluteal or gluteus medius minimus. That is how you know Dolly. ठीक है, Trendelenburg gate. Let's identify in cadaver. That's the toughest question. This is gluteus maximus. You have to cut it to see other things. We have medius, then you have piriformis. And this nerve is sciatic nerve. Below the piriformis, you have superior gemellus, obturator internus, inferior gemellus, quadratus femoris. ये जो gemellus है ना, gemellus means उधार. ओके, सो इनका खुद का नर्व ही नहीं है. दे आर लाइक आसपास कौन है, नर्व दे दे, नर्व दे दे. सो सुपीरियर जेमिलस इज सप्लाइड बाय नर्व टू ऑब्ट्यूरेटस इंटरनस एंड inferior gemellus is nerve to quadratus femoris. Okay, this is what you need to remember. Fine. Now we have to go for next. Why? क्यों अंबर 8 बजे छोड़ देना? क्या है, करवा चौथ है 8 बजे. करवा चौथ तो हो गया ना अब. सो यू हैव ऑलरेडी रियलाइज्ड कि भूखे रहोगे तो उम्र बढ़ेगी, करवा चौथ से नहीं बढ़ेगी. ओके, सो क्लास में अटेंड करेंगे जब तक चलेगी. now now we go to different things. Muscles are now done. Now we will go into labor pain. ठीक है. First stage of labor pain, second stage of labor pain. First stage of labor pain is T12, L1, L2. This is going to be sympathetic. All right. So this is the sympathetic pain. These are the roots in first stage. In second stage, it is your parasympathetic S2, S3, S4 via the pudendal nerves. So that's why we give pudendal block, not for first stage labor. For second stage labor, pudendal block is done. ठीक है. Then 2 questions have come from facial artery, like complicated questions. So they have asked it 2 ways. Okay. So out of these 4, which is not a branch of facial artery? Answer batao. Lateral nasal, superior labial, inferior labial, mental. Mental is not a branch, okay, of facial artery. It is a branch of, mental is a branch of superficial. No, mental is not a branch of this, is a branch of maxillary. Okay, so ये हो गया हमारा this. दूसरा क्वेश्चन आया जिसके नाम में है facial. The only artery of the face not arising from facial artery. वो कौन है? वो है transverse facial. So this is arising from superficial temporal artery. So दिमाग ऐसे टूट जाएगा when you see such facts that this is one branch which is not of facial artery. All branches of facial artery supply the face except transverse facial, which is a branch of superficial temporal artery. Okay, this is about this. Fine. चलो आगे बढ़े. I am not making fun of. Are you offended because I made fun of Karwa Chauth? Oh my God. How do I end up offending somebody all the time? Sorry, Sheetal, I did not mean it. Okay, I was just joking. Okay, please don't be offended. Please, guys, please don't spread this video and like मेरे पे पूरा ये हो जाएगा. Okay, we will not go into it. Karwa Chauth is great festival. Oh my God. So this is why I should not take class on YouTube. Chalo. Fatafat, let's go to, let me just stick. No more jokes. We will only stick to embryology. So here, all derivatives. So ये है neural tube. All right. So this is neural tube. These are all neural crest derivatives. So neural crest derivatives कौन है? Motel passes. What is motel passes? चलो फटाफट ये लिखेंगे नहीं कोई. Melanocyte, odontoblast, active recall, tracheal cartilage, enterochromaffin cells, leptomeninges, PNS ganglion, adrenal medulla, Schwann cells, spiral septum, endocardial cushion, skull cartilage. If you could expand this, kudos to you. If you could not expand it, listen to the last 10 seconds again. These are neural crest derivatives. Neural tube gives rise to the spinal cord and brain. What is this? This here is notochord. Notochord derivatives is nucleus pulposus and tectorial membrane. Tectorial membrane is a continuation of PLL. ठीक है. Then we have 3 mesoderms. Remember PIL, something that might be filed. So this is PIL. P for paraxial mesoderm. Paraxial mesoderm मतलब It will give rise to everything that spine needs. So dura, axial skeleton, muscle of back and everything. Intermediate mesoderm is going to give rise to genitourinary system, and lateral plate mesoderm is divided into somatopleuric, which is rest of the limbs, and splanchnopluric, which are rest of your muscles, because mesoderm. Okay, so cardiac muscle, smooth muscle, only two organs of the abdomen not derived from the endoderm are spleen, is spleen that you want to remember, and macrophages, serosa, everything comes from mesoderm. All right, ठीक है, few more points there. आई मसल्स की बात कर लेते हैं. स्फिंक्टर डायलेटर प्यूपिले आर कनेक्टेड. सो योर रेटिना, योर ऑप्टिक नर्व एंड योर आइरिस एंड योर स्फिंक्टर प्यूपिले ऑल कम फ्रॉम न्यूरो एक्टोडर्म. ठीक है. सिलियारिस सी कम्स फ्रॉम न्यूरल क्रेस्ट. रेस्ट ऑफ द मसल्स कम फ्रॉम मेसोडर्म. ठीक है, इतना आई में याद रख लो. इफ यू रिमेंबर दिस, इट विल बी एवरीथिंग इन आई विल बी सॉर्टेड. बस इतना याद रख लो. सरफेस एक्टोडर्म से क्या आ रहा है? लेल. व्हाट इज लेल? वी हैव लक्राइमल ग्लैंड, वी हैव एपिथेलियम ऑफ कॉर्निया कंजंक्टिवा, एंड वी हैव लेंस. These are your surface ectoderms. ठीक है, चलो अब जाते हैं into this. They have given you by A से क्या बन रहा है. So you can see spinal cord here. So this is dorsal, this is ventral. So ventral mesentery, just remember everything which has the name liver in it. Lesser omentum is hepatogastric, hepatoduodenal, falciform, triangular, coronary, everything liver. ठीक है, चलो. पैरामीजोनेफ्रिक, मीजोनेफ्रिक. पैरामीजोनेफ्रिक मेल का है, फीमेल का है? इतना ही बता दो एट दिस पॉइंट ऑफ टाइम, आई विल बी हैप्पी. सो पैरामीजोनेफ्रिक इज योर म्यूलेरियन, है ना. एम एंड एम डोंट गो टुगेदर. मीजोनेफ्रिक इज वुल्फियन. Men are like wolves. So men, wolves. I don't mean it. I only mean it as a joke, as a mnemonic. Mnemonic है, mnemonic. So paramesonephric, Mullerian, mesonephric, Wolffian. ठीक है. अब है डेरिवेटिव्स. सो मेल फीमेल डेरिवेटिव्स तो अब बता ही दोगे. अब मुझे बताओ कि मतलब मुलेरियन का मेल में व्हाट आर द डेरिवेटिव्स. सो यू विल रिमेंबर पैट. व्हाट इज पैट? प्रोस्टैटिक, यूट्रिकल and appendix testis. Appendix testis. ठीक है, this is our male derivative. Female derivative of Wolffian duct, peg. What is peg? Paraoophoron, epoophoron, and Gartner duct. Gartner duct cyst is not remnant, guys. It is a cyst which arises from remnant. Okay, so Gartner duct cyst will be seen in anterior vaginal wall. Remember, the cyst will be seen in anterior vaginal wall. All right, now let's talk about supracardinal vein, subcardinal, supracardinal, subcardinal vein derivatives. Okay, we did not have to wait for Zara to spill water today. I have done that job. So here what you have to remember are the derivatives. Yeah, I wanted to use thin pen. I realized while writing, but now it was too late. So now I will use. So supracardinal, this is anatomy, है ना. Technically क्या होना चाहिए? Supracardinal should give rise to suprarenal IVC. Sub should give rise to infra. पर ये anat है, तो कैसे रहेगा? Supracardinal gives rise to infrarenal IVC. And साथ ही very important, A है ना. So azygous, this is a repeat question. Azygous, hemiazygous come from this. ठीक है. Subcardinal is ulta, so suprarenal IVC, and everything else with the kidneys. So left renal vein, both of the adrenal veins and the gonadal veins, these are all coming from subcardinal vein, everything around the kidney. And just this one is nothing but the renal part of IVC, क्योंकि infra supra कर लिया ना, तो renal का क्या? So that is from the anastomosis. So this is where you most of the time get question in azygous comes from this. Okay, so ये हो गया हमारा embryology. So don't worry everybody, this was the toughest part. Now we just have few baby stuff and we will be finished. Okay, थोड़ा सा 5-10 मिनट हिम्मत रखो, we will be done. Fine. So CVS के derivatives कर लो. The outflow tract, the truncus arteriosus is gonna divide into 3 parts. So truncus arteriosus is going to be the 2 arteries. Okay, these are going to be the 2 arteries. So it gives rise to aorta, main pulmonary artery. These are divided by the spiral septum. So if spiral septum comes anteriorly, what is the congenital heart disease which will happen? You will have tetralogy of Fallot, right? Overriding of aorta is because of this. Then absent है ही नहीं, that is persistent truncus arteriosus. That's good, Naman. I am very happy that this is what you have written, that you are very confident about exam. I hope that is the case with all of you, because like after so long, I don't know how many of you are here who have joined BTR from the beginning, but those of you who have, we went through a series of bonus BTR, then we went through T&Ds, then we are doing this revision, we gave grand test. So it's almost like, you know, your exam is my exam, and if you don't do well, I am going to be as upset as you are going to be, you know. So it's like I'm very personally invested, and I have done everything in my ability to make, you know, you clear this exam. Not promoting, not doing anything ki BTR खरीदो, ऐसा कुछ intention नहीं है. The whole intent is just very pure, that I want you to do well and just get over it, है ना, just get over the exam. That is what I pray for all of you, कि इतनी मेहनत करी है अब हम सब ने. I just hope that it translates to result. Okay, I hope you guys also can just do a small prayer right now, that dear God, I have put in the effort, I have done my best, I'm going to give a good exam, I'm going to stay calm, but बस थोड़ा luck दे देना. Everybody needs that one sprinkle of luck, right? That is very important. चाहे कितना भी बोल लो कि पढ़ाई बहुत इंपॉर्टेंट है, एमसीक्यू सॉल्विंग बहुत इंपॉर्टेंट है, me as rank 1, I can admit it to you right now that if I was not lucky, I would have not gotten rank 1. So luck is very important to get a rank. So we pray. luck कैसे मिलेगा? एक तो आपके कर्म हो सकते हैं, if you have done good deeds, maybe you have good luck, or you can pray for it. So right now only you can pray for some luck, and hopefully, you know, we will I will meet a lot of you soon after, you know, your result, and I will get to take your interview and meet you. Irrespective of result, I hope I get to meet you all someday. Anyways, coming back, so emotional movement. So we have anterior, we have absent. When the spiral septum does not spiral, then we will have two arteries, no, where RV gives rise to aorta, LV gives rise to pulmonary artery. So this is where you have transposition of great arteries. Okay, so that is what is important. ठीक है, so ये है truncus arteriosus. चलो अब जाते हैं into conus. There is one more part which is conus between truncus and bulbus. This is what is giving rise to the outflow tract. So outflow tract is coming here. RVOT, LVOT. Okay, bulbus cordis is what is the trabeculated part of RV only. This is where you may get trapped, guys. ये बहुत important है. Only RV, because primitive ventricle giving rise to trabeculated part of left ventricle. Okay, trabeculated part of left ventricle. Atrium दोनों का ही, RA, LA, trabeculated part, it is giving rise to. Okay, thank you so much for so much love. Again, I will say it later on also, but always very grateful for the love which I have gotten. Almost neutralizes, almost like over neutralizes anything negative which people say, no, is neutralized by the love that you give. Thank you so much. So we have sinus venosus, which has right horn and which has left horn. So body and right horn hai and left horn hai. Body और right horn क्या बना रहा है? It's making the smooth part of right atrium, and the left horn is making the coronary sinus. Okay, so now we have trabeculae, we have smooth RA. क्या बच गया? LA smooth. So this primitive pulmonary vein is on the left side, so that will make the smooth part of LA. बच गई common cardinal vein, will make the SVC. Okay, so this is what is the embryology of heart. This is very, very important. All right, chalo, very quickly now let's identify now just few niche topics I have. This will be very cute. Okay, ab zyada stress nahi hai, very quickly we will finish, don't worry now. So what we have here are the electron microscopy appearance of lung. This is type 1 pneumocyte, alveoli, right? Alveoli is going to be type 1, it is going to be clear. Okay, thank you. Then we have type 2 pneumocyte. So you see this one, EP2 jahan likha hai, this is your type 2 pneumocyte. So this is what they had labeled and asked ki batao hyaline membrane disease mein, ARDS mein, which is the cell which is not working. So it is type 2, which is supposed to make surfactant, right? And this is your endothelium, जहाँ पे gas exchange will happen. So your gas exchange is gonna happen here from alveolus to endothelium, and ये छोटू सा कचरा is macrophage because it's eating debris. Okay, so this is about lung electron microscopy. Then we look at different glands. They've asked you to identify sebaceous. So sebaceous is holocrine. Holocrine meaning complete cell is disintegrated. Complete cell is disintegrated while the secretion releases. Then you have submandibular and mammary. So submandibular is an example of merocrine, and mammary is an example of apocrine, where only the apex gets pinched off. Merocrine में कुछ भी pinch off नहीं होगा. It's secretory vesicles. That's why you see the cells are so pink, because there are secretory vesicles. Whereas mammary, you will see center being empty because the apex is getting pinched off. Whereas holocrine पूरा cell मर के secretion दे रहा है. Okay, very important. Then very important is this part. What is the labeled part is fornix. Fornix originates from, so you will remember H&M. You know store brand H&M. Type 1 is this, no, the clear part. This is the clear alveoli filled with air. ठीक है, चलो वापस आते हैं H&M. So hippocampus से origin करेगा, fornix will go into mammillary body. So you can see how it's originating from hippocampus, shaped like a seahorse. So this is hippocampus, fornix, and this is mammillary body. All right, so this is H&M. Then what you have to remember, what are the other parts of Papez circuit? What are other parts of Papez circuit? Then what you have to remember is we have anterior thalamic nucleus. Okay, so we have anterior thalamic nucleus and we have cingulate gyrus. Okay, so you will go for window shopping to H&M alone, right? Alone जाओगे, single जाओगे, and anterior thalamus. Okay, आगे से window shopping करेंगे. So this is what you need to remember. These are all components of Papez circuit. ठीक है? Then what you have to remember is this. What is this part here? What is this swelling here? It's known as facial colliculus. Okay, so facial colliculus, what you need to remember, you have the sixth cranial nucleus. Okay, this is the sixth nucleus, and you have the seventh cranial nerve. So what they ask you is kiska UMN lesion hoga? UMN lesion of sixth, so LR6. Whereas if you have LMN lesion, it will be seventh cranial nerve, where they ask you risorius. Okay, or any facial muscle basically for that matter. So this is very important, facial colliculus. फिर आपको पढ़ना है ये. Thank you so much. Then what you have to remember is this, which is the jugular foramen. So you have a jugular spine which divides it into pars nervosa, pars vascularis. They have asked कौन अकेले खेलता है? Who is the one which is living alone? So what you have in pars nervosa is one inferior petrosal sinus. Let me just draw it inside only so that you remember. What you have here is inferior petrosal sinus, okay, which is a vascular structure, and you have cranial nerve 9 having its own sheath. ठीक है, so this is the one which lives alone. पीछे हमारे पास 10 और 11th cranial nerve है, रोमन नंबर यूज ही नहीं करना. 10th and 11th cranial nerve है which has a common sheath, and then you have your IJV. Okay, because jugular foramen, obviously IJV is there, and behind what you have is your sigmoid sinus. So this is where you have sigmoid sinus. So sigmoid sinus continues as internal jugular vein. As we go down, even inferior petrosal sinus continues into IJV. This is what you will remember. So how they can ask you, very important, jugular foramen. 9th अगर जाएगा तो क्या होगा? Gag reflex जाएगा, right? So remember the presence of gag reflex. If they tell you gag reflex is gone, they are talking about 9th cranial nerve. The second thing that they can give you, that the touch, the taste of what part of tongue? Posterior 1/3 of tongue will go if 9th cranial nerve goes. 10th cranial nerve जाएगी तो क्या बोलेंगे? They will tell you cuff reflex is gone, right? Cuff reflex is gone. They will tell you ipsilateral uvula deviation will happen. And 11th तो पता ही है, trapezius and sternocleidomastoid will go. ठीक है? This is what you have to remember here. Jugular spine, if it's eroded, very good. One of you saying Phelps sign, perfect. So Phelps sign is a sign of glomus jugulaire, where the spine is not worth, is eroded, right? So this is very, very important point that I have told you right now. Multiple 5-6 questions have come from here. So you know rule of 17 also, 10 and 7, ipsilateral deviation, and 5 and 12, sorry, 10 and 5 and 12 ipsilateral deviation, है ना? And this is contralateral deviation. Fine, this is what you have to remember here. So this uvula, my bad, is going to be contralateral. Yeah, it is C, not I. Okay, contralateral deviation. Okay, okay, yeah, you guys are correct. ठीक है, तो ये हो गया हमारा jugular foramen. Very, very important. Okay, now let's go to the arrangement of lung hilum. This is again extremely important. Repeat question है. Anterior to posterior is what they asked. What you'll remember is VAB. ठीक है, so we have pulmonary vein, we have artery, and we have bronchus. So VAB from anterior to posterior. Then they can also ask you superior to inferior. So superior, you remember which hilum is higher? Left is higher because it has pulmonary artery as the highest, and it is the main contributor of the hilum, artery. ठीक है, so this is the pulmonary artery on the left side. Then you have bronchus, then you have veins. Here you have bronchus, which is highest. That's why left lung hilum is higher. ठीक है, so ऐसे हमारा lung hilum arrangement हो जाएगा. Then let's talk about this. What is the foramen? Tell me the nerve which passes through this foramen. That is my question to you. So this foramen here, you have the passage of inferior mandibular foramen. You have the passage of inferior alveolar nerve, which emerges from the midline as mental nerve from the mental foramen. Okay. अब आता है V3 पे सवाल. From the trigeminal nerve, mandibular nerve, what are the nerve branches? Remember, posterior segment has 3 branches, early branches. Very, very important. 3 motor branches. Auriculotemporal. What you have to remember, motor and sensory, both. So auriculotemporal, what you will remember, this is sensory to the face. Yesterday in ear I had taught you, and this supplies parotid, secretion to the parotid. Lingual nerve, you all know, sensation of anterior 1/3 of the tongue. Taste of anterior 1/3 is chorda tympani. वो भी देखो उसके साथ ही चल रही है. And then inferior alveolar, we have already seen. What does it supply? Extremely important. It supplies the mylohyoid, and it supplies the anterior belly of digastric. Okay, if it's feeling as blurred, I think in the main video it will probably be okay. YouTube में थोड़ा सा शायद blur हो गया है. So mylohyoid, anterior belly of digastric. So this will also help you remember all of the muscles supplied by first arch, all masticator muscles by V3, and you have these two, mylohyoid, anterior belly, and these are supplied by inferior alveolar. So this is posterior. Anterior branches जो होती है ना, before we go to anterior, the main one, the main trunk supplies medial pterygoid. So this is the exception. All masticator muscles supplied by trigeminal except medial pterygoid, which is supplied by the main trunk. Okay, understood this? So this is supplied by the main trunk. Then what you have to remember is, the trunk also supplies the tensor tympani and tensor palatini. So these are 3 muscles supplied by the trunk. So this will help you remember all your first arch derivatives. ठीक है? And finally, the other anterior nerves are going to be your motor nerves. These are all of your motor muscle nerves except buccal nerve, which is a sensory nerve which pierces buccinator. So this is what they ask you, the nerve which pierces buccinator but doesn't supply it. It's a sensory nerve. So your anterior divisions are all motor nerves except buccal. Your posterior divisions are all sensory except inferior alveolar, which is motor. This is the toughest that you can get a question from trigeminal, because anterior posterior खेल रहे हैं. अली याद किया है, सिल याद करो. सिल is the posterior division of iliac artery. साथ साथ हो जाएगा. If I remember this, I don't need to remember anterior division, right? So superior gluteal, iliolumbar, lateral sacral. Boundaries of epiploic, you all know: superiorly caudate, inferiorly D1, posteriorly IVC, D12, and right adrenal, and anteriorly you have the free margin of momentum, which has the triad. So this is what you are going to compress for Pringle's maneuver, right? So this is Pringle maneuver. You press in the epiploic foramen. 4 types of histopath images of papillae: pointed, filiform. Foliate, rule that out. Fungiform is oval. It has a U. It is shaped like a U. And this is your big circumvallate. So molar tooth जैसा लगेगा. Okay, so molar tooth, fungus का U, pointed filiform, बच गया वो foliate. They had asked circumvallate in one of the exams. ठीक है. Now, going on to this, recognize this foramen. This is foramen rotundum, through which V3 passes. I'm showing you a coronal view of the greater wing of sphenoid. This is greater wing. And this one here is the Vidian canal. Vidian canal is inferomedial to the foramen rotundum. Okay, so this is foramen rotundum, not V3, V2. Okay, so maxillary nerve. Now, going on to this point here. So this is the pterion. टीरियन पे बहुत सवाल आए हैं. 4 bones meet here. What are the 4 bones that are meeting at the terion? You have the frontal bone, you have the parietal bone, you have the temporal bone, and you have the sphenoid bone. In the option they had written maxilla. So maxillary bone is not a part which is meeting at the terion. Second thing that you want to remember here, one of you is asking mattocks and cattle brush. The only thing you want to remember is mattocks is on the left side, right? So what they have given is कि aorta के लिए हम cattle brush करेंगे right side. No, aorta is on the left side. So we will do mattocks for visualization of the aorta, cattle brush for right side for visualization of IVC. ठीक है? शायद surgery में पढ़ाऊंगी. There is a PYQ on that. I will teach you in surgery. चलो वापस आते हैं. टीरियन पे क्या है? एंटीरियर डिविजन ऑफ मिडल मेनिंजियल आर्टरी. दिस इज व्हाट ब्रेक्स व्हेन यू हैव अ टीरियोनल फ्रैक्चर. व्हिच बोन इज बिलो इट? लेसर विंग ऑफ स्फिनॉइड. ठीक है, इतना कर लिया तो बहुत है आई थिंक टीरियन पे. फाइन. सो दिस इज अबाउट टीरियन. देन corpus callosum, internal capsule, very important. First of all, internal capsule has what fibers? Projection, association, or callosal. These have projection fibers, right? So these are projection fibers. Projection fiber का meaning होता है which are taking from up to down, है ना? जैसे जो भी spine में लेके जा रहे हैं, corticospinal and all are projection fibers. So anterior limb has anterior thalamic radiation. Then you have the corticospinal tracts in the genu and posterior limb. So genu, posterior limb, face, arm, thorax, lower limb. This is how they are arranged, corticospinal. Then I have optic radiation and auditory radiation. Optic radiation, remember retro, look, and sub. So when we start the class, do I ask you, क्या सबको सुनाई दे रहा है? So you will remember that sub lentiform is auditory, retro lentiform is retro look, है ना? Retro look होता है is to look. So this is how you will remember this. Now vascular supply gets you question. Anterior है तो ACA. Oh, sorry, something just fell. So ACA is anterior thalamic and the artery here is Hubner's artery. ठीक है? तो ये है Hubner artery, एक branch of ACA. Then you have genu and posterior limb. Genu and posterior limb is when you have MCA. ACA हो गया. So this is going to be MCA and this is Charcot's artery. Charcot's artery. Finally, sublentiform, retrolentiform supplied by PCA. So ACA, MCA, PCA. This is how you will remember. And both of these have something common, which is the internal choroidal artery. Internal choroidal direct branch of ICA. ठीक है? या बस थोड़ा सा है, 10 मिनट और पढ़ लो, 5 मिनट और पढ़ लो, we will be done. Okay, 5 more minutes it will be done. चलो फटाफट. और नैट ऐसे ही है, क्या करे. Now This is extremely important from brachial plexus. Anterior, posterior पता होना चाहिए. So this is scalenus anterior, this is scalenus medius. What is there in interscalene triangle? I can see the roots and I can see the subclavian artery. So interscalene triangle is subclavian artery and the roots. Everything else is anterior. So I have the phrenic nerve. We have what else is present anterior? We have the subclavian vein. All right. So just remember these two. And then there are two branches, transverse cervical, suprascapular of subclavian, which are anterior. तो टेक्निकली इसमें ये भी पता होना चाहिए किस फेशिया के आगे क्या है, बट इतना याद रख लोगे तो बहुत है. एक्सिलरी शीथ इज अ कंटिन्यूएशन ऑफ प्री वर्टिब्रल फेशिया. ओके, इट्स अ कंटिन्यूएशन ऑफ प्री वर्टिब्रल फेशिया. ठीक है, थोड़ा तेज बोल लो से क्या होगा, समझ ही नहीं आएगा तो बोल के क्या फायदा है ना. तो अभी सुन लो, यहां तक आए हैं, डोंट गिव इट अप एट दिस स्टेज. ओके, यू नो व्हाट इज सीक्रेट ऑफ गेटिंग रैंक 1? सीक्रेट ऑफ गेटिंग रैंक 1 इज इफ यू आर डन कि अब हमसे नहीं हो पाएगा, गिव इट 5 more minutes, है ना. 5 more minutes और पढ़ लो आफ्टर यू आर कंप्लीटली डन. रोज रोज ऐसे करोगे ना, इमेजिन हाउ मेनी मोर मिनट्स यू वुड स्टडी इन योर लाइफ टाइम. लाइफ टाइम नहीं पढ़ना, बट हाउ मेनी मोर मिनट्स यू विल स्टडी इन 2 to 3 months. लॉट्स, राइट. सो अभी हमारा टाइम है टू गेट रैंक. दैट इज द टेस्ट कि भाई किसका रैंक आने वाला है, किसका, किसने गिव अप करके बोला यार अभी बस बहुत पढ़ लिया ना, नाउ आई हैव टू गो आउट एंड पार्टी, आज तो पार्टी करेंगे. नो, इफ यू स्टडी फॉर 5 more minutes, रैंक विल कम. ओके, चलो फटाफट. masticator muscles, very very important. Who is the main elevator of mandible? It is temporalis. Remember, temporalis is the only one which is a retractor. So but its main function is elevator. ठीक है. Then tell me which is the one getting supply from main trunk? Medial pterygoid. बच गए दो. Arises from zygomatic arch, inserts on the angle of mandible. That is your masseter muscle, and this is also a repeat question. Infratemporal surface of the greater wing से origin कर रहा है lateral pterygoid. Function of lateral pterygoid is lowers. This is the only depressor. So बाकियों का function क्या है? They are all elevators. Main elevator is temporalis. Temporalis retracts. बाकी सबका function है protractor. Okay, so what will you remember? Lateral pterygoid lowers, temporalis retracts. ठीक है. So अब match the following कर लो. ये muscle है temporalis, ये है masseter, this is lateral pterygoid, medial pterygoid. Remember lateral will be ऊपर. तो आंसर क्या बनेगा बच्चों? 1A. Okay, let's just distinguish. Then what is B? Masseter. Masseter is B4. Then we have C, lateral pterygoid is 2. So answer becomes B. ठीक है, बहुत important. चलो फटाफट 1 liner. अब कुछ नहीं है, सिर्फ आंसर. Which following distinguishes pancreas from parotid? It's the absence of a striated duct. Everything else is similar. Both are serous glands, just duct. Talocalcaneonavicular is ball and socket. Calcaneocuboidal is saddle. Relate this also with incudostapedial is ball and socket, INS is ball and socket, and malioincudalis calcane is saddle joint. Okay, so this is how both of these parts you relate, ear and ankle. ठीक है. Pretracheal layer does not enclose sternocleido. Sternocleidomastoid अलग से है. Nerve vascular bundle is absent in the posterior superficial compartment. All are true about gray rami except preganglionic. These are also postganglionic. Cremasteric, all of you know, is L1, L2, L3, L4 is patellar, S1, S2 is ankle. ठीक है. Then we go to all take part in wrist joint formation except distal end of ulna, which drains into brachiocephalic. Very important question. Left superior intercostal drains into brachiocephalic. Mark the structures of the cubital fossa. You know MBTR. So this is median nerve. Then you have brachial artery, MB, T for tendon. This is biceps tendon, which is cut. Then you have this 5, which is the radial nerve. ठीक है, 4 कुछ नहीं है. So this is MBTR. So structure name 5, radial nerve जाएगी wrist drop. This is just branch, I think, branch of radial nerve, cutaneous branch होगी radial nerve की. ठीक है, not important. So this is about wrist drop. ठीक है, my phone battery is also going to be dead any moment. Chalo. Then we have this very important trapper. This is a wonderful question because they most of you will mark foramen transversarium here, है ना? So it's not foramen transversarium. That's the second part of vertebral artery. The third part is gonna cross where? It's gonna go from two posterior arch से जाएगी. So it is gonna be two, which is very very important. ठीक है? All of the following form the mark structure. So this is the dorsal digital expansion. Tell me, palmar interossei adducts, pad. Does the middle finger need to adduct? No. So palmar interossei is not there only. This we have studied in ortho BTR, right? It's not there only in middle finger. Tell me, palmar interossei is unipennate or bipennate? We always say pad, dab. So this is uni. Dorsal is bipinnate, right? Dab, dorsal abduction. Both of them supplied by ulnar nerve. ठीक है, lumbricals medial वाले by ulnar, lateral वाले by median nerve. First two lumbricals unipennate, third fourth lumbricals bipinnate. ठीक है, चलो इसमें कौन pelvic diaphragm है? Obviously A is your levator ni. All right, this is your sphincter, this is obturator. C is obturator muscle and D कुछ नहीं है, it's just a fascia there. Okay, so A is levator ni. Finally incorrect match. So one indeed is cilia, 2 is goblet cells, 3 is nuclei of epithelial cells, 4th is not lamina propria. Lamina propria is lower down. Third, I mean the fourth part here is the basement membrane. Okay, so that's the basement membrane. So B becomes wrong answer. Last question, arrange from medial to lateral. So cranial nerve columns. Do you all know save Virginia, save vas? I'm not going to revise that. Just remember that from medial to lateral, we have GWA, then we have SWA, then we have GSA and SSA. Save Virginia, save VAS, but this save Virginia, save VAS will tell you all of the parts, but it will not tell you medial to lateral arrangement. ये हमें somehow याद करना पड़ेगा. पहले GWA है, फिर SWA है, फिर GS है, फिर SS है. Okay, so the answer becomes B here. What I also want to tell you is afference and efference. So remember DAS. So dorsal is going to be the alar plate, which is sensory. All of your A's are dorsal and everything else. So ventral is your basal plate, which is motor. ठीक है? This is what you have to remember, and this marks the end of mammoth revision of the 5 biggest subjects. I hope this was useful to all of you, and I have tried my best to summarize. Now I have to prepare tomorrow's class, and I have less than 12 hours to do that. No, I have more than 12 hours, but I have to sleep also. So yeah, I will manage somehow, and I'll see you all tomorrow 3 o'clock. Kalka, I will let you know about where it will be, whether YouTube or app. Most likely it will be in the app for subscribers only. ठीक है? But you can get subscription and join. Okay, just saying, it will be useful for NEET also. I think by now I have proved that I am good. I don't know if that was needed, but I hope that helps for people who were new. But I think most of the guys who have still stuck around after 5 years are people who are already subscribers. So please stop with the FOMO कि अरे बाहर वाले देख लेंगे. ऐसा कुछ नहीं है यार, है ना? Ultimately जिसका rank आना है वो rank आएगा because you have worked hard, you have prayed for good luck, and you have done good deeds in your life. So if you meet all criteria, you will get rank. है ना? ये subscription वो subscription will not get rank. That is what I am telling you as a student myself. I may be a teacher, but I am your senior first, right? And I am your friend. So I just want to tell you, just focus on your karma, which is to work hard, and other external factors will take care of themselves. Having said that, let's see what happens tomorrow. So thank you so much. I will see if Zara comes. अभी end मत कर देना live stream. I'll just bring Zara and come. Okay, wait. Zala baby दिखाऊंगी. But to see Zala baby. Whoa. Let's see. Zara दिखाऊंगी. Wait. ये देखो. पर इस पे तो कुछ आ ही नहीं रहा. ये Zala baby seen. दिख रही है Zara baby. Hi Zala. पहले Zala baby देखो. Can you say hi friends? Hi friends बोलो. Hi friends. Say hi friends. My name is. What is your name? Jala. Can you give high five? High five everyone. Say all the best. Thumb कैसे है? Where is your thumb? Okay, give high finger. Say all the best. Show one finger of yours. We can't show thumb. वो skills हमारे में नहीं है. Motor skills we don't have बेटा. ऐसे करो. ये thumbs up होता है. All the best. All the best everyone. Okay, bye बोल दो. Bye. I am going to play with mama. बाय कर दो. बाय फ्रेंड्स. यहाँ पे है फ्रेंड्स. देखो हार्ट्स भेज रहे हैं. Want to see hearts? See heart. Heart. Okay. Say bye. Bye. Do you want to sing? Do you want to sing song? Can you sing? नानी नानी तेरी मोनी गाओगे? हाँ? Do you want to sing? No, you don't want to sing. You are shy. Okay. Say bye. Bye. Good night. Good night कर दो. Good night. Flying किसी दोगे? Okay, very good. Bye. Thank you, guys. Hope that refreshes all of you. So study and revise now. All the best. Thank you. Bye, baby. Bye, baby. Cute.